Tyson, can you hear us? Oh, Brian, can you hear us? Okay, I think he got kicked out. Okay, he's requesting again. Let me get him on. And we also have, guys, pardon me a little bit. This is my first time of hosting a space, so if I'm a little choppy here, it's pardon me a little bit. Add a speaker. Okay, good. You on, Brian?
I'm on now. Yeah, the last time it muted everything. I couldn't hear anything.
Okay.
But yeah, I'm here now.
Can you hear us?
Yep,
Okay,
I'm good
good.
now.
Yes. Tell us a little bit about what you do and, and okay, good. Melissa Tate is here. She's gonna probably as a host, she's gonna help to moderate what we're doing. Go ahead, Brian.
For me, I'm a family physician, but family practice trained, but ER physician and urgent care physician for many years. I own my own practice out here in El Centro and Brawley now. I have 2 urgent cares with 2 more coming, and I've had a wide variety of experience, 13 years at a level 2 trauma center, Arrowhead Regional Medical Center is where I was at, did hospital work as a hospitalist for about 16 years, did ICU care, anywhere from St. Bernardine's to San Gorgonio to Redlands, Desert Regional. So I've been all over as a physician, opened my own practice, and the urgent care it's been 5 years now, out here in El Centro, which is a border city. We're a rural community halfway between San Diego and Yuma. To kind of give you guys some geography, it's basically in the middle of nowhere, in the middle of the desert. We have one of the largest agricultural areas, though, in Southern California. So we have a large ag community out here, and we have a large migrant population out here. Imperial County is literally the poorest county in the United States, so not a whole lot of resources either. And when COVID hit in 2020, we knew it was going to be problematic because we don't have a regional center out here. We only have 2 local hospitals, both rural hospitals, and San Diego being 89 miles away, and Palm Desert, Desert Regional, and Eisenhower being about 70 miles away, makes it tough for people who are sick to get treatment at larger medical centers. So we put our big boy pants on and we started treating COVID patients in person. We never just went to the straight telemedicine route. We started with basically a triage center out in the parking lot, built that into basically a mobile clinic. We treated everybody that entered our facility or showed up at our doors, anywhere from 2 months old all the way to 102 years old. And we've now treated over 20,000 patients successfully for COVID-19. We have a success rate of 99.9997%. We've only lost 4 patients to COVID-19, and all 4 of those started treatment after day 7. We wrote a book, me and Dr. Fareed, called Overcoming the COVID Darkness, how 2 doctors treated over 7,000 patients. Our analytics for a paper that we tried to get published is in that book, because we couldn't get a journal to publish it, because they basically didn't really want to know about early treatment. I broke early treatment success at KUSI News in San Diego, which immediately received a lot of publicity, and then it hit Facebook and YouTube, and it got censored and shut down. I was part of the American Frontline Doctors second summit with Stella and Urso and the crew, and we did a big summit there. I had my speech, told everybody, we've got treatment, early treatment works. And again, that went viral just to get shut down. So we've been fighting the censorship for this whole time, and that's basically who I am.
Okay, thank you. I had to let you speak so I can get other people on. Well, I'm Dr. Stella Immanuel, and a lot of people know me from a very, very public splat in 2020, July 2020, when we spoke at the steps of the Supreme Court saying COVID was treatable. And to give you a little background on me, I went to medical school in Nigeria, where I trained as a general practitioner. I came to America, got the first residency that I could get, which was in pediatrics. So I did a residency in pediatrics and moved to Louisiana, opened a practice. And while I practiced as a pediatrician, I continued to work in the ER on and off. And somewhere about a few years ago, I actually just stopped working as a pediatrician, just worked in the emergency room. So that kind of prepared me to be in a position to do the work that I was called to do. And so in 2005, I can move to Houston, and 2019, after I got my Texas license, I opened a practice in Houston. This was like in September. A doctor that had just passed away, that had 15 to 20% of his patients from China. He was a Japanese doctor. So we had a lot of Asian patients. He passed away, and we bought his practice. So because of that, I was now put in a position where COVID showed up in the early 2020, and I had to deal with COVID. Why did I have to deal with COVID? Because we had patients that were basically from China and from Japan and from everything, and we had to deal with it. So initially it was scary for all of us. We were wearing all the Tyvek suits and the mask and everything. I ordered a bunch of N95 masks way early, like in February and early March. When the thing really hit and they could not have masks, we were shipping masks to doctors all over the country. People were spraying them and reusing them. That is the atmosphere we're in. So a pharmacy friend of mine told me that they were using hydroxychloroquine in Europe. So I went digging and I found an article that was done under Anthony Fauci, the NIH, in 2005. And you can go Google this. It said chloroquine was a potent inhibitor of SARS-CoV-1. It was easy for me to jump in to start using hydroxychloroquine. In fact, in those early days, the government was hoarding hydroxychloroquine. So we started using mefloquine, which was also one of the quinolones, and we use the quinones. So we used mefloquine and it worked. As usual, I went online and I was excited. This is a pandemic. It's something new. We don't know what's going on, and I'm using this and it's working. So I went online. I was excited and telling other doctors, oh my God, this is exciting. It's working. And I got attacked. I got vilified. I got attacked. They were like, no, it doesn't work. We need a randomized double-blinded study. I said, no, in a pandemic, when things are so uncertain, we don't need a randomized double-blinded study. We're using something that's working. You're supposed to hear and try it. That is how physicians work, especially in situations like this, especially too, because the medications we're using is something that's been around for a long time. At the same time, President Trump had come out to say that hydroxychloroquine works. And so they attacked me. It was crazy. I was somehow attached to President Trump, regardless of what I vote. They vilified my medical practice and decided I was a Trump operative. And because of that, they attached me to Trump. Just me as the days went by. I've never met Trump. I've never spoken to Trump. I don't have any personal relationship with Trump. And it was crazy. So, and in that situation, we started just meeting online with people like Dr. Orso. He's on here today, and just comparing notes, which is what doctors do when there's something crazy happening that we don't have the full idea. We're comparing notes and we're just happy to treat patients. Initially, when I found Dr. Orso and he was in Houston, I called him. We talked for hours. We were scared. We were being threatened by boards. We were being threatened by other physicians to report us to the board. And it was a terrifying situation, but we just knew that we couldn't stop treating patients. Dr. Orso is an ophthalmologist. So you can imagine ophthalmologists rising up to treat patients because other doctors were not doing what they were supposed to do. So when I talked to him, the next day he tried to call me and he couldn't reach me. He was so scared that something had happened to me. So, and as usual, when you are doing something like that, it's just good to get really loud. So we went to DC and in the first summit, it was actually the second summit. And of course, by God's mercy, we went viral and the whole world kind of, I could say today that was a watershed moment. Prior to that, the whole of humanity was caged in this fear and we're all going to die. And So our voice at that time just came in as a voice of hope in a dark world. And from then to today, we've treated over 120,000 patients. At some point during Delta, we were seeing 700-800 patients a day, nationwide. We had about almost 40 physicians and nurse practitioners working for me. We were not sleeping, but we were there to take care of the American people. So it's been a really interesting journey. I was vilified. I was called names, and my religion was pulled up. I was turned to a quack and just all kinds of stuff. But I'm glad that we stood and we fought and we stood strong. And so this is where we've been. So I'm going to let Dr. also kind of speak, and then before we start going into the true protocols of medicine, Dr. also, you can unmute and say something.
Sure. So we're sitting here with the two most experienced doctors in COVID in the entire United States. So it's pretty awesome. Both Stella and Brian, like Stella said, a lot of what happened was a collaboration. We talked to each other, and these two have had so much experience that, like I said, a lot of what we know is probably the best formula right now. The McCullough protocol comes from Brian Tyson and Stella Immanuel. So it's like they've had a tremendous impact. For me, it was pretty easy to step in. I'd done drug design. I've been 11 years in the lab, invented an FDA-approved drug. I spent 6 years running a small ER, so I felt very comfortable in treating patients. And basically, I didn't want to treat patients. I work with my colleagues always. Like, if somebody has a pulmonology problem, I send my friend, the pulmonologist. But yet, I have a very strong conversation about, what I found and why I'm sending them. And so it's normal to kind of rely on your colleagues to kind of stay in their lane, more or less. But I've always done what I would consider to be functional medicine, in a sense. So they call it functional medicine now, but I've always thought the body's all connected. That's how I practice. I did nutrition for Major League Baseball, NBA, and Olympic teams as a formulator. So I've had a lot of experience in that. And then eventually, left the university system, built a huge practice, I think the biggest in the United States of its kind. And so, I've had a lot of good things happen. Thankfully, now what's happened over this last 3 years is we found our tribe of docs that are willing to go out and do the right thing and take care of patients. And that's who this is. That's who did the early treatment. We were scared. Stella said we were scared, but the scaredness was this, and I think this is really important. Brian Tyson, Stella Immanuel are looking people in the eye every day. Scared is they're dying. The patients are going to die. If you do nothing, they die. You're not going to be that scared. Individually, you came to help people. It's really easy to sit in an office and do data punching and say something doesn't work. If a patient dies in front of you on the ground, right? Let's say you don't say, let me check CPR, do a randomized controlled trial. You don't say, I'm going to find out if shocking the patient, let's do a randomized controlled trial. That's not how medicine works. This is a rapidly evolving process in a disease that occurs very, very quickly. All right. So you don't have time. Nobody ever does a randomized controlled trial in the middle of a disease that has rapid progression. Is never. I'm going to say never. A deadly disease doesn't ever, not a single one ever has a randomized controlled trial attached to it. Okay, that's never happened. So let me reiterate that. This whole randomized controlled trial in the face of a deadly disease doesn't happen. What they did was in their randomized controlled trials, they did, I forget the guy's name, Bardwell, I can't remember the guy's name, he's a loser from Minnesota. He put together wrong dose, wrong time, wrong patient, sent the drugs out late. Some of the people came in on the drugs, didn't separate it. Really bad data collection. If it looked like it was going to be positive, they cut the data short, basically only enrolled 500 patients. Brian Tyson put the ultimate study out there with thousands of patients showing that his patients, Stella has all the data that would basically the same thing, but his patients, published literature, 98% more, 90% better than the surrounding community. So in a sense, we could have saved 98% of the people, but we sort of round the number off somewhere between 85 and 90%, just to be fair. But bottom line is we've got some great people that are the best. David Boulware. So thank you, Molly James. Molly is also tremendously experienced. She just sent me David Boulware. I think it's worth just saying that name because he's been the key person in putting out fake studies for ivermectin and for hydroxychloroquine. They literally said, hey, we need a good fake study. Well, let's go find David Boulware. I mean, literally, that's who the guy is. I don't mind saying it. David, if you're listening, you're welcome. Sign up the lawyers. Come on. I'm ready for you. Anyway, that's what I have to say. And thank you for having me.
One more thing that I want to add here would like what Dr. also was saying about the fear of seeing patients in front of you that can't breathe. And initially we were terrified just as physicians and doctors because we didn't know the disease. But once we started treating patients, my staff, we knew that this thing was treatable. So we dropped all our Tyvek suits. Sometimes we wore the N95 mask to make the patients comfortable, but we dropped all our Tyvek suits and we were there to take care of patients. Most importantly, we were able to hug patients and tell them they'll be okay. Think about it. See yourself in my clinic sitting down and a patient walks in that is 75-year-old and is a diabetic and has high blood pressure. They are crying. They are scared. All they know is that they're going to die. And I tell them, don't worry, sit down. We can take care of you. You're not going to die. So we're going to be discussing our protocols, my protocols, and Brian, all of us will be bringing the protocols, simple things that we did to keep patients alive. Before we even go into the controversy of ivermectin and hydroxychloroquine, one of the things that Richard and I talks about all the time is that, number one, COVID, there are two kind of diseases in COVID. It's the viral infection and, of course, the cytokine storm or that comes in the later part of the disease. If the intervention was done early enough, you did not get to the cytokine storm. So what we did initially was to stop the disease, the viral disease. Even for people that did not believe in hydroxychloroquine and ivermectin, there was a thing that they did in the hospitals, in the urgent care, in the doctor offices, which was so anti-medicine that did not make any sense. COVID disease had the viral part. They had the inflammation, they had the respiratory part, they had the respiratory distress, they had the people had anosmia, which is they couldn't eat because they lost their sense of smell and the dehydration. We found out that most patients that walked into our clinic, if we gave them fluids, rehydrate them, gave them a breathing treatment, gave them and just gave them vitamin B complex shot to just give them energy. That alone got most of the patients where we gave them budesonide. We used to put in budesonide and mix it with Zoponex to just give them a break. So these were little things that we did, which any doctor could have done. People stopped giving breathing treatments because they did not want to aerolize the COVID into the atmosphere, but you could have given the people the breathing treatment and given them a machine to take to their home. So there were simple things that every physician does with the flu or with RSV or with any other virus that is supposed to be. There were simple things that we could have done, that doctors could have done to just manage COVID in a way that could have kept a lot of people alive before even any antivirus that we used. And Dr. Osa, I want you to talk a little bit about that too.
Well, I'm going to let Brian talk about it too, but basically, historically, we can't cure diseases all the time. So a lot of our strategies are based upon mitigation. And I always kind of go to hypertension. We don't cure hypertension. We mitigate the potential damage to the stroke by taking a medicine every day. So it was very simple early on when I was looking at this back in February to think about the blood clotting and mitigate the potential blood clotting with something, mitigate the inflammation with something, steroids, other drugs, hydroxychloroquine, ivermectin are both very good anti-inflammatories, by the way. But many drugs can fill that role. And then the respiratory compromise, basically, if you can't breathe, there's lots of asthma meds and they work for this disease too. So mitigation strategies are number one. But even back in early March, the first look I had, I found cyclosporin, fenofibrate, protease inhibitors, nucleoside analogs, hydroxychloroquine, chloroquine, ivermectin. Singular might have been helpful. I think it was like 9 drugs that I had. I mentioned fenofibrate. I think 9 drugs. and that could actually be used to potentially attack the virus early on based on literature reviews. So when somebody says, hey, we tried something, it's not willy-nilly. It's based on potential mechanisms of disease where you see it might interfere with the virus. So you break things down, you treat what you see, and that's what we did. So, Brian, I know you talk a lot about this, so please go ahead.
Yeah, thanks, Richard. And I think for everybody, I think the biggest takeaway from all of this was the hands-on approach was neglected by the physicians for everyone, basically, with COVID-19. I talk about taking care of patients and doing and treating what you see. So being able to see a patient in front of you, you see that they can't breathe. So you check your oxygen level. Do they need oxygen? A lot of the patients, like Richard said, were presenting with asthma-like symptoms, chest pain, shortness of breath. It hurt to breathe. So we gave them the asthma treatment. We gave them an injection of steroids, either Decadron or Solumedrol. We gave them breathing treatments with albuterol, atropine, and budesonide. We saw, and I think we were one of the only ones who were doing chest x-rays initially, because I really wanted to see what the x-ray pattern looked like, especially as we got later on in the disease. And we started seeing the COVID pneumonia. So we started treating with antibiotics, Zithromax and doxycycline. We knew that there was an inflammatory component. So we used anti-inflammatories. We started out with hydroxychloroquine. The chloroquine study was already out there from 2005. That chloroquine was a potent inhibitor of the SARS coronavirus and its spread. That was the basis of all of our SARS anti-inflammatory treatment. But I also used a lot of colchicine because, again, that had a lot of anti-inflammatory. I used Singulair, and we used Pepcid. There was a lot of GI issues, but also Pepcid's an H2 blocker, a histamine blocker, which, again, trying to prevent the cytokine storm that we were seeing and hearing about. And then we were seeing a lot of blood clotting. And I think right now the blood clotting seems to be the main pathogen in the pathophysiology that's leading to a lot of the disease and deaths. And I really want to take note of that. But we were using full dose aspirin and apixaban or Eliquis with our high risk patients, and that seemed to generate enough of a response that all of our patients seemed to do extremely well one way or another. I had my patients always come back 3 days later to see how they were doing, and if they needed another round of treatment, did they need more steroids, did they need me to add something to their treatment, and then I would see them at day 5 and day 10. So there was a follow-up protocol that we were using as well. And if I felt on day 5 that they weren't quite over the disease illness as much as I'd like them to be, I would give them a whole nother round of treatment. And so they would get 10 days of treatment as opposed to just 5. It's kind of like what we do in everyday life in medicine. If you have a cut on your arm that gets infected and you give antibiotics, you're going to want to see that patient back and make sure that they're responding to that antibiotic. If the wound's not quite healed and it's not quite better, you're going to give them another course or another few days to make sure that they get through it. There was none of that going on. And the first time in my life as a physician, and I'm over 20 years now, were we being told not to treat a disease process, an infectious disease process, early in the stage of the disease. And it never made sense to me. And I think everybody needs to hear that. Because if you have appendicitis, you're not going to wait till your appendix ruptures before you go get treatment. If you have cancer, you're not going to wait until it's stage 4 until you go treat it. If you've got, a gallbladder, acute cholecystitis, and your gallbladder's all inflamed, you're not going to wait until you're so sick that you need to be put on a ventilator in the ICU to get it treated. there's no difference in a viral illness that is causing respiratory failure to wait until you're in respiratory failure to treat the disease. So a lot of us who are early treatment experts and a lot of us who started treating COVID just didn't buy into the fact that, oh, there's no treatment, just wait until you can't breathe and then go to the hospital and let the ERs take care of you. That's nonsense. We've never done that before. We've treated really bad viral infections from human metapneumovirus to H1N1 to bird flu to you name it. There was a SARS coronavirus when it was around in 2003. There's always been respiratory viruses in kids with RSV, parainfluenza that we've had to deal with that there are no treatments for. But there is symptomatic treatments. There is, Dr. Immanuel was saying, if you're dehydrated, you can give them fluid, and guess what? These patients are going to get better. Why are we just telling them to go home for 10 days? Never made any sense to me.
Yeah, and that actually did not just make sense for physicians, but it also brought about the fear, because you can imagine there were people telling somebody go back home with a disease, which the media is going on and on and on about how you're gonna die, and then they just tell people to go back home. So this did not just. I mean, it was unconscionable. It was just not the way we practice medicine. And Dr. Molly, you're on. Molly worked a lot in the hospitals, and I want her to tell us a little bit about her experience working in the hospitals, and then we're going to actually dive deep into what we actually are the different protocols that we used. Go ahead, Molly.
Yeah. So one of the things very early on, I was in New York in, April 2020, just after the peak of the pandemic there, first one. They were using hydroxychloroquine. They were using high dose hydroxychloroquine. And we were using the vitamin C, zinc. I think they were using vitamin D then, and then antibiotics. People were in fulminant cytokine storm. We didn't know it then, right? Because we didn't have the phases. We didn't know what we knew in hindsight. But the professional organizations, when they came down on should you do this or that, really they said not enough evidence either way on most things, except they said don't give steroids. So, in the trenches, we thought that giving steroids up front was going to be detrimental because it's an active viral infection, right? So there was an evolution of what we did in the ICU. And then if you remember, in like late spring, early summer, we started seeing studies come out that said that the falsified study in the Lancet that said this is causing cardiac arrest. Well, anybody that was in the ICU with these really terrible, ARDS patients, we were seeing cardiac arrest. And so we knew it wasn't helping. It maybe was hurting. So we pulled it and we stopped using it. And this, people need to understand event is not event is not event. Everybody I had in the ICU was on 100% oxygen, super high pressures. Like this is the worst lung injury on the spectrum, and everybody had it. So it wasn't until late summer that we started getting autopsies back, because remember, we weren't doing those at first. And they said, there's microclotting. So we started adding blood thinners, but we didn't know how much blood thinner to add. Is it, the prophylactic? Is it the full dose? Is it somewhere in between? And then we started hearing we need to add steroids. But again, we were undertreating with steroids, right? Because people were dying of an inflammatory condition. We were using 6 milligrams of dexamethasone twice a day. So things did evolve a little bit over time. But it didn't really make a dent in mortality really until this day. Through Alpha and through Delta, the hospital never figured out how to treat patients because they're letting people die of an inflammatory condition without maximizing the options for that treatment.
Hey, I want to tag on there, Molly, a little bit, because we brought up a couple good points. I think what you're hearing there, there's two things that are strike me. I worked in respiratory viruses, some, but I also did like tumor viruses, human papilloma viruses, and so early on, I was really never afraid because it's a respiratory virus. And for whatever reason, I know respiratory viruses are gone in 5 to 7 days. So once I knew they're at the point where they're in the hospital, I'm actually kind of shocked that this, that infectious disease people didn't talk about this and this didn't get transmitted. But once we had information from Italy in February, it was clear that it was a respiratory disease turned into an inflammatory disease and blood clotting. And I think the first time I had this conversation with some people that I considered high level, one of them Fauci and Birx. Okay, one of them was Birx. And I was shocked to think that she didn't know that respiratory viruses are dead after about 5 to 7 days. So to me, the very first patient I treated with was with steroids because he was like in day 8, and I said, okay, well, he's in the inflammatory phase. To me, the mechanisms of everything made really good sense right off the bat. So, and it's kind of surprising because the leadership in anybody who works with these kind of things in a lab would know this information, right? So, but maybe the docs in the ICU, they're not usually seeing this kind of process, and they were making it seem like these people were infected, and even infected like you couldn't even do the autopsies because they were still carrying live virus, like 30 or 40 days later, which is absurd, by the way. So there's one thing that sort of struck me as that's an information thing that if doctors are all communicating really well together and there's good leadership, that should have been like one of the prominent things to come out. Secondly, the blood clotting was clear that it was a major problem, and it was very confusing. I have to agree. The most confusing thing was to have a coronavirus have this major clotting, and I still first struggled with all the mechanisms that evolved in the clotting phase. But it was clear clotting was happening, and so I'll say, like, I immediately on the first patient, March 12th, I used an aspirin because I already knew about the clotting stuff. So it's kind of like almost shocking in some ways that because the confusion, the massive confusion, in a sense, the poor leadership, it led to a lot of sort of, in a sense, bad outcomes, but partly, bad analysis on most people's part. So when it's almost, to me, looking back on it, I almost still in shock thinking about how, if you ever worked in a viral lab, N95 and down doesn't work. R99, R100 and upper, that works. So, it's like I usually say, for people who did that work, it seems like it would be a no-brainer. But because there was nobody like trying to coordinate messaging, I mean, it was a mess in the beginning. And as Molly said, a lot of people were using the drugs. Down in the 3 major hospitals here, I had ability and because I was close to, formerly married to top anesthesiologist here, and I knew a lot of the people in critical care. They were friends, and we talked, and they were on committees with me, and so I was able to just kind of jibber jabber back and forth with them and see what they were doing, and they were using, like you said, hydroxychloroquine. The steroid thing was always something where we were saying, hey, you can't use 6 milligrams of Dex. I give 8 milligrams to dexamethasone to my patients every time I do a blepharoplasty. All right. So I'm telling you, like 6 milligrams of dexamethasone for a critically ill patient is absolutely nothing. I might, like in the past, I had done traumatic optic neuropathy cases, and we gave a 2-gram load of solumedrol, never mind 125 or 250 milligrams. So steroids were underutilized from the beginning in a big way. And it was a shame because if there had been true good leadership, that wouldn't happen. But those two things stand out. Thank you. Over.
Wait, let me say something about Molly. Let me say something before we get back to you. Listen, when it came to using steroids, I think I always say this, especially to people that are into a lot of academia and they don't really see patients. I always say, professor, get out of your book and look at the patient in front of you. One thing that was encouraging for me, I worked in the ER for years, and working in the ER, I knew we used to give steroids to patients that had the flu. The flu is an RNA virus, just like the RSV and just like a coronavirus. So for me, I did not have the fear, okay, it's an active viral process, it's not a herpes, sometimes we're worried about, giving maybe a herpes virus, giving steroids, and then it makes it worse. But in this situation, number one, we were able to give breathing treatments, which was one of the most important things, giving budesonide breathing treatments. And many people in the hospitals, they did not want doctor groups. Nobody wanted to give breathing treatments because they felt it was going to aerolize the COVID and infect everybody. At this point, my clinic and we were all on hydroxychloroquine, and we were taking hydroxychloroquine weekly, and I'm going to talk a little bit about why it was very important and wise to use hydroxychloroquine on a preventive level. So we were taking hydroxychloroquine weekly, and none of us had been sick. Patients were breathing on us, sneezing on us. They were coming. at some point, my clinic here in Houston, it was so crazy that people used to line up in front of my clinic as if they were at Black Friday. And people will come into the clinic. They didn't want to go to the hospital. We had people coming to our clinic with oxygen of 60, and we will give them a breathing treatment, bring up their oxygen, give them a dose of hydroxychloroquine, give them a dose of ivermectin, send them out to the hospitals. And just that one dose of hydroxychloroquine that they got protected them, because hydroxychloroquine stays in your system for like up to maybe 72 hours. So, because of this situation that we were pushed in, we had a walk-in clinic, and we almost became like an ER. People will come there very sick. Almost every day we'll be calling the ambulance to come and pick up people from the clinic. But we always made sure we gave them a dose of hydroxychloroquine, ivermectin, gave them a steroid, and immediately, especially if you gave them budesonide with like budesonide and Zoponex, we didn't give them albuterol because it will increase the heart rate, and they were already in a hypermetabolic state. So when we gave them budesonide and gave them Zoponex, it immediately opened their airway. It brought up their oxygen sometimes 20 points up. And one thing we found very interesting is that COVID patients were able to tolerate very low level of oxygen, which started making us think this might not be more of a respiratory thing. It might have something to do with the oxygenation, which was one of the things that was kind of, remember the hospitals used to say that COVID patients were like, they were very hypoxic, but they were happy. You see somebody with an oxygen of 75 or 85 and they're just playing on their phone. So we started allowing people, and we were not scared when somebody walked in with an oxygen of 70. So we were pushed into this situation where we almost became like from just a walk-in clinic to almost treating patients at an ER level. My experience was great, because I had worked in the emergency room and I was not scared. Like, well, push come to shove, we had ambu bags. We can back this patient and get the ambulance to come and pick them up. So we were pushed in very, very critical situations. But I'm glad, because we took care of people and they got better. In fact, in the first few months, all the way, I think we had our first death sometimes in August. It was a 96-year-old diabetic that was like tired. They were at home. We treated them at home. The 96-year-old was diabetic. The 76-year-old and the 78-year-old, they were all diabetic. They all had COVID. And the 96-year-old did not wanted to go home, wanted to die and go meet her husband or something. But the other two got better. So it took us a while to even have one death. And after that, the reason why now we probably have had maybe 20, 30 deaths is because we started having very extremely sick patients come to us. And the main thing I would say is that COVID is still around. And in the big conversation everybody is having about COVID, we need to get back to early treatment, and we need to get back to people's mindset that if we treat this disease early, we will not get to the cytokine storm and not get to the pneumonia and not get to the place where we're too sick. And COVID treatment is the same whether you're vaccinated or unvaccinated. We treat them the same. Right now, we're getting more vaccinated patients getting very sick, but we treat them the exact same way. We took care of the respiratory problem. We gave them antibiotics. And we also gave them low-dose aspirin. We gave that to all our patients. In fact, I advise all my vaccinated patients to be on low-dose aspirin because it can help them stop from clotting. Anyway, and we have I was going to let Dr. Brian. Okay, yeah, Brian, your hand is up. Go ahead.
Yeah, Stella, I want to piggyback on what you said, because you said something that I think gives you and I a comfort level that most physicians didn't understand. Working in the ER and working in the ICU, most of us understand pulse oximetry. We understand vital signs. We understand looking at our patient in front of us. And the mainstay of treatment initially, when these physicians saw these pulse oxes drop, was to put them on a ventilator, send them to the ICU, give them high pressures, and trying to fix the pulse ox, which was just absolutely the worst thing to do. We know that you can simply put a nasal cannula on a patient, put them at 4 to 6 liters, and they do just fine with these low pulse oxes. But what that taught me, and what we're really finding out now, and Richard can back this up because we had a great presentation on Tuesday, is that this is a microvascular clotting disorder. This COVID-19 And the spike protein from COVID-19 is causing a blood clotting process in the microvasculature that is prohibiting oxygenation at the very capillary level. That's why these patients are doing very well, but their pulse ox is very low because they're not oxygenating at the cellular level as much as they should be. And that's where the blood clotting and the anticoagulation treatment was so beneficial. Aspirin and Eliquis, or even Lovenox if they couldn't do it, heparin if they couldn't afford it. We were giving all sorts of things. And patients were going home on oxygen. We were kind of forced into that whole protocol because patients refused to go to the hospital when they started coming to our clinic. They didn't want to go to the hospital. Like Stella said, they were showing up so sick, but they absolutely said, no way am I going to the hospital. I'm just going to go there and die. I'd rather go home and take my chances. So we were getting home oxygen set up. We were putting them on the protocol. And 3 days later, they were calling back going, I don't need oxygen anymore. Everything seems to be going fine. I'm walking around my house again. It was crazy how all of that transpired. But it goes back to having the comfort of knowing your patients, communicating with your patients, seeing your patients, and just giving them what they needed at the time they needed it.
Yes, Brian, you're so right. And I think part of the thing was our comfort level was working in the ER because, when you've worked ER, you practice, especially for somebody like me that worked low volume ERs where I was probably the only physician within maybe 2 or 3 mile, maybe 20 or 30 mile radius. We got used to taking care of all kinds of stuff and stabilizing patients in all kinds of ways. So that gave us the comfort level. And would the physicians that are on here as speakers just lift up your hands and we'll bring you up? Yeah, Molly, you were going to speak. Yeah, say something more.
Yeah, I was just going to say, first of all, mad props to, the early treatment docs on here, because while I was, in the ICU where people were dropping left and right, you guys were figuring this out and you taught me how to treat people early. Like I was using your protocols. So, I didn't figure this out on my own. You guys did. So first of all, that. But, and I'm one of the most critical of what happened in the ICU, but it also was a very imperfect environment, right? A lot of people were talking about a lot of different things, a lot of different treatments. And I was one of the big ones to jump on anticoagulants on the bandwagon. But remember, it's not 100% like if you do something, everyone's going to be okay, right? I also had a couple people who had a fatal head bleed. And when you've got patients paralyzed and intubated and sedated and, prone, to detect a head bleed is almost impossible. So they were massive and it was horrific. So for everything that's good for most people, it's going to be bad for a few people too. So there's never just 100% pure discussion on what should have been done for everybody.
Yeah, that's a great point, Molly. I mean, that's one of the things that happened with when ivermectin first came on board was that people were slow to adopt it because even if it's a 40% improvement in the ICU, in a sense, if you're in your hospital in a small, say smaller ICU, and you do it, you're still going to have people die. It's going to be less, but you're not going to have that acceptance. Once they started hitting down on a lot of these medicines, like you said, people are still going to die if you don't. So that's what happens. People stop doing. Here's why people stop doing the protocols. If you follow the protocols, you're not in trouble. If you go against the protocols, you're still going to have deaths. So now you've got to sort of justify why you went against the protocols, and yet still some of your patients died. So even if there's a 40% improvement, that still means a lot of people are dying. So it makes it very hard. Once the hospital has made it clear that you want you to follow these protocols, it's hard to step out of that box. And I don't know, you want to comment on that at all, Molly?
Well, yeah. And the other thing to that is you're not the only doctor on the case, right? So in my case, you would have a hospitalist, you'd have an infectious disease doctor, you'd have a pulmonologist, you'd have a cardiologist. Like I hated that, right? Just put him in my ICU and let me go. But I didn't have that. And so like it would be easy for me not to prescribe remdesivir, but it's really hard to stop it if another doctor is putting in their chart you need it. So it becomes the like lowest common denominator. And again, I hate it. Like just put him in the ICU and let us go. But that's just not the reality of the situation.
If they had listened to One of the things, we were on another space and I was saying that we need to have, like physicians, we need to have a postmortem just looking at what happened. You know what I'm saying? What happened? Why was COVID treated the way it was treated? Why did they allow people, why were they blocking people with early treatment? Why were they sending people home without even giving them supportive care, which is what we do for viruses? Why did they wait for them to get too sick to come back and die? Why were they willing to let people die? When I say why, because when I said earlier that there were some nefarious actors in the medical industrial complex that affected the way doctors and everybody reacted towards this disease. And then people that stood their ground, people like me and Dr. Orso, Brian Tyson, that stood our ground, like, no, we're going to treat patients. I'm not just going to watch somebody die. And we were vilified, we were harassed, we were threatened. Like I said, I had over 30 board reports and higher lawyers to fight the boards. And something happened that was nefarious. And that is why we're holding this space, because, and I would like to even bring other people that are not physicians that to comment on that, because something happened that was nefarious. And because something happened that was nefarious, a lot of people died. And there are still doctors today that are arguing about the efficacy of hydroxychloroquine or ivermectin or fluvoxamine. And I would say, in medicine is apprenticeship. Most times, I remember early in March where Dr. Armstrong treated patients in a nursing home, gave them hydroxychloroquine, monitored them, and they did well, and he was attacked. They even threatened to hold a Senate hearing against him. That to me was crazy. When patients came to our clinic, we did EKGs on them. We sent people for x-rays. We were not doing just some kind of fake medicine. We were practicing proper medicine, because we knew at that time that if anything messed up, we're going to be in big trouble. So there was just something that happened that was really nefarious, and we have to address that and say that, if the medical community doesn't sit down and go, we need to look into this. There were studies that came out in the Lancet. Somebody was quoting the Lancet. There were so many fake studies that came out, and so many good studies that were totally just, they will not even let it come out. You couldn't even publish a good study. You understand? So there were things that were happening that I believe that was not right. And I'll bring Dr. Laurie if you want to say something.
Hey, I want to tag on you, Stella, for a second. So just to point that out, John Jacques Ratcher had his study ready and wrapped up. And when we went to July to the second meeting, I actually brought that to the White House with me. But no one would publish John Jacques Ratcher's study showing a 40% reduction in deaths in the sickest patients in the ICU. Had that been published, later Pierre went on and gave a really impassioned speech, and I think in November. But this was July, where we had data that could have been published, and it's exactly what you said. We couldn't. The journals were corrupt. They were publishing fake studies. Harvard University, corrupt, had a CV doc publishing fake studies. This are highest levels of corruption in our system. So, yeah, was anybody asked, does that happen? Absolutely, that's what happened. So, I mean, we had the ability to put this information out there, and I think you said it well. It's nefarious because anybody who's spent a lot of time in infectious disease knows respiratory viruses are 5 to 7 days, period. There's no reason to not do an autopsy for 30 days later. All of this, the blood clotting was occurring and aware, and people overseas were talking about it. And it shocks me to say how long it took for that to spread. So great points. Corruption was a big part of it, and it was definitely nefarious. It was collaborated, coordinated attack on normal medical care. Over.
You're 100% right, Richard. Let me tell you the story out of the urgent care. The state of California Department of Public Health made us a sentinel site for COVID-19 because of our area, the high infectious rate, the LA Times study. We were flying out, I think, 500 patients a month from our small little hospitals to the main medical centers. So the state of California wanted to monitor the situation here. So they were in our clinic, physically inside our clinic, and we were collecting data for them for 2 years. The data that they wanted was demographic data, age, comorbidities, okay, and whether or not they had traveled inside or outside of the United States. The data that they did not want, even though we had been collecting it, and I showed them an entire year, a spreadsheet that we had. The data that they did not want was the reinfection rate data to prove natural immunity, and they did not want the treatment data because we were keeping track of how many patients were getting treated, what they were getting treated with, what their chest x-rays look like, and when they resolved. They published the demographic data, but would not publish the reinfection rate or the treatment data. That's how you know this is sinister. And then when I called them on it, and we had a big meeting in December, 3 days later, they pulled out of my clinic as a Sentinel site. Think about that.
Of course, that goes without saying. There's something, Brian, I want you to break down. Anyway, before we go to that, Dr. Mitchell wants to speak.
Hi, Doctor.
Okay, Sandy. Yeah, it's the next practitioner. Okay, go ahead, speak.
Hi, Dr. Immanuel. Thank you so much for allowing me to speak really quickly. I want to speak to your point of why were so many okay with this. And I just want to speak really quickly on several things that didn't make sense to me. I'm a nurse practitioner who in the Kansas City area was in family practice and urgent care at the time everything hit in early 2020. There were so many things that didn't make sense. Dr. Tyson, I can relate to that. Dr. Immanuel, it was really poignant when you said at the same time they were hyping up fear in the media was the very same time that we were telling people or directed to tell people to go home, not only go home, but isolate in a room, go to a basement, not to the top floor where your other family is. All of these things. And it really primed the pump for that shot to come in, 8 to 10 months later to be the savior, really. Why were medical providers, why were doctors, nurses, others in the medical field, why were they okay with this? Not why just was the government okay with this? I can tell you other things. Why was the recommendation for aspirin dropped in the middle of the pandemic? Why were vitamin C, vitamin D demonized? Why was on a 28-page document in the big box, big institutional medicine urgent care I worked for, why was I told in my 28-page treatment doc that vitamins were dangerous and basically forced to resign because I simply treated with vitamin D and azithromycin? I farmed out, my hydroxychloroquine ivermectin to my free doctor and Dr. Graves, who I treated with here, and ultimately I did telehealth on my own. MAB, I don't know if any of you, I don't know, Dr. Tyson, if you came into this, but in the Kansas City area with 6 hospitals that were under this corporation I work for, you'd know who I'm talking about, southern part of the U.S., there was no will to staff these infusion centers, no will. 10 urgent cares across the city. They told us about MAB, but no one ever said, this is what we need to do because it's basically all we have. It's our only EUA. I talked to providers that I would work at the same clinic with months into COVID, and they were like, oh yeah, I've never sent anyone over for MAB. I mean, no will to treat. There was at the one hospital that was giving it, I had an inside person. They were staffing with one travel nurse that was basically being let go in January, and they didn't plan on restaffing it. There are so many things that on a daily and weekly basis just didn't add up. Why was this allowed to happen?
It's so funny because right now in Houston, we still have most of the practitioners in Houston will not treat acute respiratory disease. They tell people to go to urgent care hospitals.
Yeah,
I think family practice. That's what we told everybody.
Scared the hell out of everyone.
Yeah.
I think it truly was. They drove so much fear into the public that if you got coronavirus, you were going to die. I have doctors out here who were scared to death to even open their office. They were doing telemedicine visits from home. They would only talk to them on the phone. They didn't want to have anything to do with anything COVID related. A lot of physicians were, in our practice, are elderly. They're in that high risk group. And so fear drove people to do really stupid things, honestly.
There's something about the way doctors are trained in America that affected the way doctors reacted to this pandemic. Most, if you go to most parts of the world, when physicians get trained, they are trained as general practitioners first, and then they learn to take care of everything, and then they specialize. But in America, most of our doctors are hyper specialized. They are so hyper specialized that they don't have a clue about anything else. So, for example, I had a psychiatrist call me a few days ago. She had COVID. She was terrified. I was like, "What's wrong with you?" She was terrified. She was unvaccinated and she was so terrified, but I treated her and within 2 days she was fine. But I'm just saying that a lot of doctors did not know. Number one, there are many doctors that were so hyper specialized that they just did not know. And people listen to doctors. There were doctors speaking like Sanjay Gupta and even Fauci himself that has not seen or touched a patient in years. Like you talked about Dr. Burks, that did not even recognize what they were talking about. So if a doctor is not in primary care, has not taken care of respiratory illnesses, has not taken care of a flu patient, and you bring this, most of the time they don't have a clue what's going on. So I give props to doctors like Dr. Oso. Anyway, Dr. Oso, you've worked in the ER and had some primary care experience. But many doctors, because they lack total primary care experience and they came straight from residency, medical school into some subspecialty, most doctors were just as terrified as the regular public because they just did not know. And because they did not know, they rely on data. They rely on what the CDC says, or they rely on what the medical industrial complex says. And in this particular situation, the medical industrial complex was against the people. So the second set of doctors were scared to lose their jobs. They were scared. They still had big student loans. They just were scared to lose their jobs. There are many doctors that for years right now, they've taken practice away from the regular primary care doctor that has their own practice. Remember when doctors used to go home with their doctor bags and the medicine has been so commercialized in a way, and now we have all these big conglomerates that have doctors working for them. Most primary care doctors sold their practices to the big conglomerates and joined these practices. So at the end of the day, they could not do anything. So there were doctors that knew that there was some truth going on. There was something they were missing, but they couldn't do anything about it because they were working in these big companies and they did not have the guts to stand up against them. They had children to feed, homes to pay, student loans, and all kinds of stuff. So we had those set of doctors. Then we had doctors that were working in the hospitals that were like in the ICU, like that did not, all they saw were the patient when they were already too sick, and they didn't, and to them it was devastating. And then of course we have the fourth set of doctors that I call them the nefarious ones that knew the truth, like Anthony Fauci. Anthony Fauci knows hydroxychloroquine works. In fact, in his emails, he knew hydroxychloroquine works. They did the study in 2005. It was done under Anthony Fauci. Anthony Fauci is involved in the gain of function study. So there were doctors in the high echelon that with big pharma and everything that are the nefarious people. So sometimes it's hard to just say, people today don't trust their doctors that turned them away, didn't want to see them. They don't trust their doctors. And to gain back that trust, we're going to have doctors have conversations so that people can trust them again, because they're like, well, I came at COVID. You didn't treat me. You let my husband die. Why should I come to you? People just stay home. There were times when, like Brian Tyson said earlier, people will come to the clinic. They will refuse. Dr. Stella, I'm not going to the hospital. I would die. I had a patient that called me from this thing. He said his oxygen was like 50s. Diabetic, obese. He said he is not going to the hospital. He would die at home with his family. We saw him. He called us just before. He called us, and the next day we sent him. The medicine didn't even get to him before he died. But he's like, I'm not going to the hospital. I'm begging him, please go to the ER. No, I'm not going. I will take my chances. And that happened to a lot of people. And now the trust was broken because a lot of doctors were not well trained, did not know anything about primary care, did not know what was going on, and the whole of America and the whole of the world was relying on doctors. It says,
So well said,
anybody can talk to that.
Stella. That's so well said. I think you've kind of summed it up, and I love to hear what you say, because I feel like there's a certain crew of docs that know what happened, and they did, and so that's where I feel like that fourth, the Fauci's, I really can't have any forgiveness for them because they knew what was going on, and so it's, in a sense, it's somebody who allowed this to happen, and actually, he's the main messenger coming out of Washington, giving extremely bad advice. So I can't really go after politicians. They really don't know. I can't go after a lot of people in terms of where they were emotionally, how it was affecting them. The messaging was so powerful. But when you have scientists like that who are scientific physicians, they've been in this field a long time. They know. I told you literally the stuff I knew. I knew about viral replication. Steroids would be impactful early on. I wasn't sure about using them in the first 5-7 days, but I knew that steroids were a mainstay in respiratory disease. It was basically very simple to look at things and say, hey, we're going to mitigate at least, even if we can't attack the virus. All of this is, interferon is never used. And interferon is, very impactful against viral disorders. So nobody even did a study on interferon's role in something like this, because it's, our major response in our cellular response is interferon against viruses. So there's a lot of things that could have been done early on. They had Kaletra. Kaletra is just like Paxlovid. For people who don't know, viruses and tumor cells are really similar. I've done a lot of oncology work, and I know you always attack heterogeneous cells like viruses and cancer cells. You always attack them on multiple levels. Never made sense to go after it with one thing, but there were things that we could attack the virus with early on. And we never did any of that. It just never made sense. It was the most absurd thing I've ever seen. And as Stella said, yeah, I was like Stella, I spent overall about 6 years working smaller ERs. One, I ran ER schedule for 2 years, and I actually would go 60 hours every other weekend, and did during the week with another person, would go from 6 a.m. to like 6 p.m. to 6 a.m., covering that call there for a long time. So, yeah, I had a lot of experience doing things in a small place where there was the next closest hospital was literally about 35 miles away. So, that did give me some feeling of going forward. But at the end of the day, it was more of knowing what the scientific side of it was, that it was just absurd. And so anyway, I can't forgive people like Fauci for that. Over.
Dr. Laurie, Dr. Laurie, you should say something. I think you've been putting up your hand for a while.
I've mostly been emoji reacting because I agree with everything everybody's been saying, but thank you. I just wanted to quickly back up some of the things that everybody's been bringing up. They're excellent points. One thing I noticed for sure, friends of mine that still have independent practices, they were very open to using early treatments and to using the hydroxychloroquine and later the ivermectin. It was the practitioners that were under the thumb of the medical industrial complex that were hesitant. I wouldn't say that they didn't know, but they were afraid to prescribe the medications, as was brought up before. The other thing I wanted to comment on was to agree with what Dr. Stella said before with Dr. Fauci. In his emails, not only did he admit that hydroxychloroquine worked, he had said that it had a near curative effect on SARS-CoV-1, and he even admitted that it would be effective as a prophylactic. So certainly he knew that. And then the last thing, I just jotted a couple of things down. I don't know if you spoke about this at all, but I believe it was in the Lancet where they had the fake hydroxychloroquine study. Do I have that? Does anybody know?
Yeah, it was the Lancet,
okay.
Yes.
Yeah. They had used data from hospitals that didn't even have the capacity to collect such data. I should say, they faked data from hospitals that didn't even have the capacity to collect the kind of data that they were reporting on. And the number of patients that they had reported to have studied in these studies could not have possibly been
Yeah,
treated at that point through the. So I just
71,
wanted to bring this up.
yeah,
Thank
671
you.
hospitals. Yeah, I'll jab in on what you said. 671 hospitals, 93,000 patients, done in about 2.5 months. It was absurd, and that's what got them. That's what they reached too far, and that's what got them. So that's well said. And I see you have some. Someone's got their hand up. I'm over on that.
Yeah, we see Bob has his hand up. Okay.
Hi. Yeah, I have a few questions about the studies that is being done, through the COVID critical care and all that. I use the C19 site quite a bit because it seems like it's being updated regularly. It has the meta-analysis and all that of the different early treatments. And I was just curious, are there going to be some studies posted to kind of show the combined protocols to start seeing, like, for instance, if you did like ivermectin plus quercetin, plus if you had enough vitamin D and zinc, if you take all that stuff together, you can't just add the stuff together, right? Because they have uh, overlapping benefits, right? But there's probably cumulative benefit, and that's why you do the protocols like the FLCC. And I'm just curious if there's going to be some work done to have those kind of aggregate analysis or aggregate data put out there. And I'm actually really interested, maybe somehow I can connect with somebody afterwards about getting some of the raw data that's on like that C19 early site to be able to have it so it can be queried, more effectively to show, rather than just the charts and stuff where somebody could go in and do their own charts, like you get with a statistical site. Over.
Yeah, we have a lot of data. We started out in March, taking care of patients in the clinic and after clinics. And then somewhere around July, we started doing telemedicine around the country. And we have we have over like 100 and something thousand patients. And at some point, even if we put the data together, nobody will publish it. So there's a lot of good data out there to show that this stuff works. But people can do retrospective studies on my data, on Brian's data, and a lot of us that we know a lot of doctors that saw a lot of patients, and the data is still available. It's not anything that it's hidden, and you can, for example, we're putting a data together from just patients born before 1945 that we treated, which is at the age where it's dangerous and have other comorbidities. We have all the data, and I will be glad to let anybody analyze the data if they need to. And there's something else that I wanted to mention about the way this was handled and why a lot of doctors, I don't know why they choose not to do it, but in the beginning, we sent out the protocols. Like, Dr. also said earlier, the Makalov protocol was basically taken from people like Brian and me because we have the COVID protocols. That we put together. My protocol was published. I gave it to many doctors all over the world, and many people started using the program in Brazil and all over the world. As people who just DM me on this time, we'll send the protocol out to people, and people were using it and getting a lot of success. So these protocols can be put together, but the issue about it is that are we at a time yet when the medical industrial complex can let this data be published and let the truth be given out there without vilifying it and trying to block it? If you ask Dr. Brad, most of us could not get our data published because they didn't want to hear it. Nobody even wanted to see it or hear it. Until today, that has not stopped. We are talking
Yeah.
right now because we're fortunate that Elon Musk has allowed us to talk. This is the first time that our own side of the story is being heard. For years, we just heard the other side of the story. Oh, no. COVID bad, take vaccine, get boosted and boosted. You know what I'm saying? So our side of the story is coming out right now. So yes, we do have this data. Is it time right now? Are they going to still stop it? We don't know.
Yeah, that's, I guess, brings me around to the other thing that I'm really interested in trying to trying to put together a project with other people, other software and IT people and stuff. Because, I mean, there's alternatives, right? I mean, yeah, Twitter's opened up, but all the other social media sites are censoring. You have Substack, which actually is runs on Amazon Web Services, which could get shut down. So so I guess my point is I think that it's better to start getting that data out, being able to start pulling it together, and it'd be nice to be able to start working with more people on that, to be able to put it on some sites, on maybe some private websites that can't get shut down that easily, and then be able to share those links and get that information out there. Because it's really hard, I think, for me. I've been keeping like a huge list of all the sites and pulling together the data. I download data all the time that I can find. But most people can't do that. And, if I want to try to look at some correlation, it doesn't take me that long. I work in this industry. It doesn't take me long to see, that's how come I knew right from the start that there was something wrong, because I could see the data on the hydroxychloroquine early on, and that it was showing, success, and all of a sudden they ban it. It was obvious that there was something nefarious going on. But again, I guess I'm just trying to find a way to be able to help in whatever way I can to share data. I can put stuff on websites. I can make it available for people to look at and stuff. And so, I'll just leave it at that. Over.
Yeah,
Yeah,
Bob. Let me get you in touch with Matthew Crawford, who's one of our main statisticians in our group, and him and Dave Weisman are doing a lot of data research. We could put you together if that's your forte. So I just followed you on Twitter. You can send me a direct message now, and I'll get you hooked up in that group.
Yeah, I appreciate that. And I think it's going to get bad again. I have this bad feeling that, that this isn't over. And I feel like we need to really start having alternatives for people to get to the data. And, private websites like FLCC sites and things like that are going to be more and more important, in my opinion. And we'll see what happens. But I'm afraid of what's going to happen based on what they've already done. Over.
There's something that I want to mention here about even the COVID early treatment. I remember late Dr. Zelenko had put together the Zelenko protocol, and Richard and I, early 2021, we put together something that had vitamin C, D, zinc, and quercetin. Like I said, if you go on the NIH website and you just talk about zinc and RNA viruses, there are studies that show that zinc is a potent inhibitor of RNA viruses, which COVID, flu, and RSV are all part of it. So we put together quercetin, which is over the counter. Quercetin is actually a weak ionophore. There's a problem with zinc. Zinc cannot be absorbed into your system. So zinc needs something that will open the zinc channels and allow zinc to go in. This is why hydroxychloroquine, even ivermectin, is good early, because they open zinc channels, zinc goes into the system and kills the virus. Quercetin is a weak ionophore. Quercetin is over the counter. So a lot of people that were just taking quercetin and zinc and vitamin D and vitamin C, they were less likely to get the virus, or even if they got it, they had they didn't get as sick. So these are things that people need to know. But like I said, our voices were silent, and we actually put together what we call COVID vices on our website, drstellamd.com. But it's something you can buy over the counter. You can get quercetin, you can get zinc, you can get vitamin D and vitamin C. They were just simple supplements that people could take that would make them fight any virus, not just COVID. I'm talking about vitamins that will help fight flu and RSV and other viruses. And we were kind of, our voices being silent stop people from hearing this. So I want to tell everybody listening and just get it to everybody. There are many little things that you could have done, to just, just gargling with warm water and many little things I could have done to help people from either catching the virus or getting a serious disease before we even talk about the medications that needed to be prescribed. So if we can still look at quercetin still works, vitamin D still works, zinc still works, if taken together. So it's something that we still need to look at and let people know that there are things that you can do to keep yourself healthy. And of course, good exercise, going outside. They locked people in their houses in the worst time possible because staying in the house actually just the air in the house circulating and the virus circulating made people less healthy. The masking that made people less healthy. So there were many things that were done that were like totally off. And when I say it's nefarious, this thing led to the more and more deaths that we saw with COVID. So people need to start. I'm glad you're talking about getting this data out to people so that people know that, there are ways that there are things you can do, simple things that you can do to stop yourself from picking viruses in the winter and getting better. And then we'll talk about the medications that we use. Okay. For example, one of the things, I'm a big proponent of prevention. The same article that we all read that got all of us to jump on hydroxychloroquine was done under Anthony Fauci in 2005. He actually said that hydroxychloroquine was actually going to work not just as treatment, but as prevention. And not just, it could actually be used as a vaccine. And this was Anthony Fauci. So looking at it, if you look at the mechanism of hydroxychloroquine in treating viruses, number one is anti-inflammatory. Number two, it's an ionophore. It opens zinc channels. It allows zinc to go into the cell and kill the virus. That it stops viral replication. That would make sense for you to take it as prevention. I have been on hydroxychloroquine for the past several years, all through this pandemic. I've never really gotten sick. I have the mentality of somebody that lived in Africa where we took chloroquine, hydroxychloroquine, whatever, as Sunday medicine to prevent malaria. So weekly hydroxychloroquine has been something, or weekly of the quinones have been something that I took growing up, which has solidified my mindset on taking hydroxychloroquine. And some ivermectin too can be used the same way. And this is one thing, and then I'll hand over to somebody else to speak. If you look at the data from Africa, we had people like, scientists are so shocked that sub-Saharan Africa has not really, really gotten COVID like that. Why would they be shocked? In sub-Saharan Africa, if you get a fever, you go over the counter and you buy chloroquine, mefloquine, any of the quinones, and you take it for malaria. And because sub-Saharan Africa had this ability to just go get these medicines over the counter for malaria, COVID was not really an issue in sub-Saharan Africa, and the deaths were not that high. Sub-Saharan Africa is like, maybe less than 3% vaccinated. And most of the people that are vaccinated probably came to America or something. That, and then the second thing is when COVID left Wuhan and seeded into America and all over the country, COVID seeded in Nigeria too. You cannot social distance in the slums of Ajengune or Lagos. But when COVID entered Nigeria, people that left Wuhan were required to take anti-malarials to go to sub-Saharan Africa. And because of that, the COVID was knocked out of their system. So COVID could not really seed into Nigeria. COVID seeded into Nigeria from Europe. So I'm just saying this to say, if scientists are actually looking at the data, looking at what is happening in other places, we will not be cloaked with this whole medical industrial cloud that has covered our minds. And Dr. Osa.
So that's really well said. I think in general, the way they're actually doing this is you'll never see studies from people that actually treated patients saying any that are being said. I mean, it's always somebody evaluating data, using the wrong dose, wrong time, wrong patients. I mean, it's over and over. The studies are corrupted. When the studies have been, if you look at the ivermectin study, there was 10 deaths, control group and 3 in the ivermectin group, but they cut the study off at around 400 or 500 patients, which didn't give it a proper p-value. So they've done a lot of things to make sure that even when things were going well, they did things to make the studies not look right. And then also the meta-analysis, those are just data guys sitting in, never looked the patient. And this is, again, really important. Data analysis is great, but I just can't tell you enough. When people are sick and dying in front of you, it's a much more personal thing. And you will not do nothing. you will not do it. If you do, you should not be a physician. So this is very, very important. These patients are coming in, begging you to save their life. And we went through the Delta phase. It was even worse than the initial, and we had to redo our protocols. We can maybe get on that at some point. But all the things that were working for us before suddenly weren't working as well. So I'm sure Brian and all of us on here have treated. No, but Brian and Stella actually have probably a lot to say about that. But at the end of the day, these people that are doing these studies, the data guys, and I'm not taking away from data analysis, but this is purposeful. They basically can afford things like that. They can afford to go out and hire a bunch of people to make data sets that look favorable to what they want. This is what's happening. That's why I don't trust the CDC with their recent data release. They've already shown that they let us down during a pandemic. They've already given us public policy that created 90% of the carnage. So you can't look to the same people that have already bitten you to actually give you the truth. It's not going to happen. It's real. That's reality. Over.
So the CDC, what I've noticed is that they are distorting the data. They'll do like graphs and stuff, but they won't provide the underlying data to show. Like they came out and said that 99% or 95%, was it 99 or 95? Of the people getting dying were unvaccinated. And it turned out what they were doing was they were just using the relative risk initial numbers. I mean, there's so much corruption of the data, I agree. And I think, though, more data is better. So, like, I spend a lot of time going on Twitter and trying to chop down a lot of the bad stuff where somebody will say something like, well, Africa's younger, so that's why they had less people die. Well, okay, so they're younger, so they do have less risk. But even when you factor that in, it still shows up as a huge discrepancy. So I think that getting a lot of the data together is useful, but I agree with Dr. Urso that it's an issue, that there's a lot of corrupt data going out. There's a lot of misleading data. It's like figures don't lie, but liars sure can figure, right?
Yeah, I agree. And the reason, which we haven't hit on yet, in my opinion, started with basically Fauci's MO of, taking repurposed drugs, shelving them and not allowing physicians to use it so that they can push the new, bigger, better, more expensive drugs, and everything under this emergency use authorization, right? So if you notice, we're still in the emergency use authorization era 3 years after COVID has started. Why? Because number one, it gives them immunity to all legal liability. That's number one. Number two, if you have an alternative solution or an alternative treatment, you cannot get an emergency use authorized product to market. Okay. That's where, when I broke that story, that's when basically my whole social media life died. I got kicked off Facebook, Twitter, YouTube, you name it. Because we were telling people and pointing it out, and they even readjusted the emergency use authorization to take out the fact that in order to get it to market, there couldn't be any other alternatives available. So that's why they destroyed outpatient treatment. That's why they said, oh, you can't, there is no other outpatient treatment. There is no repurposed drug use. You can only use drugs that are EUA, which is the monoclonal antibodies, right? And then, when remdesivir first came out, it was EUA. Then it was the only treatment you can use in the hospital that was, quote, approved. Meanwhile, the FDA, going back to, what was it, Richard, 1997? We can use drugs that are FDA approved off label,
Yes.
as long as we
Correct.
not against any policy or any law or any protocol to say we can't use ivermectin or hydroxychloroquine, because those are FDA approved drugs. We can use budesonide. We can use vitamin D3. We can use zinc. We can use colchicine. We can use that's FDA approved because we have the right to do so. But they made it seem like it was against the law. They got all the pharmacies on board to say, oh, no, we're not going to prescribe it. And then it was, oh, if you're using it, then, we're going to, punish you for it. Also that they can push these vaccines and their treatment and their drugs. Because now you look at the CDC and the NIH, it's all about early treatment. Oh, make sure you get treated early. Make sure you get treated early with Paxlovid and Molnupiravir, right? And we'll make sure you get treated within the first 3 days because that's when you're going to have the best success rate. Well, that's what we've been telling people from the very beginning. Get treated in the first 2 to 3 days and you're going to do just fine. You don't have to use their drugs. You can use our drugs. You can use our drugs, their drugs. I don't care, but you need the early treatment part of it. And they kiboshed it so that they can get their drugs and make their money and get everything to market. That's my 2 cents on it.
Yeah, Brian. And what's really horrible about that is Paxlovid. There's another drug. It's a carbon copy of it called Kaletra. And they tried it. They didn't do it in an early treatment trial. They only did it in a late treatment trial. As I said, that's why remdesivir doesn't work. Nucleoside analogs aren't going to work late. They can't. The virus isn't replicating. You're going to kill mitochondria. You're going to kill normal cells. You're going to kill anything that's replicating that might be susceptible to this. But you're not going to kill viruses because viruses don't exist 2 weeks later and 3 weeks later. This is such a basic 101 concept. It's still shocking to me that we had the whole world using a drug that had no chance of working. It's still a shock. So, and it's still being used. It's still on the protocols. So Paxlovid, if you look, is basically ritonavir in there, which is also in Kaletra, and another nucleoside analog, which helps. The ritonavir helps the other nucleoside analog. The other protease inhibitor work better. Sorry. The ritonavir makes the other protease inhibitor work better in Kaletra, and it makes the other protease inhibitor work better in Paxlovid. So what you're seeing is they had a drug available that could have worked, and they held it off. And let me say this, as I said earlier, Paxlovid by itself, it's a one-trick pony. So when you see that Paxlovid rebound, you're not really seeing rebound. You're just seeing the inflammatory stage kicking in, and that's what you're seeing. So in general, what I'm saying is they went out of their way not only to not treat, but the on-label drugs, which they had to know, so this is an on-label drug. So just like Paxlovid is on-label, so would be Kaletra, because it's going to affect the I'm blanking on the chymotrypsin protease. And so what that does is once the proteins are made in a big block, it's chopped up by this protease into smaller pieces that can then self-assemble into the virus. And this doesn't allow that to happen, so the protein never gets chopped up into 11 pieces. So for the most part, this is how the Paxlovid works. This is how Kaletra works. And guess one of the things that ivermectin does is it's the best at the time. It was never tested against Paxlovid, but it was tested against every other 3CL protease inhibitor. And basically what they found was that ivermectin was the best of that group. But ivermectin does 20 other things. So again, you have to attack on multiple levels. What's unique about ivermectin, it attacks the disease in different areas. It attacks the inflammatory component. It helps in the blood clotting component. It hits it on a lot of phases, and that's why it's made such a great impact on this disease. But you still need other things and other things to treat with. And our government went out of their way not to allow us to use those things, and they were already available. There were other nucleoside analogs other than molnupiravir. There were other, like I said, protease inhibitors other than Paxlovid. So this is a real crime. So that's what I have.
It's a crime, and not only is it a real crime, the issue is there are many doctors today that still believe that ivermectin is a dewormer, it's a horse medicine. Can you imagine that our own FDA put out something about that's a horse medicine? And think about what it did to people that were just out there trying to take ivermectin. They did not even say this is medicine that is used all over the world, that is used for to treat all kinds of diseases all over the world. They didn't say that. They made it look as if we were cooks because we're now taking horse medicine and trying to give it to human beings. And that is so wrong. And even Paxlovid is not I will not use it. While I will not use it, because apart from the rebound, which I don't think is a rebound, I think is just not effective. So it allows the virus to go to the cytokinin state. You understand? So I won't use it. Why? Because hydroxychloroquine, ivermectin, budesonide, Z-Pak works. It works. And if they allow people to make a choice to get the medication that works for them. So this is why we need to be doing these spaces now that we have an opportunity to speak. And for you people that are on the spaces, share this, because people need to know that COVID is treatable and it's preventable. They don't have to be scared of COVID. They don't have to feel like they have to inject some mRNA, and we're going to do a space on that, on the vaccine, because that's like a whole other story. We're going to do a space on that to talk about the pros and the cons and why. And I'm not an anti-vaxxer. I'm a pediatrician. Before I started working in the emergency room, gave a lot of vaccines. But today I've gotten to a stage where when it comes to vaccines, I said, you know what? I will wait until further notice, because right now the distrust over what these people have done to humanity is too much for any of us to deal with right now. So, Brian, I want you to actually break down a little bit. No, there was somebody that wanted to speak before we go to Brian. Apote Carol, I know you do a lot of holistic medicine. If you can say something.
Hi, thank you so much. I'm just really thrilled to be able to be here, Dr. Emmanuel, and hear you speaking. I want you to know that you have been here for the last 2 years. You have been speaking here for the last 2 years through us. We've been here for 2 years saying exactly what you're saying about early treatment, and we have been teaching people. Michelle has been shoulder to shoulder with me doing this, as has Texas Girl. She was a COVID ICU nurse here in Texas, and there's one other nurse. And the four of us were here every single night teaching people about the early treatment and sending them to Dr. Zelenko's website, to the FLCCC, to wherever they could get early treatment and telehealth. If they couldn't get their prescriptions filled, we helped them find a place that would fill them. We taught them about the vaccines. We helped them read the studies for themselves. We answered questions. What is quercetin? They're like, well, what is quercetin? Where does that come from? When they tried to, threaten to take NAC away, everybody pulled together, people that weren't medical, just people in these spaces. Everybody branched out to help find places where people could stockpile a little bit of it for themselves just in case. Like this has been going on for 2 years, every single day. And we have heard your voices in every podcast. Every time you testified in front of any Senate that we could find the videos for, we shared it with each other. We answered questions. We talked among ourselves. But you have been being heard, all you doctors, all of the early treatment doctors, you have been being heard in these spaces for the past 2 years. And I just wanted to step up and say thank you. Because without you, we would not have been able to help all the hundreds. People tell me it's thousands. I don't know. I never counted. I haven't kept the data of all the people that we've been able to help through these spaces over the last, since they opened a couple years ago. So thank you all so much for the guidance and the leadership that you've given, because it has not gone to waste. It has not been in vain. Many people have been helped right here in these Twitter spaces, and they've let us do it absolutely unimpeded. We haven't been censored one bit in the spaces. Now down in Twitter, that's a different story. We've been persecuted down in the Twitter with our tweets. But up here in spaces, we have been given free reign, and we have taken advantage of it this whole time. But thank all of you for the leadership and the courage that you have put forth, because your courage gave us courage too. So thank you.
Hey, I wanted to
You're
add
welcome.
to that really quickly, Carol. That's why when we sit here, Carol and I, and we see you, Dr. Emmanuel and Dr. Urso and Dr. James and Dr. Farrell and Dr. Tyson on this call, we sit here and scream inwardly, because these are the spaces that should have 15,000, 20,000 on them. You guys are the original OGs. I mean, we have, you've guided our treatment. There are thousands and there are hundreds of NPs across the country and other physicians who have been guided. I mean, you won't even find them on the FLCCC website as affiliate, as the Alliance. You won't find them because they've been guided by your protocols. And this is, it just drives me crazy. I see this. And so everybody tweet out right now. And if you don't, if there isn't much left and we don't stay on here very long, at least after we're done with this, tweet out the recording, because you guys deserve thousands and thousands. Thank you so much.
Yeah, you're welcome. And I thank God for all the other doctors that we stood shoulder to shoulder. And I'm going to let Dr. Laurie speak, and then Dr. Angela Ferrella is on, and I'm going to let her speak. Okay, Dr. Laurie, you have your hand up.
Thank you. Just a quick comment I wanted to bring up, going back to how they demonized the early treatment medications. Do y'all remember when they put out the article that there was a gunshot victim who could not receive treatment in an emergency room because they were overwhelmed with ivermectin overdoses?
Yeah, that was
remember that article?
That was a completely fabricated story.
Yeah.
Yeah.
I wanted to throw that out there. It's just another one of those reminders, because it was surreal how ridiculous the stories became that they were putting out there in order to demonize these medications.
So
That's
somebody
looked
that up, and I think there were 3 people who called the Poison Control Center, and it was people who were taking like the paste of medicine, like a tube of it at home on their own.
Yeah, they just had general questions.
Yeah, it was nothing. And then like thousands of news outlets picked that up. Famously, Rolling Stones is now working for the man. So that was enlightening.
By the way, I have the horse paste at my house just in case.
Actually, I have tons of ivermectin in my house. And one of the things that I've told people to do, anywhere that I spoke, wherever news outlet, wherever I was given the voice to speak, one of the things I told the American people is, make sure you have hydroxychloroquine, ivermectin in your medicine cabinet. Have it in your medicine cabinet, because the early disease can be treated, can be knocked out immediately. Don't wait till you get sick. Don't wait and be calling us when you're in the hospital and trying to get somebody to come and break you out of the hospital. I had people that practically broke out of the hospital, ran out and then called me from their house and asked me for medication. I mean, I did, oh my God, I can't even imagine the kind of medicine I practiced in the past 2.5 years. But, we did something.
I have a
question.
Did
something.
Yeah. So are you using hydroxychloroquine, and Brian too, and everyone in here, are you using hydroxychloroquine to prophylax? Are you using ivermectin to prophylax?
I use both. It actually depends on the patient. Some people want hydroxychloroquine. It's cheaper. We give it to them. And some people use ivermectin to prophylax, and we give it to them. But this is what I'm saying. And it comes from my mindset of growing up in Africa, where we took prophylaxis weekly for malaria. There's no such thing as a regular cold. There's no such thing where in a time when COVID is now endemic, there's no such thing like I have a cold or it's my allergies, I'm just going to wait it out for 5 days. Because by the time you wait it out for 5 days, if it's not your regular cold or your allergies, you're moving into the next phase of the disease, which is going to be harder to treat. So one of the things that we are trying to do on our website, if you go to my website, drstellamd.com, you can see it on my Twitter, on my Twitter handle. One of the things that we do is we encourage people to get hydroxychloroquine and ivermectin and stock up in their home, in their medicine cabinet. Many of my patients were put on prophylaxis weekly. They took hydroxychloroquine, they took zinc, vitamin C, vitamin D, and most of my patients, they stayed healthy. They had family members that got sick. They took care of family members and they stayed healthy, which is one of the big things that we push. One thing that we did earlier when we started doing telemedicine, it was a nightmare. We would call pharmacists. Pharmacists would report me to the board and they would cancel prescriptions and not even tell us that they canceled prescriptions. It was crazy. So somewhere along the line, we reached out to the mom and pop pharmacists. I was on one of the two conservative big shows, and I reached out to mom and pop pharmacists and I told them, listen, we need your help. America needs your help. So one of the things that we did is that we got mom and pop pharmacists, network mom and pop pharmacists all over the country that could ship ivermectin and hydroxychloroquine to your house. Number one, we had doctors licensed, we still do, in all 50 states that would prescribe hydroxychloroquine and ivermectin to you to keep it in your house. And one of the biggest thing that we did when we started out is that I built my telehealth system from scratch. It was not initially. It was hosted by Amazon. Then I took off the hosting from Amazon because we built our telehealth system from scratch. We connected with pharmacists and built a portal for our pharmacists. we ended up creating a closed system. And since we created a closed system, it stopped a lot of the crazy reportings to the board, and we're able to give patients medications without being impeded. But what that did is that it takes 2-3 days to ship to your house. So we tell people, if you go now, you get the hydroxychloroquine and ivermectin right now. Get it in your medicine cabinet. Don't wait till you're too sick. Chloroquine, and they work also for flu. They work also for RSV. The reason is because they are all RNA viruses. And I'm sure Richard will say a little more about that. So they work for all these diseases. So there is no reason for anybody to be afraid of COVID. And the only reason people are afraid is that they withheld information. They withheld information that could allow people to make the proper choice on the treatment that they wanted. I'm not going to give somebody a COVID vaccine, but I'm not going to beat somebody in the head for taking a COVID vaccine, because they come back to me and I still treat them and I take care of them like anybody else. But people need to have informed consent on anything. When I had the first report to the boards, they looked at everything and they said, oh, you did not give a proper informed consent. We had a 2-page consent. We had a whole full-page consent on hydroxychloroquine, what it does, the rare side effects we had, and we gave it to the patient. So I asked the board, I said, you guys are you're promoting a jab that doesn't have any side effect listed. We have people sign a consent before we give them hydroxychloroquine or ivermectin. So that way they knew that this can possibly happen, and they signed and they took it. And so we had all this, so much rancor happen over something that still today is easily treated, is easily prophylaxed, and people should not be sick. So that's why my message to the American people, to the world at large, is that COVID is treatable, it's completely preventable. People should not be afraid of it. And you should make sure that you get the information and get the medications for your family. Because if you're waiting for the medical industrial complex, you might not make it out. And I'm going to let, where's Dr. Angela?
Can I just ask one question on prophylaxis too?
Sure.
I'm sorry. I wanted to know if anybody had come, I haven't, but I was wondering if any of you had possibly come across any studies that would have been done on patients with, say, like rheumatoid arthritis who had been taking hydroxychloroquine prior to any of this, and to see if they had any, if there was any difference prophylactically.
Well, we had a lot of rheumatologists come out and say that their patients were not catching COVID. We had a lot of like I said, on Facebook, we have a group of doctors, thousands of doctors that we relate with, and we had rheumatologists speaking, and they should have spoken out more, but everybody was afraid to speak up. You know what I'm saying? Rheumatologists, many rheumatologists said this, and there was a study that was done in Paris that was done with Didier Raoult. Until today, they are still vilifying Didier Raoult in France because of the study that was done for patients that were rheumatology patients and how well they did with the COVID pandemic.
Thank you.
It's taken hydroxychloroquine for Sjogren's, and neither one of us got COVID until, just recently, like in the last few months. And, her case was she just kept taking it. She didn't change her dose or anything. And she got through COVID without too much trouble. I mean, she had the cough for like 2 or 3 weeks. For me, it was like a cold. And I was wondering about quercetin as a prophylactic, since if that's, because I was using that whenever I start feeling kind of out of it. Is that effective? And one other question, then I'll turn it over, is we're really wondering, I get a lot of questions about people that are vaccinated and worried about what's going to happen to them. And I just wonder how much work is being done in that whole area of trying to find medications that can, try to help people that, who knows what's going to happen to them with these adverse events. Over.
We do have something for vaccinated patients, but I wanted to keep this space really just about early treatment. And Dr. Osa and I were talking, and Brian, we're going to get doctors and we're going to do a space on the vaccine injury and some of the things that we're doing to help. It's not all is lost. So I wanted to wait on that. Number 2, let me answer you on quercetin. Quercetin is also an ionophore. The reason people take hydroxychloroquine, it works best if you take it with supplements of zinc and vitamin D. So if you didn't take it with supplements of zinc and vitamin D, it reduces, it kind of, if you take zinc and vitamin D, it increases the efficacy of it, kind of just preventing you from getting COVID. So people that took quercetin zinc and vitamin D, most of them did not get COVID. And if they did, I know a lot of patients and they got a milder version and these are anecdotal reports. So quercetin works as an ionophore. It opens zinc channels. It allows zinc to go in and kill the virus. So quercetin works very well if they with zinc and vitamin D. Dr. Also, and I put out a formulary which our patients take and they do very well.
So
And
my
and
understanding,
and I will say that one of the things about hydroxy is a little bit different than zinc in terms of just not only being that zinc ionophore, so it has a big effect on endosomal acidification, which is basically a way that that not only the zinc ionophore effect in the RDRP, but it also has an effect on viral assembly. It's got other effects that quercetin doesn't have, but quercetin's a good prophylactic. It's safe, and I think in general, that whole regimen that Stella just mentioned is a very reasonable way to actually help against any of these RNA viruses. Respiratory RNA viruses use a lot of the same pathways, and so that's why it'll be effective against the flu and some other things also. So I think it's a good strategy as a prophylactic.
Dr. Angela Ferrara, she treated a lot of pediatric patients, and let her say something about that.
Hello. Well, good evening. Great space that we're having here. I've treated both adults and children. Most of the kids got away with just, good old-fashioned supportive treatment. We didn't have to use too much, but that's another true statement is that ivermectin and hydroxychloroquine can be used in kids, especially high-risk kids. We use ivermectin topically to kill lice, and we have been for years and years and years. So when people are talking about horse paste or whatever, it didn't make any sense because you could actually take the lice medicine and rub it on your skin. It would penetrate, and you'd actually respond. So and we did have some people actually formulate some of those topical formulations for us for people that were too sick to swallow the pills or couldn't get the medication any other way. So, that's a huge thing. And the kids, we knew from the very beginning, the kids weren't affected from Chinese studies all over the place. The kids were not affected. It was a 0.7 relative risk for the kids to actually get it. So even if a parent in the household had COVID, the children did not directly get COVID. They were a buffer. And I tried to bring that out very early on. I was a very, very loud proponent of not locking the kids down out of school. I wanted the kids to keep going to school. I wanted the kids to keep visiting their grandparents. I thought this was all ludicrous, and I kept screaming that from the mountaintops. But, when you talk sense, and it's not the sense that other people want, they're going to shut you down, and which is what we found. And at first, when that happened to me in the summer of 2020, I really couldn't believe it. Because I was like, who am I? I'm nobody. This is just common sense. And so we, in our practice, we shifted and pivoted to adults very, very quickly because the kids weren't coming in because the kids weren't sick. And so, we've probably treated over 3,000 patients easily for COVID within our practice quite successfully. And so we have to be real mindful of the PTSD now that people have suffered because of all this. And I agree with you 100%, Stella, that we do need to have everyone have certain items in their home on the ready just in case, because no one trusts the hospitals. We can't even trust our colleagues anymore to pass a patient to the hospital. We can't trust them. And so, and that's a pretty sad state of affairs when a doctor who works outside, who's a community physician, doing things as an outpatient and really needs some inpatient support, and we really can't even trust them to do that. And that's very sad and scary. So when you're looking at things to have in your cabinet, and I actually did a medical bug out bag lecture that's on my Facebook if anyone wants to go look at that, and it's A Brighter Tomorrow Pediatrics. In that medical bug out bag, one of the things that I was selling left, right, and upside down was nebulizers, because what was one of the first things that they pulled out of the emergency rooms and off of the ambulances was nebulizers. That is like the most ridiculous thing. You have people that are in respiratory distress and you won't give them something to relieve their respiratory distress. A nebulizer works beautifully in these cases. But, this falsehood of, well, it's going to spread COVID, was ridiculous. And these poor ambulance EMTs and paramedics and stuff, they were watching these people just suffocate, and they couldn't do anything for them because they weren't allowed to use the nebulizers with life-saving medications, such as budesonide, such as the albuterol or levoalbuterol. So one of the things that I started doing very early on is I contacted a durable medical equipment company, and I stocked up on nebulizers. I mean, I just called them. I said, just bring me whatever you can, how many that you can. And I pretty much would not let anyone leave my office without a nebulizer in hand if they didn't have one at home. I mean, that is another thing that's absolutely essential because, there is going to be the next thing. And so I would really recommend the American people, all of you have a nebulizer on hand. We have recipes for if you can't get albuterol, levoalbuterol, or budesonide, we actually have recipes for other things that work just as well. I was using a ton of saline with hydrogen peroxide nebs, and they worked beautifully. And so, we were doing that left, right, and upside down when at sometimes we couldn't even get people to get to the pharmacy to get medicine. And so I would have them mix this up and put it in their nebulizer, just to kind of tide them over, and it worked great. And so there's a lot of things out there now that we have discovered through this kind of crisis medicine that we had to practice because we were so blocked and shunned and censored, and, we were threatened and we were reported, all these things. We became really smart, and we became really very resourceful. We started to get, early on I found Stella, early on I found Richard, early on I found Brian Tyson, so, and also Brian Proctor. So very early on, we kind of jumped for each other as lifesavers and lifeboats to help our patients because we didn't care what the CDC said. Obviously, it didn't make sense. We were like, they're not going to help us. So what did we do? We did what we always did in medicine. We called a colleague and said, hey, help me with this patient. I got this patient. Tell me what you would do. What, do you have experience with this? Because this is something that I'm trying to do and I don't know. And is there something I can tweak? We did that. We had open lanes of communication. It was amazing. If there is a silver lining of COVID, it is the fact that there are phenomenal doctors across the country that have now found a new network. And we are not going to let each other go anymore. I mean, this is it. We're each other's life vest, And I just thank God every day that that He brought us all together, and that He has made such a strong bond for all of us to be friends and to remain friends forever. And even better, we're colleagues, and we all have the same goals. We want to save people's lives. We want to help our patients, and that's all I care about.
Thank you, Angela. You couldn't have said it any better. We became each other's like lifesaver, and then we created like groups on Telegram and stuff, and it became like our support group. When we got kicked off here, we call each other and stuff, and it's great because, like I say, I think every one of us need to give props to Elon Musk for even allowing us to do these spaces and allow our voice to come out and allow the American people to hear the side that was kept away from them for 2.5 years, that allowed people to die. You know what I'm saying? So, we give props to Elon Musk for this, and I hope this continues because, like they were saying, this space needs to be shared to many people because people have to hear that there is a way out. You don't have to be scared. You're talking about the bug out back. We put together something I called COVID Care Complete. We created our own nebulizer, which is a handheld nebulizer, which you can use. It can be you can actually charge it with your your power bank. So because at some point we could not get nebulizers, you could call hospital clinic and they didn't have nebulizers, so we created ours. So we put together what we call the COVID Care Complete, and it had hydroxychloroquine, ivermectin, budesonide, a nebulizer, and Z-Pack, where we personalized, prescribed to you to keep in your medicine cabinet. We don't know what's going to happen. And I tell everybody right now, I can scream this on the rooftop. Please, America, please listen. Tell your family members, your friends, get this stuff in your medicine cabinet. You don't have to be scared of COVID. COVID is endemic. And let me tell you something, any other virus that they try, those RNA viruses, they can all be treated in the same manner. I know some of our people that are like, no, we allowed some speakers to come up that are not physicians so that they can ask questions. And, if we can have like Tracy, can you say?
I hear you guys. I've been listening to most of this. I was waiting for a spot to jump in because I'm gonna jump down. My husband's asleep right next to me, and if I speak too long, he'll wake up and he won't be very happy. But I really hope to have the opportunity to discuss everything that you guys have been discussing tonight from a journalist perspective in the height of this pandemic, because I felt like I was your megaphone. And trying to get early treatment information out to people. And, I was deplatformed and banned and banned from payment processors and all of that throughout COVID. And so I understand in a different way the plight that all of you guys experienced, but I just want to thank everybody up on stage tonight for everything you did for humanity, because without you, there would be a lot more people who didn't make it through this. And, there's no words that can express the thanks that a lot of us have for you. So appreciate you very much.
All right. I think, Melissa, you're our co-host. Maybe you have a comment to make. And then I'm going to go to Brian to tell us a little bit more. Specifically, we need to really dig deep into the protocols that we use. Yeah.
Hello, everyone. Yeah, that's actually what I wanted to have you guys go deeper into, like the protocols, and maybe talk to people about prevention, some of the supplements. I know Dr. Stella has great supplements that she has that have helped me and my family for sure for prevention, and maybe just going into like if somebody gets sick, like, how do they take the how do they actually go through the protocol? And I just wanted to say thank you to all the doctors that are on here for, going through what you guys had to go through. I mean, we all just watched in shock what was happening in this country. And it's just truly, truly unbelievable, coming from Zimbabwe myself and coming to America, the land of the free. The last 2 years have just been a total shock to see how much of our civil liberties have been taken away from us, being taken off Twitter. Dr. Stella was taken off Twitter. I know I was taken off Twitter, and thanks to Elon Musk, I'm back on. So it's just so amazing to see everybody back and able to speak, in a country that, that we've all thought to be, the land of the free. We all come here as immigrants and, aspire to live in a free country, and then, something like this happens. So I'm just really thankful to Elon Musk, and I'm thankful to doctors like Dr. Stella, Dr. Urso, and all the other doctors that are on here that weren't afraid to speak up, and were just heroes, total heroes. And thanks to you, so many lives were saved. And because of, you talking about all the treatments that you had, a lot of people didn't end up getting the jab, which is a great thing. So yeah, so that's all I wanted to say. So I just wanted to ask if you can maybe go into more about, prevention, supplements that people can take, and what they need to do if they do get sick.
Okay, Brian, can you talk a little bit more? Let Brian talk about how to treat just the protocols. Like, just if you had a patient, somebody walked into your clinic and you think they had COVID symptoms, what would you typically do? So that people can hear this and go ask their physicians.
Yeah, I mean, it's interesting though, because I mean, honestly, Stella, things have changed. And what we started with and the tools we had, some of those tools we don't have right now, and California being very difficult, it's even becoming a little bit more so. But I'll go into what for Alpha and the Delta variants, which are the really bad ones. What we would start with was hydroxychloroquine. That was the basis. 200 milligrams 3 times a day on day one. and then 200 milligrams twice a day, day 2 through 5. That had to be taken with zinc, either zinc sulfate, the 220, or the zinc 25 milligrams twice a day with your hydroxychloroquine. Again, you guys are going to hear you need a zinc ionophore, or you need something to help bring zinc into the cell to bind to the RNA polymerase. So that's what we're talking about. So we would use hydroxychloroquine with zinc. Then we were using Zithromax, because Zithromax would treat both as an antiviral and a antibacterial to prevent pneumonia. Now, interesting, why we continued to stay with that was we would do respiratory panels, and I do a 30-panel PCR, and we were seeing a ton of co-infections with both SARS coronavirus and strep pneumo, and Moraxilla catarrhalis, and Haemophilus influenza. These are all bacterial co-infections we were seeing along with COVID-19. So it made sense to us to stick with using Zithromax in the younger population, or doxycycline in the older population, because of that whole QT prolongation issue. We made sure that everybody took at least 81 milligrams of aspirin, or 325 if they were high risk. If they were over the age of 60, they also got apixaban to make sure that they had protection against blood clotting. We gave them melatonin because one of the melatonin studies came out that it was also over the counter, as well as D3 and vitamin C. Everybody knows that D3 and vitamin C help your immune system. So we gave them and told them to make sure that they had that. NAC hasn't been talked about, I don't think, tonight. 600 milligrams of NAC daily. That's N-acetylcysteine. That was a huge benefit in preventing the inflammatory cytokine storm process, as well as keeping down the viral replication. And then later we added ivermectin when the ivermectin study started coming out. And yeah, we did use all of this in combination. I did not use the 0.4 milligrams per kilogram that the FLCC uses. I used hydroxychloroquine with 12 or 16 milligrams of ivermectin daily for 3 days. And what we found was we had probably an 80% success rate with treatment. If the patient had respiratory symptoms, okay, and the respiratory symptoms we're talking about is they had chest pain, they had shortness of breath, or they had any evidence on chest x-ray, they got a shot of 12 milligrams of Decadron in our office, and we sent them home with budesonide, 2 milligrams twice a day for as long as they needed until their chest x-ray showed improvement. And I think that was one of the biggest things that we did. And we also added Singular and colchicine if we found those chest x-rays positive. With that, we added another layer of 19.9% cure rate on that. And then, obviously, if they needed supplemental oxygen, we would give them supplemental oxygen. But that was the basis of our treatment. When monoclonal antibodies came out, Regeneron was the first one. We did give those patients IV infusions in the clinic, especially the elderly and the really sick ones that we saw. We definitely gave it to them. We didn't care what stage of the disease it was. We gave them the monoclonal antibodies. The patients reported that it was helpful. And then as those changed from Regeneron to bimizumab and sotelimab and all the other mAbs, we would use those as they would come out. But now everybody knows recently they pulled them all off the market, so we can't even give those anymore. It's no longer EUA approved, any of them, so we can't give those out anymore. But we were doing that with IV fluid for anybody who had high heart rate, showing signs of fever. We treated dehydration in the office as well. So, I mean, that was the protocol.
Dr.
And
Tyson,
it was
can I ask
based
a
on,
question?
yeah.
Pediatrician here. I just had a question about acetylcysteine. Did you ever use it as mucomist, and did you find that effective?
I used Mucomist in the hospital, but I did not use it in the outpatient. I just went ahead and just had them buy the over-the-counter NAC, and just told them to buy that. And then it was really weird because after we were using that for a while, the FDA came out with a hit on that, and you couldn't even get it in the pharmacies anymore. You had to get it online, and only certain stores would carry it. But I didn't have any experience having to use Mucomist, but I'm sure it would be the same formulation. Richard might know more than that.
Hey, Brian, let me jump in on that one too,
Yeah.
because as a pediatrician, I'm also a pediatrician. This is Angie Farella. And Mucomist in our local area, we couldn't even get it at the pharmacy. We could not even get the nebulizers, the nebulized medicine, because I knew how to use it. Obviously, I have a couple of CF patients in my practice. And so I jumped to try to get Mucomist, and we couldn't get it, could not get it. And so that's when I kind of pivoted, and I was like, well, forget it. I'm just going to use the good old-fashioned albuterol, levoalbuterol, and budesonide, of course, oral steroids, and all the stuff that everyone else said. But I really hit people very, very hard with vitamin D. I used super high doses of vitamin D. Lots of studies in the early 2000s that showed the higher your D, the better your responses to reactivity in your lungs. And so, there's an inverse proportion. The higher your D, the less asthma you have. So that was kind of my go-to at the time. And then I gave oral and acetylcysteine, or the NAC, so that was a cornerstone of something that I was doing. And I thought about that early on, but I could not for the life of me get it.
Yeah, we started using.
So just to talk about the Mucomist, the oral versus the IV, I think the IV was there. So there's probably some difference in pharmacokinetics, but it's not considered major difference in the outcomes. The Mucomist, the IV administration is basically a lot of originally developed for Tylenol toxicity, where a lot of those patients, when they're having severe issues, are in nausea and vomiting stages, and so the oral administration wouldn't be able to be administered. So I think I don't know. I haven't looked at it in a long time, but the pharmacokinetics might be a little different. You might get a little bit of extra oomph out of the IV administration. Certainly, you can. The whole point of it is to create a glutathione, raise glutathione levels, which of course can be administered IV. So in some sense, I think the oral administration is very, very powerful in this case.
Yeah, we did use NAC. We used NAC, and we used zinc, vitamin C, D, zinc, and NAC. We used that quite early on. And because we finally got pharmacies that were like mom and pop pharmacies, we were able to get all of them to stock all this stuff and be able to get it to the patients. And we know there was a doctor that is actually being sued by the government right now because he encouraged the use of vitamin D. And so what I would tell, like I said, it's back to actually really being practical. As what we would tell people to do practically, like I said, get your vitamin D, get quercetin, get zinc. And in this, I have a protocol. Richard and I produce a protocol. We call it Covivites, that has vitamin C, D, zinc, and quercetin, or just get it over the counter or buy it on wherever you want to buy it. But it's important that everybody has the mindset of COVID is endemic. If you have the mindset that COVID is endemic, you start having that little cold, just take your vitamins. You know what I'm saying? And I would say it 500 times, get hydroxychloroquine, ivermectin in your medicine cabinet. We're going to open up the space for people to ask questions. We're just going to open up the space. People that want to ask questions, you can request, and then we can let people ask questions before we go off. With something else, Brian, there's one thing I noticed in my treatment protocol with patients. I found out that the difference between somebody surviving COVID, especially in above like the age of 60, if you gave them fluids, dehydration was one of the main reasons that older people went down. So if we were able to give them IV fluids, and we usually will put like vitamin B complex in their IV fluid, and so that it will give them energy and they'll be able to get up. And because when COVID knocked you down and you can't walk up and down, the more you sit down, the more your lungs get oppressed and the more you get sicker. So we're able to get people up and walking up and down and giving them it gave people energy, and we encourage people to eat. I was like, eat, drink, even if the food tastes like wood, which is probably going to taste like wood, you need to eat because you need the energy, because COVID is a very hypermetabolic state. And if you don't have the energy, you're going to be weak, you're going to be drained, and that is what brought a lot of people down. That is the weakness, the drain, and then the respiratory symptoms got people to run to the emergency room, and most of them never came out. We were very, very, and still do, giving budesonide and Zoponex, levoalbuterol treatments in the clinic. That got people better very, very fast. Even till today, when we take care of patients, usually we will ship the hydroxychloroquine and ivermectin to you. But if people can get, we call in zinc, we call in budesonide, and we try to get them a nebulizer so they start taking it immediately. Most times they start getting better with just budesonide nebulizing treatments before they can even get the hydroxy and the ivermectin to get to them. So these are things that, like I said, we're telling you some of these things. We want you to know it. Ask your doctors and think about you and your family. And remember that this is war. I don't think this is not even science. There is something nefarious and going on against humanity. The medical industrial complex, it looks like the kings of the world have waged war against the people of the world. And that is why I tell everybody, be aware of the fact. Think about your family, how to protect your family. And we're doing Melissa and I are writing a book on preparedness, not just in medical preparedness. And in other words, what are the 5 antibiotics you will need in an emergency? What are the 5 over-the-counter medicines you will need in an emergency? What do you how do you get your medicines? Like if you're on diabetic medication or you're on high blood pressure medication and you can't get it, what do you do? So we're putting that together because I'm sure every one of us on this space and other people that are going to watch it have this sick feeling in them that says this is not over. So my mindset is to get people ready and prepared to stand whatever it is that they do. And so we're going to open up. Bob wants to say something, and then we're going to open up for people to ask questions.
Okay.
Dr. Before you open the questions, I'm going to give a little bit of instructions for the audience. Please make sure that you ask your question within like about 30 seconds. We probably won't have time for stories. We just want you to address the doctor that you want to ask the question right away. And then after Bob, we're going to go to Heather. She'll ask the first question. And then I am going to be asking people to drop themselves out because we're limited on only to 10 speakers at a time. So we need to be bringing on the next speakers. Thank you. Go ahead, Bob.
Okay, just really quick. On the vitamin D thing, I just wanted to point out I had read that it's really important that you have your vitamin D levels up before you get COVID. That like trying to take massive amount of vitamin D when you get COVID is maybe a little, it's hard to get enough in your system fast enough if you've already got a deficiency. So I'll just put that out there for the doctors to comment on. And also I did read that there was some interactions like where on the FLCC side, I think it said like that you shouldn't take at the same time as ivermectin. I can't remember what it was. I just remember that there was some stuff about that you should take some, if you're taking a lot of all these drugs that you shouldn't necessarily take all of the medications at the same time. And the other thing was Renee was putting some stuff in chat, and she was wanting to ask a question. For some reason, she couldn't get in a request, but over.
Yeah, we're going to open the floor.
Let me answer that on, we're going to open the floor in a minute. Let me answer that on taking quercetin and hydroxychloroquine at the same time. Yes, you can. And the FLCC, yeah, they have a protocol, and I think they are ivermectin only. We have other people that are budesonide only, and people that are hydroxychloroquine only, and stuff like that. This disease has to be managed with many different things. You understand what I'm saying? So the disease I gave hydroxychloroquine and ivermectin and quercetin and zinc and vitamin D to sick patients. Depending on how sick they were, sometimes we gave them a full course of hydroxychloroquine. We gave them ivermectin day 1, 3, and 5, or maybe just one dose. So it's all depending on the patient and how they respond. Is it safe for you to take hydroxychloroquine, ivermectin, and quercetin and zinc? Yes, you can. It's safe for you to take it. So far, we haven't had any people come with side effects from that. And if you look at quercetin, you can take it. And Dr. Also, if there's anything to say about that.
Yeah, I was specifically wondering about time of day. I understand you could take them all together, but I was reading something that I thought that you weren't supposed to take them all at the same time of day, even if you take them all together. Go ahead.
So let me comment on that. Basically, when you're dealing with what we were dealing with, and I don't want to be fussy about this, but in a sense, you're losing the forest for the trees. That's what Stella's saying. Okay, you're spending too much time thinking about something that doesn't matter that much. And I'm not picking on what you're saying, because it can be really critical not to mix certain medications together. So you're basically talking to somebody who's treating hundreds of patients a day, and in a sense, the criticalness of what you're asking is not that critical clinically. That's the point. So that's the point. Like there are things that actually matter, and then there are things that are theoretical. And Brian, do you want to comment on this, because you give them specific instructions? There are people who can't take pills. They can't take more than 2 or 3 at a time. At the end of the day, they want to get the medicines in. They want to get them in the body. They want to get them absorbed. Ivermectin does better with fatty food. I don't know what it says on the thing, but I can tell you I've been mixing eye drops for it for 20 something years. And I can tell you that if it doesn't have an oil base, it doesn't penetrate as well. So, it's with a fatty meal, it's better. But I don't tell the patients that to the most part. I tell them maybe a little bit. But at the end of the day, you're losing the forest for the trees when you're in the middle of people that are sick that very day. So it's not a critical component of the actual care. And I think that's the main point what Stella was trying to say. Brian, you want to comment on that?
Yeah, I mean, I'll just tell you, I mean, we've treated, over 20,000 patients. So a lot of what you're hearing is upset stomach. A lot of people can't handle taking all the pills at once. So it is better to space them out over time of the day. We didn't really care what time of day you took it, or how you took it, as long as you ended up taking all of them at some point during the day. Ivermectin.
Go ahead, Brian. Go ahead.
No, I was just going to say ivermectin. We did also tell them to take it with their meal, because most of the time, especially in our environment, they're going to have some fat in that meal. And then we also had them follow that up with the Pepcid for the dyspepsia and stuff like that. That would help.
Yeah, and that's another good point. I mean, Brian, that's probably what I should have thought about that, because when you take a bunch of stuff at the same time, it is a load, and especially I know hydroxychloroquine. I got a lot of upset stomachs with hydroxychloroquine if you give too much too fast. So I mean, it makes a difference. But in the way, and I think I was reading into what your question was is it clinically important? It's clinically important because, like I said, patients, when they get those loads, they don't want to even take the medicine. If you get an upset stomach, then you feel even worse from that. But I mean, as far as outcomes, clinical outcomes, it's about getting the medicine in your body, getting it absorbed, and letting it get to work. And so I don't know why they have that on FLCC website, but it's not a critical point in the whole care. Although I've had patients vomit everything up because they took too much too fast. So that's kind of it's a good question. But in a sense, there's the answer is more in what Brian just said.
We had a lot of patients that came with GI symptoms that had diarrhea and vomiting. And most of the time, if you did not address the diarrhea and vomiting, they could not tolerate the rest of the medication. So we were giving people sometimes Zofran. And if we gave Zofran, because Zofran and hydroxychloroquine and Z-Pak, they both all cause QT prolongation. If we're giving Zofran, if they were taking, we'll probably use doxycycline. So we all tweak stuff together to make sure. There's one thing that we did for our patients that were coming to the clinic is that we got our patients to come, especially when they started developing pneumonia, they came daily and they got Rocephin shots. So we gave them, if we did 5 days of Z-Pak, and if at the 5th day they were still sick, we put them on doxycycline, and they came daily and they got Rocephin shots. And if they came in and they need IV fluids, we gave them IV fluids. We found out that managing these patients daily was really worked wonders. Even patients that we were seeing via telehealth, we basically saw our patients and followed them up till they got better, and followed them up till they needed, if they needed more medicine, we called it in. If they needed if they needed IV fluids, we started encouraging our patients to drink at least 2 liters of Pedialyte or some kind of light. So we encourage them to drink in a day. So we'll tell them to make sure that they're taking 2 liters of Pedialyte. That's what we encourage them to take in a day, and they should try to get it down. So we had to give them something to stop the nausea so that they can be able to get these fluids down, because if they didn't, they're going to get dehydrated and get sicker. So it was a comprehensive treatment. We had RNs on call that would call the patients every 2 days and see how they were doing. And, so it was a comprehensive thing that we all put together. And, it's something that, like I said, other doctors could probably glean from, and we all helped each other. We'll call each other to check what was happening. What do you do for this? What do you do for that? And it worked out. And we've created a community that has actually been here to take care of people.
Yeah, and so that's a great point. I just want to tag on, Stella. One of the things that happened was, like, for me, once I started realizing there may be an H1, H2 blocking be very important, I started using, if I needed to do something for nausea, I started using Phenergan, because it blocks H1 and H2 receptors. So I think in general, little nuances occurred, and the electrolyte replacement was really important. The other thing that I found really important, once I started giving steroids, a lot of these patients the sicker patients were insulin resistant. And so I basically put them all on 0 carb diets for the time they were taking the steroids. So I basically say, hey, you've got, a week where you can't eat carbs. And, I gave them bone broth. That was a big part of one of the things, because when you're in the ICU, constantly can measure glucose, and you can constantly have a sliding scale of insulin. But in an outpatient setting, you're going to basically drive your patients into a ketoacidosis state if you're not careful with steroids. And at one point in time, as we got in the Delta, I was using 100 and even 120 milligrams of prednisone, even up to 140 on some days with really bad patients with the SATs down in the 70s. So I think in some sense there was a lot of nuanced treatment as we went forward, and we never had just one protocol that we were stuck on. It depended on the patient. They got diabetes, I might adjust it. If they were nauseated, we all started doing little things differently. So it's great conversation actually to have this, because that's basically what we were doing. And that's why these hospital protocols were absurd, because there's always something a little bit different about ages, the comorbidities, et cetera, for each patient.
Exactly. So we're going to go to...
There was one more thing that we haven't mentioned either tonight, which I found was actually pretty useful, was opening the windows of your house and having your patients walk around the block. So we would tell our patients to walk around outside. It helped with circulation, mobility, and fresh air in a time where everybody was told to stay inside and stay at home. And that fresh air and that walking around seemed to help out a lot as well.
Okay, so we're going to go to questions and answers, and let's see. I think we're going to start with Nikki, if you want to say something. And like Carolina said earlier, we can only have 10 speakers at a time, so we might have to drop some speakers so that we can let people speak. And once you speak, you ask your question and it's answered, we'll drop you so that other people can come on. All right, I think Nikki, or is it Heather? Let's start with Heather. Heather was going to say something.
Yeah, it's Heather, and then it'll be Micah, and then Nikki.
Okay, go ahead.
Hey, thank you guys, and thank each and every one of you.
Go ahead, Heather.
Yeah, can you guys hear me?
Yes, we can.
Okay, thank you guys for putting on this space. And Dr. I'm really interested in that future vaccine injury space that you're going to be hosting. So if you could keep me in the loop about that. I don't think I've seen a Twitter space on that yet, like how to treat the vaccine injured. But my question is for some of the doctors here that have mentioned that you guys had found successful treatments, but then they became hard to obtain, or you just couldn't get them at the pharmacies and stuff. So do you think that was attributed to like a higher demand that the supply couldn't keep up with right away? Or is it something more nefarious where
government agencies are getting involved in directly suppressing treatments that they know are effective at treating COVID. Because I personally testified on a bill here in my state of New Hampshire to make ivermectin available over the counter. And actually, Dr. Paul Merrick flew in for it, which
Yeah,
some of
seems
you may
like
know.
Molly is getting in and out there. There was no initially when we started out, the government actually hoarded hydroxychloroquine. Hydroxychloroquine was hoarded. It was put in different states, and they were not allowing doctors to use it. They hoarded it everywhere. At that time, I started using mefloquine, and then they opened up, and then hydroxychloroquine started coming in. There's never been a time when, apart from that early time, there's always been hydroxychloroquine. It's a common medication. It's manufactured by every Tom, Dick, and Harry pharmaceutical company. It's all over the place. Ivermectin is all over the place. So there's never been a shortage. The issue was doctors were scared to prescribe it. Pharmacists refused to fill it. And then we had to go through creating our own, like a closed loop system to take care of people. And then most importantly, people did not have the information that it worked. And if there's anybody else to say anything about it.
Yeah, it was totally nefarious because the pharmacist would ask you what you're using it for. And if you said COVID, they would not fill it. And that's not a supply issue. That's just being evil. And I don't know about the other docs, but I had them refuse to fill doxycycline. I had them refuse to fill Singulair when a patient had a breathing problem, budesonide. You've got a patient in front of you short of breath and you won't give them breathing medications. I mean, that's just evil.
So in situations like that where doctors like yourself are
Okay, where's I think the next person?
Oh, okay, sorry.
Yes.
Yeah, Nikki was gonna say. Okay, Nikki.
Oh, sorry.
I'm going to go right off what she said because my aunt actually called for help for you, and she...
Was Nikki gonna speak? Can we hear you?
Can you hear me?
We can hear you. I can hear her.
Yeah, I'm asking Nikki to Nikki was lifting over. Okay. Carolina, call the next person.
Can you hear
Nikki
me?
was speaking. I think you weren't able to hear her.
Oh, Dr.
No.
Stella, you might not be able to hear her. There's a
We're in the
glitch.
question and answer session, and we're trying to make sure that people are able to speak and say what they wanted to
Nikki,
say.
drop out and come
or give a contribution.
Stella, I think you're not here. I think.
Okay, Nikki, I think you can speak now. Unmute yourself and speak.
Can you hear?
Yes, we can hear.
I don't think she can. Should I just drop out and come back up?
Yeah, please. Dr. Stella, can you hear us?
No, we should. Stella
Something
probably
is
needs
not
to
going
drop
right.
out and come back. Stella needs to drop out and come back. I'll text her.
Well, she can't because then we'll lose the whole space.
Oh, okay.
Can you guys hear me?
Yes.
Yeah, we all hear you. Maybe somebody try to speak, see if she can hear any of us.
Okay,
Stella,
Nikki, we're
can you
expecting
hear
you
me?
to speak. Can you unmute yourself and speak? Okay.
No, Stella, she's speaking.
Can you call Stella?
Okay.
Just give her a call.
I can't hear her either.
Stella, can you hear us?
I can hear
Molly,
you guys.
try speaking.
Stella, you're not hearing Nikki.
Stella, who can you hear? Point out who you can hear.
Okay, Dr. Lori, talk. I don't think she can hear Molly, Urso, or I. Dr. Urso.
Hello, can you hear me?
No, she cannot hear you. Oh, Melissa, can you try to speak, see if she can hear you?
I'm going to drop out
Hi.
and come back in and see if it helps for
Dr.
me, okay?
Stella, can you hear me?
Okay, now I just heard because I wasn't hearing, but now I can hear. Who can you hear? Okay.
See, Stella, that was God talking to me, talking to you. So
now I can hear. Go ahead.
We're all praying.
I know,
Please,
right?
Lord, bring
I was muted. I couldn't hear anybody.
Okay, we're going to go with Micah.
Stella, that's the first time I've ever done that. You've done that for me. So, you opened my eyes, and now I open your ears. Wow.
I am wondering whether any of the doctors are aware of the role of selenium in viral infections, because selenium is there's this German physician who explains it as selenium kind of functions for lay people. He says it's like birth control for viruses. If you have a virus, let's say any herpes viruses, if you're low in selenium, you will have more outbreaks than if you are on regular selenium. And especially with chronic spike proteins in the blood from getting the vaccines, especially now, listening to all of you, you're talking in the past about the early treatments. And I'm sure there's still people who have COVID now who need early treatments, but it sounds like it's gone down. And the next wave of patients is going to be vaccine, people who didn't tolerate the vaccine very well or who keep getting COVID or, spike protein acting up that they get from the vaccines. And I'm just wondering whether there is awareness about all that selenium research. And if there isn't, I think I'm in contact with Carolina. I can contribute more information about that. I just thought about it listening to this space. So I'm not prepared to say that much about it, but I could prepare myself for another space and talk about this
we're actually
incredible
have another space pretty soon if you want to give him a chance to answer the first question.
Yes.
Yeah, Dr. Oso, can you answer that? And then, yes, we're going to be doing a space on vaccine injuries.
So selenium's been looked at for many years. There's an actual increase in cancer rates with high dose of selenium. So you've got to be really careful, and that's why most people won't really put it on their list. You don't want to be deficient, but it's been done. Multiple studies have been done on selenium, and there's a toxicity issue with it, and that's been one of the reasons. It's easy to get into toxicity. I know the guys who are working with it, the guys you're talking about. They know this already, but this is why you don't hear a lot about it. It's a known problem. It is associated with higher cancer rates when you do that study's been done on selenium and cancer. I was very involved in the 1980s looking at natural supplement derivatives that could actually be helpful in cancer, and selenium was one that we looked at. And I can tell you that in the animal studies that we did, selenium was the one that actually increased the cancer rate. So it's a drug that, it's a vitamin that has a necessary nutrient, but there's a lot of issues with it. And for the most part, it'll never take off in a big way because it's really not as powerful as some other things. Vitamin D is way more powerful than selenium. I can tell you just from my own research, and that's from somebody who's been doing that kind of stuff for, going back 40 years. And I'm happy to kind of go over the studies and talk about it more, but I don't think it deserves a lot of talk on this conversation today. Thank you. Over.
Okay. We have a speaker from Colorado, Lorena. I think I want you to speak. I'm actually licensed in Colorado, so
very special guest, Congresswoman Dr. Laura. I wish Dr. Laura.
Lauren, yes.
Robert, coming in.
Yeah, let Dr.
More appropriately, GED Lauren Boebert, Congresswoman from Colorado's 3rd District. But thank you so much for having this space about COVID-19 and early treatment and all of the misinformation that has been spread about COVID-19, the Twitter files that were just released about the financial gain from Big Pharma, Pfizer regarding COVID-19. This is extremely alarming. But I want all of you to know that the GOP, the new House majority in Congress, is going to tackle this at an oversight level to the best of our abilities. We are going to issue subpoenas. We are going to bring in Big Pharma. We are going to bring in the CDC. We're going to bring in Anthony Fauci, and we are going to hold them accountable to all of the lies that were spread over the past few years, shutting down small businesses, saying that they were not vital, that they were not sufficient to be operating, and many small businesses closed and will never reopen because of government overreach. The military personnel who were discharged, the frontline workers who were discharged for refusing the vaccine when we were told that the vaccine prevents you from ever getting COVID-19. And that is a complete lie. And the Twitter files show that there was censorship of the American people And I just want you all to know that the Judiciary Committee, the Oversight Committee, and many other committees in Congress are going to be issuing subpoenas for the people who were in charge of this and exposing the truth. I was on a Twitter space earlier today with Dr. Drew, and we were discussing the importance of the Twitter files and the release of that, and the effect that government overreach had with COVID-19. This is a huge problem in the United States, and this is something that I am aiming to get on the front lines of and combat. You know, one thing that we see is the Democrat Party, they're always in unison. But why? Because they can't think for themselves, because they need leadership to tell them how to think. And then as soon as Republicans take the majority in the House of Representatives and we have an actual debate on the House floor over leadership issues, over important issues that matter to every single American, over the position of who is going to be second in line to the presidency of the United States of America, and the issues that we have with that, what concessions we want, what we want Congress to look like, and reflect in reflection of that speaker's vote. We hear, oh my gosh, it's chaos, it's dysfunction. Listen, y'all, I am a mom of 4 boys. I know what chaos and dysfunction look like very well. This has been a part of my life for a very long time. And the week that we saw with the speaker's vote, that was not chaos. That was not dysfunction. That was the most productive week I have experienced in Congress to date. We were engaged. 434 House members, representatives present on the House floor. There was 1 vacancy. We were present on the House floor debating the issues at hand. And we had conversations, engagements with our colleagues on both sides of the aisle regarding the issue. And we built relationships, we strengthened relationships, and we're coming out of this stronger than how we went in. We were able to get the concessions that we made into order. And to Speaker McCarthy's great credit, he accepted them. He saw the merit in what we were requesting and accepted them. Now we will have single subject legislation. Any amendments made to legislation, whether it be the House or the Senate, have to be germane to the actual title of the bill. No more Nancy Pelosi con game, where you title the bill one way and get to load it with a bunch of garbage that means nothing to the actual title of the bill, like the infrastructure bill, where we spent $1.2 trillion and only 9% of it went to anything infrastructure related. So no more of that. No more omnibus bills. No more $1.7 trillion omnibus bills where members of Congress have less than 24 hours to actually read the legislation. We have 72 hours to read a bill now before we actually vote on it. So the Senate is held to that. They no longer can just send us over an omnibus bill and give us no time to read it before we vote on it. No, they have to send us 12 individual appropriations bills, and we have 72 hours to read each bill. So all of this is, I believe that it is very beneficial to the American people and shows the American people that we are taking this majority very seriously, no matter how slim it is. We are taking it seriously, and we are going to be effective in everything that we do and holding the federal government accountable and holding the federal government accountable to the overreach that took place with COVID-19, and holding Big Pharma accountable, and holding the CDC accountable, and holding Anthony Fauci accountable. And I could go on and on with so many other agencies and individuals that we are personally going to hold accountable, because the American people have been done so wrong during the past few years. And I just am so appreciative of you all allowing me on this space, giving me the mic to speak. And I'm happy to answer any questions that you may have.
Congresswoman, I have a question.
Yeah.
I just want to, sorry, could I just ask a quick question? Could you add to that list that you're going to hold accountable the licensing boards? Because us physicians who are trying to do our job are constantly held to the fire by the same licensing boards that are supposed to be protecting and supporting the way we practice, because we're actually upholding our oaths that we took.
Yeah,
Dr.
and
Urso.
Lauren, this is Richard Urso, Dr. Urso here. Stella, Molly here, and Brian Tyson, myself. We've been working with the Conservative Partnership for the last 3 years significantly. We've been over into the Senate with Ron Johnson and some of the others there, Mike Lee, Cruz, Rand Paul. We've spent time in Washington. We're happy to lend a hand. We actually know what medicine is supposed to look like. The agencies have actually let us down. They are captured, and we understand a lot of what's happening there, and a lot of us can help. So we'll be reaching out to your office and would like to participate. We're already really close with Chip Roy here in Texas, and Andy Biggs and Scott Perry. Those are the guys that we know pretty well. There's a few others in there, leaving out Tom Massey. So we'd love to work with you on that, and look forward to doing that, because there's a lot of work to do, and we understand where the failures were in medicine in the agencies. As I said, I actually invented an FDA-approved drug. I know the industry not really well as some do, but I know it well enough to know what's going on now needs to be changed. And those guys do need to be held accountable, because they actually know that their policies killed 90% of the people. That's what happened. Thank you.
I'm glad, Congresswoman, that you're on tonight with us, and I'm thankful for you coming on and speaking. Like I said, I'm licensed in Colorado, and I'm proud of that. We were silenced, we were shut down, and we were not allowed to give the American people the information they needed to stay healthy. But we stood up and we fought. Brian Tyson is here with me and other doctors, and we really fought to make sure that we were there to take care of the American people. Like Dr. also says, we are available, because we need to be brought to the table, so that everybody needs to be brought to the table. I keep saying that we need to have a post-mortem. What happened? How was the medical industrial complex able to overcome people? What happened to the doctors? If we don't sit down and confront what happened, identify what happened, like I said, everybody has this queasy feeling in the stomach that something else is going to happen. So we're thankful for you being here. And you know what? I think the best thing that happened to our Congress this time was the slim majority, because it made it made them sit down and listen. And I'm glad
Amen.
for what you guys did. I watched you guys. I was like, this is what democracy looks like. And I'm thankful that you guys stood your ground and make sure that things can be done properly. And yeah, so we're here. You can always, contact us, and we will be there to make sure that we give whatever information and experience that we've had to take care of the American people. Thank you so much, Congresswoman, for joining us.
Yeah,
Thank you, Dr. Emmanuel, and thank you,
amazing.
Dr. Urso. I first want to start with, yes, we will be holding the licensing boards accountable. This is something that I will take up personally if other colleagues don't do so before I do. But this is something that we absolutely need to take charge of. There was so much misinformation, disinformation, censoring, silencing of the American people during the COVID-19 outbreak. I'm a small business owner and never intended to be in politics, never intended to be involved with the federal government. But during my first campaign, my restaurant was shut down through overreach of the state government. And they shut my restaurant down. And this really just ignited me to fight even harder and take a stand for the American people, for those who have been silenced. Through this, we've had questions, we've had concerns, we've been shut out, we've been called conspiracy theorists. And now there's so much information that shows that we were on the right side of the argument. And so I'm happy to work with each and every one of you on this issue. And I certainly applaud Congressman Chip Roy from Texas. He has been outstanding in all of this, even with the speakers debate. He was one of our masterminds behind the negotiations that we were making. Congressman Matt Gaetz from Florida was imperative to that. And we had started that debate months before the American public had seen the inner workings of that. We started last summer and were not taken seriously because there was supposed to be an overwhelmingly Republican majority. And that red wave did not manifest. And so we ended up with this slim majority where us conservatives had to be heard. It was unacceptable to ignore us. And unfortunately, we were somewhat ignored for a few days while negotiations were still being reached. But I could proudly say that we came to better negotiations and agreements at the end of that than how we had even started. So I'm extremely proud of Congressman Chip Roy, Andy Biggs, Matt Gaetz, and others who sat in all of these aggressive, rigorous meetings with myself, with the speaker, in regards to the changes that would be made. And my hope is that we can make the American people proud with the investigations and the hearings that we have on judiciary, on oversight, and on other committees regarding all of these issues and so many more. There are so many more. And I hope that we don't let you down. I have been just a citizen looking from the outside, an armchair quarterback saying, Congress, why aren't you doing this? Why aren't you doing that? And that's what's led me to be where I am today. I never intended to be there, as I said, but I wanted to do my part to serve my country and produce results, to be a part of the solution. And so that's why I stepped up. I left my family, which is an understatement. I see my 4 boys maybe 4 times a month, which, I'm not expecting any applause or gratitude towards that, but that's the life that I chose. I leave my family every day to fight for my country and get the best for each and every one of you. And I'm proud to do so. And so I'm honored to be back, to be fighting for you, no matter what capacity that is, that I'm fighting for you in. Just know that I have your best interests at heart, and I am advocating for you every step of the way. I am not a politician who considers the next election. Are you going to be reelected? Is this going to be the end of you? I don't care about that. I care about what is right. And that's what I'm fighting for each and every day. And that's why I'm here with you guys. And I'm so grateful for you that you are so interested and concerned that you're spending your evening on this Twitter space to be more informed.
Thank you,
Laura,
Congresswoman.
Dr. Denver.
Amazing. I just want to say, we all watched you over this last couple of years, and we know what a warrior you are. You were like, I would actually watch your commercials, and I didn't watch many commercials. But you've been a warrior, and thank you so much for your words of encouragement and your words, doing what you're doing for your country. It's so powerful, and thank you so much.
Wow, it's amazing. It's amazing. Congresswoman, I check your re-election every minute, 3-4 times a day. Did they get her back? Is she coming back? So we're grateful to have you. And so, Carolina, I want you to open up for other people that are here that want to ask questions. And
Dr.
please
Denver,
limit your questions to
Dr. Denver and Chaya, I believe, have a question real quick. We'll go to Denver, and then Chaya.
Yes,
sure.
Thank you for the opportunity to speak. My name is Denver Euland, primary care physician in Minnesota. Pleasure to talk with Congresswoman Boebert. And my concern overall with what we're headed into is that the World Health Organization met last week and discussed amendments to the international health regulations, and they'll be voting on these in May. And as I understand it, there's the potential to hand over sovereign decisions from our country regarding pandemic management to the World Health Organization. And I'm wondering if that's on your radar.
Yes, thank you. So that is on my radar. And honestly, anything that hands over our authority to the World Economic Forum, this is problematic for me. And I am absolutely opposed to that. We have members in our own party who are aligned with the WEF, which is extremely concerning. And that's why, as mentioned before, I'm so grateful that we have such a slim majority, because any 5 of us at any time can shut down anything that the majority is trying to do if it is unlawful, unconstitutional, or unbeneficial to the American people. And this is something that I am very much opposed to. The World Economic Forum has a plethora of comments and statements from it that oppose the conservative agenda. In fact, they even say, that they're pushing for a global liberalism agenda, a global liberal world order or so. And so this is something that is extremely alarming to me. The WEF is not something I support, is not something that I look to for knowledge or insight, other than just knowing what the deep state has for each and every one of us. And that's not a conspiracy theory quote. The deep state is very real. I work in Washington, D.C. I know how it operates. I know the effect that it has on political decisions. When we take the speaker's vote, for instance, there were plenty of lobbyists who were coming after us. And I don't think that that's how the American people should be reflected, is through the persuasion of lobbyists who.
Oh, Congresswoman, go ahead. I think somebody accidentally hit the mute button.
Oh, sorry about that. I guess they wanted me to stop speaking.
No, go ahead.
But yeah, so I mean, lobbyists have a lot of pull. I don't know where I was muted, but lobbyists have a lot of pull in Washington, D.C., and that's something I'm certainly opposed to. I take very few meetings with lobbyists. It has to be something that I'm very supportive of, to even take the meeting. And certainly to take the check. But there are $5,000 checks that are offered out to members of Congress from lobbyists on a regular basis in exchange of their vote for something. And I would much rather receive a $37 contribution from a supporter in the district than a $5,000 check from a lobbyist who is trying to dictate the direction of our country. And I'll stop it with there and leave it up for another question.
Shaya, go ahead.
Yeah, something I brought up in another Twitter space call, and a couple of the doctors were on there, said I should, repeat this conversation, is about fertility issues post-vaccination and even maybe post-COVID. And this is also for the Congresswoman. She's got 4 sons. At some point, they're going to get married and have kids. There's a very big high concern that we're not looking at fertility levels, doing egg reserve testing. And any of the physicians, if they end up speaking to you on the side, this is something that needs to be put out as a PSA, that any teenage girl and above or young woman looking to have kids, whether they've been vaccinated or had COVID, they need to have a baseline egg reserve check done. We don't want it to end up to be like the movie Handmaid's Tale, right? So I think that's something that needs to be looked at. Part of the security of our country is that we're able to have reproduction here, and we don't have to source it outside of our country. And then our blood supply. I think that this has come up. I think you've seen some cases. There's patients that take certain medications like IVIG, and people are concerned about vaccinated blood and all this. And there has to be some type of a system where people have the ability to access their own unvaccinated blood if possible, and what that looks like. I don't know. I think
we're gonna be doing. Let me answer that. We're going to be doing a space actually on the vaccine injury, and COVID long symptoms, and why we want to make that like a space on its own is because there are a lot of questions. There are a lot of technicalities, and that we really need to sit down and dig deep into the vaccine, what it is, why it causes the problems, and we're going to be holding a space on that. So if you stay tuned, and we would talk about that, and then you can
Yeah.
probably bring up some
And,
Yeah.
of the things.
and if I
Yes.
could respond briefly, there's been a lot of sudden deaths in America that has risen extensively. And how do you tell someone you love, "I told you so"? Do you send a letter? Do you send a card? Do you send flowers? Do you make a joke? Make it funny? It's really, how do you say "I told you so"? Because we were called conspiracy theorists for so long in saying the vaccine isn't ready. It's not what they say that it is. And this was an extreme concern. I'm not a medical professional, so I can't provide medical advice to anyone. But for me and my household, we denied the COVID-19 vaccine. We did not take any COVID-19 vaccines, and now we are seeing potential effects regarding the effect of young youth trying to procreate and have their own children. We've seen the sudden deaths, the heart issues that people are having and suddenly dying, seemingly perfectly healthy people who are suddenly falling over dead with heart attacks. And this is something I refuse to normalize. Not being a medical professional, this is something that I find highly concerning. There are vaccines that I would not allow my children to take even before COVID-19 because I wasn't sure of if they would be sterile afterwards. I was concerned for their safety, and I'm very grateful. I'm actually going to be a Gigi, not a grandma, not a granny. I'm going to be a Gigi in April, and I am so grateful that my son and his girlfriend chose life. I'm grateful that they were able to procreate. This is something I guess this is the first time I'm coming public with on this Twitter space. But this is
Thank you. I
something.
was gonna get it from Shauna, your mama, anyways. So awesome! Yay,
Carolina. I don't even have to look. I don't even have the screen up. That was Carolina.
yeah.
Also, Congresswoman,
Yes.
universities are still requiring the kids to get boosters, and athletes on those university teams, even though they're being required to get their boosters,
Even with the CDC coming out and saying that there's issues with these, that is extremely alarming. We have been battling at the top line our military personnel, our service members, and we have to take it further. We have to take it further to our frontline workers. We have to take it further to our college students. I'm ashamed to say we've only taken it this far, but we've taken it as far as we could have gone with Democrats in the majority. Telling Democrats, look, this is our service personnel who are being damaged by this procedure. And we have to take it further now that we're in the majority, and be sure to communicate to the American people that it's everyone who has been forced to take the vaccine that is in a precarious situation. And so this is our responsibility to communicate, to politicize. I'm fine with politicizing it. The Democrats certainly have. The Democrats politicized making this a priority. It was on every news station, whether it was Fox or CNN, it doesn't matter. It was on every news station that you have to get vaccinated. It was in every radio ad. It was in all of the newspapers as flyers and all of this stuff. And so they politicize this, and we have to politicize normalizing natural immunity over the vaccines.
Yeah, I'll tag
Dr.
on real
Molly.
quick. let
Go
me
ahead,
tag
Dr.
on,
Urso, and then we'll go to
Caroline.
Dr.
Yeah.
Molly.
So I'll tag on because it's three. I'll give the quick summary. So we know data on fertility, 35% reduction in sperm counts in Israel. There is some recovery, but who knows what happens after 4 times. We also know that there's high accumulation in the ovaries. There's lots of ACE2 receptors. That means lots of production of spike. That means lots of inflammation. We know that means there's going to be a change in fertility. What do we see in the data in Europe? 8 to 10% decrease in fertility this year in all the countries that are about 75% or more vaccinated. Then as far as the blood supply, of course it's in the blood supply. It's no assay or anything being checked for. Number 3, the mandates are ridiculous because it's ineffective and it's harmful. And lastly, what Congresswoman Bober just said, natural immunity is the Achilles heel. If you give a vaccine to an already immune patient, some of those are going to have a hyperimmune response. Some of those are going to die because of it. And you take those children between under age 11, it's 0.1 per 100,000 infection fatality rate. That means that group has a 1 in a million chance of dying from the infection. You give that group who's 80% already has natural immunity, you're going to kill more children than you ever would have saved, even if the vaccine were perfect. Natural immunity is the Achilles heel, and no mandates, not a single one, should be allowed.
All right, let's get to
Dr.
some.
Molly?
Oh, go ahead. Some
So
people. Yeah, we have a few people that are asking questions. So after Molly, we're gonna see whether they can ask. We have 3 people we've brought on to the speaker group, and then once you ask your question, we're gonna drop you so that we can bring more people on. Go ahead.
to build on that, one of the worst abuses in this is the healthcare worker mandate. You know, the majority of those people had natural immunity, and you know we've cut the workforce in half. A ton of people, it's decimated the workforce because those people are now disabled. So I would think that would be a priority, is getting rid of that. Hospitals have now admitted that they forced that because of CMS reimbursement, not because of patient safety in any way. And then what are the chances of ending this emergency? Because that ends a lot of the problems. And people are still dying from these shots, as you pointed out.
I doubt they're gonna end the emergency, because the minute they end the emergency, then they can't force us to do anything. So maybe Congresswoman, you guys can take that up with ending the emergency. That's allowing them to do all this to the people. And I don't know. Can you say something about
Yeah,
that, Congresswoman?
Dr.
ending
Emmanuel,
the emergency.
Sheila, I do believe that there are many members of Congress on the GOP side who are in support of ending the emergency mandate and who are actively trying to do so. I'm co-sponsor on many of those pieces of legislation. And this is something we have to do, but unfortunately, we don't have the Senate, we don't have the White House. And so we have to be loud, we have to take a stand, we have to use our voice. And this is something I learned in the minority. In the minority, when Nancy Pelosi ruled the Congress with a hard iron fist, I learned the only thing that I have is my voice. This is how I was able to disrupt the Disinformation Governance Board. As a minority member, a freshman member of Congress, I was able to use my voice and my platform to abolish the Disinformation Governance Board with Nina Jankowicz, the chief of disinformation, and completely undercut that and get them to abolish it, because we got the information out to the American public. So that's exactly what we need to continue to do and persevere to do now that we have the majority in the House of Representatives, to continue to fight for the American people, to not lose heart, to continue to take a stand and speak loudly for all of those who are disenfranchised and negatively affected by all of these mandates. And this is something that has to end.
Awesome. Thank you, Congresswoman, and keep being a warrior. We're cheering you on. Firebrand, you had a question?
Yes, thank you so much for this space. I would just quickly like to say to everyone, Please, can you tweet the space out? It changes the algorithms. It's seen very positively. That's our ticket for being in a space where we are being allowed such knowledge. I just want to quickly say thank you to all the doctors and all the people that are here, because today I smell freedom and I feel hope. I was taught as a child the best medicine is prevention. Sorry, I've got a slight sore throat. The best medicine is prevention, and it's the mindset. If you're strong in head and you say you're going to get better, you'll get better. My question is this. I have never been vaccinated. I have never had a PCR test, but I have an underlying condition. I am an asthmatic. I'm very well. I'm healthy. I walk 6 days a week up a mountain. And I want to know this. I'm a Brit born in the UK, moved to Spain for health reasons. I need to go back to the UK, but I also want to know that is there a COVID exempt certificate? As a doctor, and I'm your patient, and you know that I'm healthy, I'm doing all the right things. And is this document available anywhere in the world that a doctor can say, well, you have underlying conditions, you do not need the vaccine? Because in the G20, they have proposed that the passport will be coming in, the COVID vaccine passport. It's going to be here within the year. And it will literally, if I don't get my affairs sorted out, I'll be locked down to Spain. Because in order to fly, I will have to show that I've had the vaccine and all the boosters. So is there a doctor anywhere in the world that could actually provide this certificate? Because I'm healthy. I've never been vaxxed, no PCR, and that's my question. And also, just to finish off with that question, the mindset is the key. Regardless of what they've done to us, as long as we unify and we use our voices, that is how we will win the war. We've got to come together on this one thing, and it will save humanity. And it's to say no self-ownership of body. So, doctors, could anyone give me this certificate? Because I'm going to go to my Spanish doctor next week to see if he will. Thank you.
I would like to answer that on a spiritual level, if you don't mind, not a congressional level. God says he sends his word and he heals people. God says declare the end from the beginning. He says declare a thing and it shall be established. And that has been my mindset with COVID-19 from the very beginning, that Jesus came and bore our infirmities in his body, and he has healed us. By his stripes, we were healed. That's what 1 Peter says. By his stripes, we were healed. If we were healed, then we are healed. And so this is the mindset that I live by. And I think that that's what you're conveying here, that what you speak into existence is what is. That is your existence, what you speak. And God created the universe by speaking. We have seen this with quantum physics, that at the heart of every object that we see, that there is sound, that there are sound waves that respond, that there are atoms that move and respond to what we say. You can have a table in front of you and think that it's an inanimate object, but in reality, it is moving because there is voice, there is life, and God spoke the world into existence. And if God framed the world by his words, then we who were made in his creation, in his image, can also speak our worlds into existence, that we can frame our worlds into existence. And this is something I've spoke over my children. This is something I've spoke over myself, my family, that by his stripes, by Jesus' stripes, you were healed. If you were healed, then you are healed. And this is something I have completely spoken. Since COVID-19 came about, this has no jurisdiction in my home. This has no authority over my family because Jesus spoke the ultimate word and said, it is finished. And I live by his word more than anything else, more than anything that Congress puts out, more than anything the CDC puts out, more than anything the World Economic Forum puts out. I live by the word of God. And God says that you are healed, that you are whole, that if you receive Jesus as your Lord, as your Savior, that you make him master of your life, then you are restored to perfect union. Restored to perfect union before the fall of Adam and Eve. And excuse me for getting preachy, but that is
Go
where
on, go on,
my
go on, go
thank
on.
you. That is where my faith lies. So in the midst of all of this was God. Was God Almighty, was his word, was his son, was his spirit in every step of the way. And government overreach clouded so much of that. It created so much fear with so many people throughout the world, not just America, throughout the world. And fear is contagious. But folks, courage is contagious. Faith is contagious. And I am imploring each and every one of you to have faith in Jesus, to have faith in the completed, redemptive work of Jesus, because that is our saving grace in all of this.
Awesome,
Wow.
awesome, awesome, Congresswoman. Listen, you need to come on the space where we talk about COVID vaccine injuries and the spiritual implication of COVID, because right now we're talking about the medical this thing, but there's a deep spiritual and sinister implication in this whole COVID and vaccine and the World Economic Forum and everything. And I'm telling you, we're going to be talking about that when we talk about vaccine injury. We're going to go also into the deep spiritual implication of what this whole pandemic is about. And you are so right. A lot of people got scary. A lot of people did things that they did that because they were scared, because they didn't have a hope. And I'm so thankful that you came today and just preached. Awesome.
Thank you, Stella. Thank you, Dr.
Yeah.
Emmanuel. I'm very grateful to join you all tonight. I am going to leave.
Hey,
I
Congresswoman,
look
before
forward.
you
I
go,
get okay.
military
Sure.
whistleblower here. Hey, how's it going? Major
Oh,
Beckerman.
love that.
Yeah, great. My opinions are my own. I don't represent DoD, Air Force, all that good stuff. So, hey, real quick, look, I'm a plaintiff in a lawsuit that's suing the Department of Defense for mandating an unlicensed vaccine. You know, the pharmaceutical companies have came out many times, have stated they haven't produced the licensed version, the licensed product, which is a violation of Section 564 of the Food, Drug, and Cosmetic Act, right? So this whole country, it's basically Anthrax Part 2, if you're familiar with that case law, Doe versus Rumsfeld. We're repeating that mistake. And so we have a bunch of military members that are ready to speak on all these issues, speak at the hearings. We're just having a hard time connecting with staffers and military, like your military reps. Another issue that I wanted to bring to your table too is public policy versus shadow policy. So the NDAA repeals the mandate, but I just spoke to an attorney, a military attorney in the Air Force. We call them ADCs, Area Defense Counsel, and he has a client who's still on the hook for a discharge board. And, you know, I know you spoke about the service members. We separated 8,600 service members DoD wide because of this, you know, what I'm calling and my attorney's calling an unlawful mandate. And so, you know, we're really trying to heal, to get better, to restore the faith and trust in our leadership. But we absolutely need accountability for, you know, what Secretary Austin did. And there's rumors supposedly that he hasn't divested his stocks, right? There's no Form 4s to show that he sold his stocks in Raytheon. There's no Form 4s to show that he sold his stocks in Tenet Healthcare Corp. And Tenet was profiting off of the mandate. So there's a lot of issues, and I'm hoping that we can connect Like I said, with one of your staffers, with your military reps, we have a lot of folks that are ready to speak on these issues.
David, I'll send you a text message about it. And Congresswoman, yes, he's one of the whistleblowers. He handed me all of his material, so I can send that to you as well.
Yes, please do. And my staff is very responsive to this, so please send me any information that you have. We are doing everything that we can on our part to make this right for our military personnel and our frontline workers as well. So please send me anything that you have. I promise it will be communicated to my staff and to the appropriate committee staff that has jurisdiction over that, so we can make it right.
Absolutely. Yeah. The other thing too is there's first of all, yes, thank you for the support. And then the second thing is 96% of the military is vaccinated, according to Secretary Austin. And so we have some ideas to maybe get ahead of the damage that's been done if what we think about these what we think about these vaccines is true. And that for sure I'd like to talk to you offline about.
I would welcome that. Thank you.
Well, thank you so much.
Thank you, David. The next person to ask questions is Patrick, if you're there.
I am. Can you hear me?
Yes, we hear you.
Oh my gosh, like my hand is shaking. I cannot believe that you actually joined us. I'm so grateful to hear your message and your position on this, your platform on this. Like literally, I felt like I was going to break my thumb with how many times I was sitting the heart emoji and the 100% emoji. Oh, did she leave?
Oh,
Yeah. She had said after that she had to leave. Yes, sir.
Okay.
But I'll tell her. I'll text her.
Okay. Sorry.
Yeah, let's get back to people that have questions on early treatment. Like I said earlier, we're going to host a space on vaccine injury and things that we can do to help people that have been jabbed. And then we're going to host a space on the spiritual implication of what's going on. So go ahead and ask the questions. Anybody that has questions on the early treatment so that we can wrap up. It's almost midnight.
Yes, hi, this is Pam. Can you guys hear me?
Yes, we can.
Yes, I've asked this question, I guess, in another space. And thank you all so much. You're just brave people, and bless you all. Being proactive, preventative, I'm unvaxxed, 3 years, teacher in New Jersey, had to get tested for a year. I have not gotten COVID yet. I'm on, just as a general, I know you can't give actual advice, but I'm on, God bless Dr. Zelenko, I'm on a disease stack. And I just want to ask a poignant question. I also take ivermectin, and I'm afraid I'm getting mixed signals. 12 milligrams once a week, is that too much? Should I stop? I'm just curious what you feel.
We cannot, I can't give you medical information, but you
Right.
actually are giving, we give ivermectin by weight, and usually it's anywhere from 12 to 24 milligrams weekly. So
that's what I take.
Yeah, we can't give you any medical information because we need to look at your weight and height and all that stuff to make sure that we're giving you the right.
I'm frontline doctors, and I get it through compound centers in New Jersey.
So if you got through the doctor, they probably give you the right dosage.
Yeah, I know all that. I just thought if it's like you said, I don't think this is over. So I just wanted to be proactive.
I'll give I think let's make the question. I think this is a good time to kind of talk about that, Stella. Maybe we can kind of generalize the question.
Yes, generalize.
Is what do you do in the case where somebody wants prophylaxis? Let's kind of go around and say, what do you recommend in general as a rule of thumb? What are the things that you're recommending to patients?
Okay.
Are you using ivermectin for prophylaxis? Are you using hydroxy? Are you using the Covimin stack that we have? What are you recommending to patients?
I actually we give ivermectin and hydroxychloroquine depending on what the patient wants. So if they want hydroxychloroquine, we give them. If they want ivermectin, we give it to them. Both of them are equally effective. And then we make sure that they're on the COVID vitamins that we put together. That's vitamin C, D, zinc, and quercetin that they can take on a daily basis. And then they take hydroxychloroquine or ivermectin on a weekly basis. So we're able to, like I said, we created the telehealth services. You can get that on our website, drstellamd.com. We have doctors in all 50 states, pharmacists in all 50 states that will ship the medicine right to you. So that's what we do for prevention. And of course, if you've been jabbed, we also advise you to go on daily aspirin. But basically it's the vitamins and hydroxychloroquine, and of course good air, walk around, make sure that you take care of your health.
Yeah, I'll tag on. All right. So one of the things of concern, right, is what are the side effects of these drugs, right? So,
Yes.
hydroxychloroquine has amazing side effects. I go over them all. Ivermectin also. If you look under clinicaltrials.gov, you'll see hydroxychloroquine is being used as in 113 clinical trials for its use in autophagy inhibition in cancer. But it also, lowers hemoglobin A1C, D-dimer, SED rate, improves bone health. It's improving the risk of heart attack, stroke, pulmonary embolus, decreases platelet aggregation, so preventing blood clots. So in general, there's a lot of good side effects from it. Is it having an impact on the microbiome? Yeah, it looks like it is, and so that might be some concern. But from a clinical standpoint, patients that are taking it prophylactically are doing better with COVID. Same thing goes for ivermectin. It's also being used. You see now that they're using it as a checkpoint inhibitor with checkpoint inhibitors in breast cancer. So you're seeing that has these anti-tumor effects. Historically, I have been using ivermectin hydroxychloroquine as eye drops. Hydroxychloroquine since the mid to late 90s, and ivermectin since about 2002. I think 20 years ago. So basically, these drugs have been, in a sense, in use for a lot of people for a long time for different reasons other than for worms. Okay, so I'm just going to say, I think in general, that's another one where if you look at the data, it might even be more effective as a prophylactic in the right dose once a week. So I think there's a lot of reasons to take them. And I think the quote unquote side effects, many of them are beneficial. And that's my thoughts. Thank you.
And when you talk about
Thank
microbiome,
you.
I always advise my patients that are taking prophylaxis, you can take yogurt that has the micro. Jeez, my brain just you can take yogurts with
Yeah, so good bacteria and bad
good
bacteria. So
bacteria.
the
Exactly. My
bifidobacterium,
brain
yeah.
was just
And
yeah. So I basically I take the yogurt with the the good bacteria. Yeah. So if people are
Yeah,
worried about that, so
I take a prebiotic and a probiotic
probiotic.
with it.
That's it. It's like right here, and I
yeah,
can get it.
Yay.
Like
so
with probiotics, yes. I take probiotics. I take yogurt. I eat yogurt with probiotics. If you're
yeah,
worried about your
prebiotics,
microbiome, yeah.
prebiotics, probiotics. For anybody who doesn't know, basically you're talking about seeds and soil. So in a sense, you
Good
don't want to
bacteria.
put probiotics into bad. You don't want to put probiotics into bad or anything growing into bad soil, right? So you think of prebiotics as soil, probiotics as the seeds that grow. So in a sense that there's some utility in that. A lot of the formulas out there are garbage. So I can tell you that I formulated these products. I've formulated these exact products. There's a lot of garbage out there. If you got it at the grocery store, it's garbage probably. So anyway, you can keep doing it, but if you got it on the shelves in the grocery store, it's probably not that great. So
I take
um,
BioComplete by Dr. Gundry. I order that.
yeah, I looked at this formula a while back. I mean, the bifidobacterium bifidum is probably the most. If you look at the impacts on, if you look at the people who did the best, that work's been done. Sabine Hasen's done it. Basically, the people who did the best during COVID had the highest levels of bifidobacterium bifidum. But again, you're talking about, in a sense, is that a product? So when you pour them in your stomach, is that going to make you more healthy? It's a finding, in a sense, like homocysteine is a finding in people with heart disease, but lowering homocysteine doesn't necessarily make you. It doesn't actually. It's never been associated with a better clinical gain. So is putting probiotics into your system going to lead you to better health? I don't know. I believe it does, but the data is not really clear on that. But I do believe it, and I'm with you, and I would keep taking them. And Gundry has spent a lot of time on his products. A little pricey, but probably a good product.
Thank you, Dr. Urso. I just want to remind everyone we have 25 requests. So please ask your question. Take about 30 seconds. If you want a particular doctor on the stage to answer, let's do it quickly. The next person, Dr. Stella, I already got lost. Do you know who's next? I believe it was Nikki and then Paulito, Tim, and then Darla. If not, then I guess that's the new order.
Can you hear me?
Okay, we hear you, Nikki. Yes,
We
go
can
ahead.
hear you,
Yay.
yes.
I just want to say thank you to Dr. Stella. My uncle back in 2000, I'm not going to make it too much of a story time. So back in October 2021, he got
Yeah,
sick.
girlfriend, you got 30 seconds left. No, I
Okay.
love you. By the way,
He got,
Dr. Stella, Nikki was pounding on the crazy doctors that you were on with the space earlier. She's a champ. Go ahead, Nikki.
I was letting him have it. That was over the whole EUA approval. They thought everything was approved. I'm like, the hell it is. So anyway, I just want to say thank you to Dr. Stella. My uncle got sick back in October 21. He, my aunt called you guys. She's wishing she would have drove him to Texas, but she called your team. And your team called in a prescription to the pharmacy. It was 5 things. I think the ivermectin and hydroxychloroquine were probably sent separate. So the 5 basic drugs that you would do for like a pneumonia. She got the runaround from the pharmacy for, I think it was 3 days. And she had to call you guys back to have you call a prescription in to the other pharmacist, because the pharmacist, actually, the manager over there, had the nerve to say, after making him wait 3 days, we won't prescribe, we don't fill prescriptions from that doctor. And we have her text messages. She was working on a lawyer, and I just want to we were so upset. He ended up having to go to the doctor because they didn't get ahead of everything that was going on. He had to go to the clinic, Cleveland Clinic, checked in. They had him go to the main campus. They were going to do ECMO, and we know how this all goes. And unfortunately, he ended up passing away. But I feel like if he would have had access to that original, the pharmacy wasn't filling, the controversial meds. They were just like the basic meds for the pneumonia, and they weren't filling them. So, on your end and on our end, what's the recourse we have against these people for basically, potentially, if he would have had that, he could have maybe lived, like you said before. If those early treatments are given, you get into a position with the family, like they get to the hospital and they panic and they're stuck, and then they end up with the remdesivir and all that shit, and it goes down. So my question is, what's the recourse for you as a physician and for us as family when it comes to these not feeling even basic medications that aren't even being asked for, like off label?
We had when we started out in one of the things that happened, we had staff sitting down on standby, calling 3, 4, 5, 6 pharmacies before we could get to somebody that will fill the prescriptions. I remember calling a pharmacy in Minnesota. I had a man that was in the house, 350 pounds. He was scared. He was diabetic, 350 pounds. And he said, "I'm so scared, Dr. Immanuel, don't let me die. Don't let me die." That day, I called the pharmacist. I said, "Give me your name, because if this patient dies, I would personally come after you." I was so irate and I hung up on them, and they immediately called the guy and they called in his medications, and he lived. So what we did as a company, or the work that we did, is that we created, like I said, we've created a closed system. Now that, and I tell people, please don't wait till you're sick and they can ship the medicine to you. But what recourse do you have? That was part of the emergency declaration, that so that you can sue anybody. You can sue those doctors. That's why they couldn't sue the governor of New York, Cuomo, for killing people in the nursing home. That is the sad part. And this is why we will probably need a Nuremberg 2.0 to bring these people into accountability.
Thank you, Doctor. We're going to go to Paulito and then Tim.
Doctors, Carolina, thank you so much. I've been a pest to a lot of you. I'm sorry, but I'm not crazy. I have tinnitus. I have vertigo. I have joint pain. I have what else do I have? I have so many things. Surgeries. My doctor gave me said everything was stress and anxiety. In 2 years, 2020 January, I got sick, and it was downhill from there. And a lot of symptoms. I have hypertension. I'm taking medication for that as well. 16 milligrams of candacertin and my blood pressure is still high. I don't want to take any more, but because I have another surgery tomorrow, actually Thursday, to repair tendons in the shoulder that were, partially torn, and I don't know why they got damaged like that. But so, anyways, and pretty much my doctor said after 3 years of hospitals that it was anxiety and stress, and it's not. And I know what it is. And I appreciate you guys putting on these spaces. And as soon as I kind of started like digging around for work purposes, I seen what was going on, and that's helped me a lot, trying to understand exactly what's going on. And I appreciate that. And if it wasn't for people like you, people like me would never figure out what's going on. I'm just a normal guy that goes to work every day and hasn't missed a day of work in 3 years other than the surgeries. But this is my story, and I just want to make sure that a lot of people out there I know feel the same way, because you hear it, and you hear it from people here on Twitter, and I appreciate it. Thank you. That's it for me. I just want to drop down, and I appreciate everything.
Thank you, Pablito. Tim?
Okay, can you hear me? Hello?
Yes, we hear you.
Okay. I want to start with saying God bless you, Dr. Stella, in the all-powerful name of Jesus Christ, and thank you for all of your work and your standing up. And also to Nikki, I'm also in Northeast Ohio, so I want to make sure we connect. I followed you. I went to my pulmonary specialist. I'm going to keep this short. 1 month into the outbreak in March of 2020, I called him from a hotel and told him how I felt and the symptoms that I had. Now, he kept me with an emergency pack on the road because I'm a truck driver. So I always carry a Z-Pack, prednisone, and albuterol inhaler because I was diagnosed with COPD. That's the reason I was seeing a pulmonary specialist. He told me early on the phone, and I wanted to get your take on this, and I know a lot of research hasn't been done, but he said he believed that this was a bacterial infection that was manipulated in a lab to look like a virus so that it was mistreated by doctors. So I wanted to get your take on that, because he told me to take the prednisone. I stayed in the hotel. I took the Z-Pack. In 2 days, I was feeling better. The other thing he told me was not to break my fever. He said that the fever would actually kill whatever was in there, and to take enough ibuprofen to keep my fever under 103, but above 101. And that's what I did for 2 days, and I was better. I mean, I was to the point where I couldn't walk 10 feet without losing my breath, and I felt like I was going to fall over just from weakness. So I wanted to get your take on if you've heard anything or seen any studies on how this may have been a manipulated bacterial infection that was released rather than it being a virus. And thank you.
I don't think most of us that are actually taking care of COVID, we don't know what it actually is. In fact, it wasn't isolated, and this was not released for everybody. But I can tell you this, that it acts just like a viral infection, like the flu or like a RSV. And because there's a lot of co-infections that come with the infection, most people that get COVID, they end up getting secretions and they get superimposed bacterial infections. That is why we do treat them, and they do well with Z-Pack. And of course, Z-Pack also has some anti-inflammatory. And if there's, Dr. Also, if there's anything you can add to that. And I think that's a mute point, actually.
Yeah. So,
Go ahead.
this, I'm going to say this, we've got a nuclear bomb. We've got a lipid nanoparticle. We've got a messenger RNA. They can write any program on it they want. They wrote the spike protein. The spike protein's been shown in the Salk Institute to be the main cause of the disease. The lipid nanoparticle is also inflammatory. We know there's some respiratory pathogen likely, and I'm going to say 99.999% likely to be this pathogen. It's well documented. They have patents on it, numerous patents. They have, all these things that are in this spike protein that never were in any kind of coronavirus prior. So I think to kind of go into the speculative nature of something like that is it's tiresome and it's a waste of time, and it's time to sort of own up to the fact that they have a lipid nanoparticle messenger RNA platform they're going to use to put in your body to do whatever the heck they want, whatever protein they want to make. That's it. That's the goal. And the goal is basically that. They don't need to have any special other things. I mean, that's enough of a goal. Put a lipid nanoparticle messenger RNA. When you start getting into all these other, conspiracy thinking that are not data driven, okay, not data driven. We don't need to go there. We got plenty of data that's horrible data we already have. So I'm going to say no. I don't go for any of that because it's unnecessary. We have lots of information that's really bad, and so that's where I'll stay. And we've treated this quote unquote this illness very successfully with the drugs we have, and it's responded extremely well. So I feel really good with where we're going. We have treatment. The main thing is, are we going to stay in a confused, hopeless, despairing, angry state? No, we are. We're God's people. We're at the top of the mountain. We need to take the role of that. What that role is. That role is basically. We don't need to look and be confused by everything they're doing. We know what they're doing, and we just need to move forward. That's it. Over.
Thank you, Dr. Urso. Darla?
Hi, everyone. I just wanted, can you hear me?
Yes, we can hear you.
Okay. Thank you for this time. I really appreciate it. And I just wanted to let you know my story. I'm a COVID-19 pneumonia survivor at 71 years of age. I did not take the vaccination. I started to feel ill on a Wednesday. Saturday, I tested, I did an at-home test kit for COVID, and I tested positive. Monday morning, late Monday afternoon, I went into the hospital, and I was debating whether or not I should do the, intravenous antibiotic bodies. And I finally settled on having that done. And I did that, and they took a chest x-ray, and I had pneumonia. So they sent me home with, what's the name of that antibiotic that someone said earlier?
Z-Pak, doxycycline? Doxycycline.
Doxycycline, yes. And it took 2 weeks for me to overcome the virus. And I recently just had an upper respiratory infection, and I was on another antibiotic, but it didn't go into pneumonia. And I was wondering, why did it go into pneumonia? Why did the COVID go into pneumonia on me? And I went to a pulmonary specialist after that, and
So
my lungs are fine.
So let's talk about that. So what do they see on this spike protein? An ACE2 receptor that's never been seen before in another coronavirus. And also, what else? The TMPRSS2 serine protease, which helps you get down in the early lungs in the time you had it. So that's why it got there. It was designed to get in your deep lungs. And it's actually causing kind of a inflammatory vascular disease that basically looks like an organizing pneumonia. There's actually an inflammatory component. The virus is dead after a very short time. You may have a secondary bacterial infection with it, but actually the disease process from COVID is basically inflammatory vascular. And for the most part, you can get a secondary pneumonia on top of that, but it's designed to do that. That was designed into the spike protein. That's why it happened.
Thank you,
Okay,
Dr. Urso.
I think we have a few more questions. Go ahead.
It's Long. I'm sorry, Lola. Lola is next, and then Jake, Kimber, then Catherine, Long, and then Julie, and then MMDO. Hopefully you remember the order. And please keep it to about 30 seconds, guys, because our doctors do have to go to bed and treat their patients and are super busy. And Dr. Molly, thank you for bearing with us. Dr. Lori, God bless you. Go ahead, Lola. Yeah, go ahead, Lola.
I think you might be looking at my name. First of all,
I'm Lola.
oh, okay. Sorry.
No, it's all right. I'm sorry, but matter of fact, I'll give up my speaking moment to you because I was here a while and I tried to get on.
No, go for it, Lola. Go ahead. Yeah, just what's your question and for who?
I don't have a question or a for who.
Oh, okay. Thank you. Go ahead, Long. Okay, Kimber.
Hey, I just wanted to speak directly to Stella and say I've only been on Twitter for 24 hours because God told me to join Twitter. I left society 3.5 years ago, went off grid, raised babies, gave birth to them at home, whatever. And I just can tell that, and I'm so happy that we were born for a time such as this. And what I have to just, I have two questions quickly. The first is, what do you think about fasting? I'm starting to think about I'm calling it like a 40-day reset with fasting and stem cell repair, and just looking at the science behind that, the micro, the macro, how to heal our bodies. And fasting is talked about a lot, in different texts and things like that about stem cell repair, DNA repair. And also beef liver capsules is what I have I have access to organic, just an hour away from me, beef liver. And, I'm going to be making capsules and stuff like that, but beef liver fasting. And what do you think about alkaline water 9.5? Is that just like a hoax? Because my well has 9.5 pH naturally, and I'd love to bring it into the cities for free for people.
Stella, you want me to answer a few of those?
Yeah.
Okay. Yeah. So
Okay, answer,
alkaline
and then
water,
I will say.
the planet is alkaline. It's an alkaline water planet. So anybody who says that the planet, either alkaline water is not, it's what the planet's water is. The planet's water is 7.4 pH to 7.8 roughly. So in general, it's got a negative ORP, which means the planet itself has a negatively charged alkaline water. That's water. So the only time it changes when you send it through a water treatment facility. It changed the RP from negative to positive. So yes, alkaline water is the water you're supposed to be drinking. So your well is good, 9.5. Keep drinking it. That's great. I forgot the first question, but I had an answer to that too. What was the first question again?
She was asking about beef liver and asking about
Beef
fasting.
liver,
Fasting is good. Yeah.
autophagy. So here's the thing about, fasting. Your body's smart enough not to chew up your heart and brain. Okay. It's going to basically chew up the inflammatory components of your body. So if you're doing fasting, it's a really smart way to, in a sense, get rid of some of the inflammation in your body. So it's a great idea. Most of the time, I recommend, you can do it in a lot of ways, but if you're doing more than 2 days at a time, you're going to run into problems probably. But in general, most people are doing like 4-hour windows of eating. And for the most part, it's like feeding your dog. Dogs, they stay lean if you feed them in a short window every day. But if you eat breakfast, lunch, and dinner, you're basically triggering things that create an insulin response. And insulin creates a downstream cascade of events that eventually leads to basically no lipolysis for about 8 to 10 hours. So you basically can't burn up, body fat when you're eating things that stimulate your insulin. So in general, if you can stay in an autophagy response, you're going to burn up a lot of the inflammation in your body. And basically it's going to be, in a sense, you talked about some of the science. Basically, a lot of the science is basically done on little nematodes and things like that. So we don't know how clean all that science is or how much it applies to human beings. But in general, autophagy makes sense. Beef liver, I think the guy who does that is the guy who's big on that is a steroid freak. You can do it. You're not going to look like him. So anyway, over.
With fasting, I actually wrote a book on fasting, both of the spiritual and the health benefits on fasting. And I think I might not be able to give you guys a good information on fasting here, but fasting has a lot of health benefits. Like I say, it resets the body and detoxes the body. I would probably address this when we're doing the talk on on the vaccines and some things you can do to detox yourself. So fasting is good. Alkaline water. I do believe that people make too much noise about alkaline water. It's natural, but remember that your stomach is acidic. So if you drink 9.4 pH water, it's going to hit your stomach and it's going to be acidic anyway. Because your stomach has to be acidic to be able to deal with all the bacteria. The acid in your stomach has to deal with killing some of sterilizing the food that we eat. So should you go out and buy alkaline water? I don't know whether it's going to make your body more alkaline or something. Molly,
Yeah, okay. I
it's
hate to jump in on you, Stella, but let me jump in. Whenever your stomach's at a pH of about 3, when you put alkaline water in, the stomach resets the pH because you put something in an alkaline state of about 9. What it does is you have a balanced equation. It's going to pour hydrochloric acid in the stomach and pour bicarbonate into the blood. You get an immediate alkaline tide. So yes, it works. It basically creates it's creating an alkaline tide in your body almost immediately.
Dr. Stella, didn't you advise me at one point to also, for a different thing, to have tonic water with it has quinine, right? Was that the same as
no,
hydroxychloroquine for other
it's
issues?
like alkaline water. Tonic water has quinine in it, and a lot of people did well on tonic water.
Okay.
Yeah, but it wasn't alkaline water. Anyway, Richard, like I said, this is, by the way, so let's move on to the next question.
Oh, hi. Thank you so much for all the valuable information. God bless you all. And it's awesome to be part of this. I got COVID in 2021. Myself and my boys we're not anti-vax, but we didn't believe in the expedience of the vaccine or any of the boosters, and I got pretty sick. I did everything that you guys are saying. One thing I'd like to do is be on a regimen of ivermectin, hydroxychloroquine. It's rather expensive and it's hard to get, and our doctors don't seem to want to prescribe it. And is there a place where we can get it that's affordable? And most of my family believe in all the fear, and they believe in CNN and the government and everything that they're doing. And so a lot of my family is vaccinated. They're all getting sick with COVID. We passed the test, me and my boys. We all got sick with COVID. We're here, we're alive, we're healthy. But I'm kind of concerned about family members getting sick, and trying to convince them to start taking something to help get their body rid of the vaccine and all the different boosters. And my father-in-law, he takes colchicine. I have colchicine.
Looks like somebody could keep muting everybody, and I don't know what happened with that.
Oh, sorry about that.
Go ahead.
Anyhow, I was just curious about colchicine and also getting affordable ivermectin and hydroxychloroquine.
If you go to our website, drstellamd.com, you can get, like I said, hydroxychloroquine. I can tell you, but we give you like 50 tablets that should last anywhere from 6 months, from a year to 2 years, depending on your weight. And that is about $100,
okay,
including your appointment. So it's not that unaffordable.
Sure.
You know something. So if you go, like I tell everybody, we created a system, and we created a closed system. So we have ivermectin. Ivermectin tablets are a little more expensive. The ivermectin compounded by pharmacists are a little cheaper. But like I said, you go to drstellamd.com and anybody can get it all over the country. Doctors.
So Stella, you're that's what I was going to ask. You're in every state, correct?
Yes, we can see patients in all states, and we have pharmacies that can ship in all 50 states, including Guam, including Alaska, Hawaii. We've seen patients in everywhere.
And one of the things you've done in doing this is try to look and see if you could get the price down over this whole time. Because remember how many? Yeah.
Yes, we worked with pharmacists. We gave them we had to work with pharmacists, and I got the prices myself from wherever, and then I spoke to the pharmacist and about, okay, we're going to send you a lot of patients, just bring down your prices for our patients. So we're able to work down like a a pretty affordable price for both ivermectin and hydroxychloroquine. But like I said, ivermectin is more expensive. It's almost about maybe $4 to $5 a pill. But if you get the ivermectin compounded, it's cheaper. Hydroxychloroquine, usually we can get your year supply for like $100. From our pharmacists can get that to you. So, like I said, go to our website, get signed up, and I tell everybody, get in your medicine cabinet. Don't wait. Don't call me at night at 3 a.m. to come get you out of the hospital. I won't be able to.
Just on tag on that, Stella, because the other thing is the COVID immune support stuff. I think you've got that there too, correct?
We talk about vitamin C, D, zinc, and quercetin. Richard, you and I put together the formula for the protocol for people to take to keep their immunity build up. We've built up supplements for. One of the things I like to do is go on NIH and look through studies, and see what the studies on propaganda, studies on this and that, and we take these studies that they've done and then we put together supplements that can help people. And we have a lot of stuff. We've done a lot of work and we do a lot of stuff. So I'm kind of proud of the things that we've been able to do and to help the American people and the people of the world at large.
Thank you. And you guys have both provided a lot of information to not only Zelenko, but a lot of different doctors that are now using the protocol at the FLCCC and many, many others. So thank you for that. Jay Holt, are you there? Go ahead.
Oh, yes. Thank you, Carolina. I DM'd her this information. I was just going to read. I'm here in Texas, and I'm looking down. There's 1,000 people in here, and I just wanted, there's bound to be some Texas people. I do see some people down there that I know is from Texas. Next Sunday night, I don't have a time where I would have posted it, but next Sunday night, we're hosting a space with Texans for Vaccine Choice. And they are, I put the tweet in the purple bubble of what they do. And they've actually started looking at all the legislation that is coming through this session that has just started. It's just beginning here in Texas for, medical freedom. A lot of the things that happened last year, obviously, people losing their jobs because they wouldn't take the vaccine or whatever. Well, these ladies, Rebecca and Michelle, are going to come on, and we're going to talk about some of the legislation that they're pushing for. And nothing medically that I will be speaking. My wife's a nurse, but I can't speak medical. But you guys are our heroes. Dr. Stella, my wife won't believe that, or Emmanuel, she won't believe that I spoke to you on space. She's in bed, but thank you guys for all that you do. And if you can just I will send this to Carolina when we have the space set up. And anyone in here, please follow that bubble, or I could put it up in the nest or whatever. I didn't want to do it without permission. But it's something that we can drastically do as citizens to get our legislators to do the right thing and to make the laws that need to be made here in Texas to where we don't have this travesty that we had back in 2020. So thank you guys for letting me announce that. Thank you, Carolina.
Thank you. And Dr. Stella and Dr. Urso both have helped me here in Texas for some of your events, by the way, back in the rally days. So yes, definitely we are glad to support you.
Yeah, they will have a rally next Wednesday, I believe, at the Capitol.
Yes, thank you.
Okay, Carolina, keep us informed and let's see how our schedules go.
Thank you. Sarah, shout out to her. She's an amazing girl. She told me about you guys, so I wanted to make sure I don't miss out. Catherine, are you there?
Yes, I am. I'll make it real quick because the doctors are probably looking at their pillows. Dr. Immanuel, you're a rock star. I found you on Alex Jones. You and Dr. Zelenko are like, you and Alex and Zelenko changed my life. So this is for the medical panel. It's not about early COVID treatment. You may not want to touch on it, but it's really bothering me. So that's why I hung around, apart from this being super interesting. The mRNA going into the food, it's coming up more and more and more by the computer guy. So I just wanted to get your opinion is if the vaccine can be ingested and if it can be, if we can be vaccinated and if you have any opinions about it, at all? Thanks.
Okay, so yes, it can be, and for the most part, a lot of the stuff can be destroyed in your stomach acid. But the lipid nanoparticle portion is going to be placed into the animals in our, our cattle, in our other plants. It's going to be placed in a lot of our food sources. That's the goal. Whether or not it has a tremendous uptake within our body and starts producing the proteins, I don't know. So I don't have a lot of information, but they're already doing that. They're putting it in the food supply. They're looking to do that in pretty much all our domesticated animals and our domesticated plants. So that's the goal. That's happening right now.
Well, that's why you need to grow your own food and have your own cattle. I have my momos in the back that I think we're going to, if you can grow your own food, get some chicken and everything. We have to be prepared for what is coming. And I'm so thankful that Representative Bobbitt, Lauren actually went into, got preachy. What is coming is going to be crazy. So please look out for the space we're going to be doing on the spiritual implications of what we're going through, the timeline of where we are spiritually, and what you can do to be safe. But I want to give everybody a word of encouragement. There will be a great reset, but the great reset is not going to be done in Davos. The great reset is going to be done by the Lord Jesus. And you should read the Bible all the way to the end in Revelation, and you will realize that, yes, finally, at the end of the day, God is going to come and, crash this whole system, and then he will, get us out of here, bring us back. We will remodel the world, and we're going to live happy after without the devil. That is the whole idea about this whole system. There will be a great reset. It will be done by God. And I think it is time for everybody to turn back to God.
Amen. Jake?
Thank you. I appreciate your time. Thank you, all your doctors and everybody that's been contributing to this. I really appreciate all the time and effort y'all put into trying to save humanity in our country, and really appreciate it. My wife just gave birth on the 31st to our fourth child. None of us had been vaccinated. I've been banned, blocked, and deleted off of practically every social media program and platform because of me trying to spread the truth since, late 2019, even before they had announced that COVID was going to be in the United States and that it was still in China. And anyway, my wife gave birth to our child at home because we didn't want to be in the medical system, because we did that with our previous son that's now almost 2. And we didn't want to give birth in the hospital again. And so birth was beautiful. It was awesome. One of the most amazing things that I've ever experienced in our home, surrounded by loving people. And unfortunately, my wife did not stop bleeding. The placenta did not remove completely from the uterine wall, and we had to call the ambulance and take her to the hospital. And they ended up having to do emergency surgery, and she ended up having to get a blood transfusion. We anticipated this on the way to the hospital, thank goodness, but at the same time, it was no benefit to us because we requested non-vaccinated blood, but we were unaware that vaccination status of a blood donor does not follow the blood. And so my wife ended up losing 2.5 liters of blood and getting that transfusion during the surgery and thereafter. And so now we're fairly certain that she could have vaccinated blood in her body. And, we eat non-GMO, all organic. We grow most of our vegetables and raise our own cattle. We raised 450 chickens this last year, and we homeschool our kids. And so we've been trying to do everything that we can to be the change we want to see in the world. But here we are, unfortunately ended up, and I'm pretty worried. I mean, we pray, doing everything that we can to trust in God, but at the same time, you can't be in a burning house and think that God's going to save you if you don't get up and walk out. So, ultimately, I'm trying to do everything that I can as quick as possible, which I know that this is about early COVID treatment, and I've heard that stated multiple times, but, time is of the essence, and I want to do everything that I can to help my wife and get her the help that she needs so that we can cleanse her body.
Let me give you right there. You're a child of God. The Bible says in Titus 3 verse 5 that salvation is by the washing of regeneration. And we have prayed for a lot of people that took the vaccine and regretted it. And we've seen miracles. I mean, we've seen paralyzed people get released. So I don't want you to be fearful. Your wife was injected something she couldn't, and just tell her to pray and ask the blood of Jesus to cleanse her. It's the same blood of Jesus that redeemed us from the Adamic nature. What happened in the Garden of Eden was a DNA corruption. And when you get saved and you give your life to Christ, you get a regeneration. And this spike protein or the nanoparticles or whatever they inject in us, it also changing our DNA. But guess what? You can get regenerated and get healed. So I don't want you to be worried. Go on our website, drstellamd.com, and there's a place there that says if you've been vaccinated and you regret it, this is the prayer to pray. You don't even worry about it. The Lord is totally going to regenerate your wife. So don't worry about it.
Thank you.
All right, Carolina, who next?
Donna?
Hi, yes. Thank you very much, everybody, for staying up so late. So in March of 2019, I got sick. It was presumed that it was COVID. They wouldn't test me because I didn't have the COVID markers of a high temperature and a cough. And 2020, I found out that I had a very severe mold allergy. And in 2021, I found out that there was mold in my apartment. And I subsequently moved out of my apartment. But the point is, in 2019, when I got really sick, I started doing research and I started taking supplements that I was finding online, like NAC, ashwagandha, things of that nature, to reduce some of the symptoms that I was feeling. And I stayed the course with some of those supplements throughout the course of me finding out that I had a mold issue. I moved out of the apartment and I stopped taking most of those supplements and I wound up getting COVID. I took ivermectin and within 3 days I was better, but I was wondering if there is any if anybody's looking into a possible correlation between people who have an inflammatory response to mold and severe COVID illness. Is that something that's been looked at?
I mean, if you had mold in your lungs and your lungs were already inflamed, it's just like any other pre-existing condition that will probably get you sicker. And like you call about ashwagandha, we actually did. I mean, we put together a lot of stuff, including ashwagandha, and in our supplements to help people. So I would tell you that that mold in your lungs is just a pre-existing condition. Your lungs were already kind of injured, so it will probably get you a little sicker. But ivermectin works.
Yeah, no, it was a lifesaver. I'm very happy that I had it on hand. Thank you guys very much for everything.
Thank you. Donna Kay, are you there?
Yes, I am. Thank you. Dr. Stella, you are heaven sent. I am so grateful to find this space for the first time. Of course, I've heard of you before and heard you on Alex Jones. And you're such a just breath of fresh air with these other spaces, because I have just been getting on these COVID spaces, wanting to shout to the world for people to stand in their spiritual authority. And I'm not being called up. And I have felt there's a block there because I feel the time that we're in, it's a test of our faith. What are we putting our faith in? If I'm not putting my faith in Christ and I put my faith in a vaccine, then I'm going to suffer the consequences. So I see it clearly that I feel like the reason I wasn't being called up to give people, some answers and solutions for healing, is because our Creator doesn't want people to just heal and be comfortable. I realized that 2 nights ago. Christ wants us to have a relationship with Christ. And so I understand that, we can go through suffering until we get our relationship right with the Creator. It's just become crystal clear with these spaces. But coming on here, I feel such an alignment with you and your message of, spiritual authority and healing in addition to the medical. It all serves a purpose. But the root is our relationship with Christ, with our Creator. And so what I wanted to share is just a practical skill, which most of us know, to literally help with COVID, even with the negative effects of the jab. I've been in ministry for many years as a spiritual teacher and a public speaker dedicated to Christ, but also understanding the quantum physics of human consciousness, wellness, and human behavior. And with COVID, it's a spirit. It's an energy. Every word, every letter, every number has a frequency and an energy, either giving life or killing life, one of the two. COVID obviously has an energy and frequency of death.
I will not want to go into energy and frequency because as a Christian, that goes into New Age, and I'm kind of already freaked out. We need to just stick with Christ and not go into quantum and energy. We'll talk about science and then we'll talk about Christ. And
Thank you, Doc. What's your question real quick? And I'm going to ask all the speakers to just have your question ready, spit it out in 30 seconds.
A question. Okay. Okay. Well, I would, two things in the question. What I wanted to share is, and it's in the Bible, every word creates life or death, of our mouth. But the answer is to forgive.
Hello?
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 Okay. Can you hear
us?
Sorry.
Yeah, I'm sorry. My earbuds went dead right as you called me up. So I'm like, no! I'm sorry. For a minute.
It's okay. We can hear you. Go ahead.
Hello?
Yeah, go ahead.
Okay. Anyway, following to this here, and a lot of
you're cutting in and out. Do you want to drop out and then come back in because it's chopping?
You're chopping. We're hearing every other word.
Okay, we're gonna go to Nereida.
Hello, hi, God bless everybody. Stella Immanuel, I saw your very first video when all this started happening in 2019, and you came out with bravery, and you were saying that you were just telling everybody to calm down, and you had the Spirit of God in you, and I remember that. And so now we are 2 years into this, and I was always, from day one, I always said, don't get the vaccine, and I would tell other Christians, don't live in fear. God had not given us a spirit of fear, but a power, love, and a sound mind. And now I don't know how God's leading me, but God's leading me to be kind to those that are vaxxed, because they're so afraid. And a lot of them, they put their whole faith in the government and propaganda and in fear. And now they're scared because they're being hurt. So how do you want me to minister to those that have already had this, are getting sick, just for them to continue?
If you go on my Twitter right now, there's a short video that I did to bring hope to the vaccinated. Like I said, we're going to be doing a whole space to deal with spiritual and physical, and how we can, what are the things that we do to treat people that are vaccinated and regret it. It's important that they have to regret it. If they don't regret it, you can't force them to do whatever. So we do have detox that we've put together, and of course we have the spiritual cleansing that we do. So there's a video on my I did yesterday. Just look at it and then go on our website and you'll see a lot of the prayers that we tell people to do, and we have a whole detox. We have a vax detox of people. So I don't think that. I think we should, you said something very important. We should show kindness and mercy to those that are vaccinated, because we're all the prey. They were so scared that they got vaccinated. Right now, they're so scared that they are vaccinated. And I know that they used to wish death upon us, but we have to look at it. We are all the prey, and show mercy to those that are vaccinated. look out for the space where we're going to be dealing with vaccine injury and how to be cleansed and purged from it. I'm going to get a few doctors that work on that space. All right.
And make sure you follow Dr. Stella Immanuel, because I know that some people were dragged on from uh, other viewers that joined. So make sure you are following Dr. Stella and everybody on the panel so that you enable the notifications. And that way, when she does go live, you do get it. You get the notification. We're going to go with Bitcoin. Go ahead.
Hi, yes, thank you. Just quick question about chlorine dioxide. I've been making and using this as needed for over a year out of fear of, vaccine toxicity. I'm just curious on your ideas on chlorine dioxide.
People have used chlorine dioxide, and we have seen. I don't use it personally, but I have a lot of anecdotal this about people using it and other patients using it. I do, because the reason why I've not really gone into other forms of treatment is because if it's not broke, if you don't fix it. You understand what I'm saying? We have a protocol with hydroxychloroquine, ivermectin, and all the stuff that we give people. And because I can still prescribe it, and I have doctors that can prescribe it all over the country, I've not had a need to go to look into other things. I've been busy. But I know there are anecdotal reports on people that use chlorine dioxide. I can't tell you anything about it.
Okay, thank you. Just to follow up on that, hydroxychloroquine and ivermectin, I did get through frontline doctors and stuff, but just to take it on a prophylactic basis, ongoing, it's very expensive. So chlorine dioxide is very cheap to make. That's why I've stuck with that.
Quercetin too can, vitamin C, D, Z, quercetin can help too. Anyway.
Thank you. Tisha?
Hello. Hi, can you hear me?
Yes, vaguely, but yes, we can hear you.
Okay, great. Yes, I wanted to kind of ask about the shedding. I have two sisters, one that was vaccinated, one that wasn't, and both have gotten very recently lung and brain cancer. So if
Yeah,
the
shedding
yes,
happens. We've had a lot of people. Shedding does happen. It's a legitimate concern, and it's there's a lot going on shedding with people that have taken the vaccine. But we're going to be discussing that with the vaccine. Like today's topic was really about early treatment, and I know we've got into many other things, and it's kind of like over past midnight here. So we just look out for the space we're going to be doing on vaccine. We're going to start that a little earlier so that we can have time to talk all day.
will do. Thank you so much.
Thank you. Rod?
Hey, where have you been my whole life? This is like, all of y'all. This is like the best, space that I've listened to since they started this thing. Y'all are heaven
Holy
sent.
Spirit with Dr. Stella Immanuel, for sure.
Right. Y'all are heaven sent.
I was blocked.
No, I just got a couple of quick questions. What is the shelf life as far as, your average pill medication?
All right, let me say this, right? There's something about expiration date that a lot of people don't understand. Expiration date most time is not spoiled by. It's not expiration date is more like most effective by. You understand what I'm saying? So
Right.
most medications, even my food, like my food in my fridge, I don't throw away my food because it's expired. I throw away my food when it tastes bad. We are like the most wasteful society. And because we've become so wasteful, because everybody looks at best by or expiration date to being spoiled by or it doesn't work anymore. And that's not true. So most pills, medications, for me, I use them for years. They actually did a study. When I found this out, when I started doing, I used to go do missions and medical fair in Africa, and I found out that pharmaceutical reps, they'll come and they'll give me their medications that have expired, and they'll tell me, oh no, it works for 2-3 years. And then we found out that they actually did studies in the military and found out that most pills still work, are still available, they are still efficacious for years, like 2, 3, 4 years. So I would say expiration date, I don't give it much credence, actually, especially if it's like a pill or maybe a fruit or stuff in my house. So that's me. So you should probably go and study the history of expiration dates.
Thank you so much. And last question. I've heard this, and I don't know how true it is. And I'm pretty sure you'll give me the right answer. Are antibiotics bad to take? Because I've heard that basically you are just nuking your body.
Antibiotics are taken when you are sick. Antibiotics are not things you just take on a daily basis when you're sitting around. What does antibiotics actually do? It reduces the amount of bacteria or amount of the virus or whatever bacteria that it's in your body, so your body's immune system can have the ability to repair. That is actually what antibiotics do. So if you're sick, there's no point like, I'm not going to take antibiotics because they are bad. All medications that we take is a risk versus benefit. If you're having if you're having a bacteria in your blood that's going to kill you, you need to take some antibiotic. Yes, it might mess up your gut flora for a little bit, but so you can take probiotics later. So antibiotics is about risk and benefit. It's not something you should just take randomly.
Okay, well, thank you very much, and God bless to all y'all.
Thank you. Ryan?
Yes, thanks so much for calling me up. A year ago, I was vaccinated 2 times, and due to work pressure and family pressure, I had COVID 2 times, including a year ago, right after I got vaccinated. And I'm afraid I may have COVID now again, because although I tested negative on a test tonight, I've lost my sense of taste and smell. My question is, really my real concern is, about 10 weeks ago, I started developing involuntary muscle spasms in my body, and twitching, and now it's mostly happening in my legs, but other parts of my body. Every doctor I've seen hasn't been able to help me or tell me what's going on. My question is, one, would it be unusual? Have you heard where somebody develops muscle spasms 10 months after the vaccine? And then 2, is there something I can do about it, especially now because I'm freaking out, that maybe I have COVID again? And is there something I can do about it? Because it's been really, really dark for me the past 10 weeks, and I really don't know what to do. And I can see this. I can see my muscles twitching and happening. And I don't know for sure if this is COVID or vaccine related, but I suspect it is from everything I had read and seen on Twitter and other places.
Ryan, number one, if you think you have COVID or you have symptoms, go on our website. We'll treat you. We'll give you hydroxychloroquine, ivermectin. We'll give you all the medications that you need, the steroids that you need, and everything. Number one. Number 2, if you've been vaccinated, repent and ask for the blood of Jesus to cleanse you. Number 3, if you are having muscle twitching, there's a way I would treat people that have muscle issues, and I would treat you as a patient. There are muscle relaxants you can give people and everything. The vaccine and COVID, they are both what I would call spike protein disease, and we don't know the whole ramifications of what they actually do. So, Dr. Also, if there's anything you can say to that, but get treated immediately. Go to drstellamd.com, sign up, and we'll see you.
Yeah, I mean, it's tough because it's an individual thing, and knowing all the nuance, it's definitely treatment for you. And I think there probably is a lot of this is connected. So I do agree with what you're kind of thinking. And remember that the spike gets access via the lipid nanoparticles. You had the vaccine, so the spike gets access to all of your body. Basically, it's going into the brain, the bone marrow, the adrenals, the testes, the heart. It's going all over and distributing everywhere. So now you have access everywhere. So that's why it's a multi-system disease. Is there a big vascular component? Absolutely. And is there inflammatory pathways that are being that are part of this? Both. I think there's multiple pathways, and that's why typically in medicine, instead I both train this way is you don't usually have peas and carrots. If somebody a new young person gets a disease, they're not going to have rheumatoid arthritis and and some other unusual genetic disorder at the same time. That's just not the way it works. But this is the difference with the spike protein, messenger RNA, lipid nanoparticle platforms. It gets into your nervous tissue. It gets into all these different tissues, and it causes different pathways of disease and different mechanisms of disease. So I think in general, first thing to do is treat you, right? That's the first thing. We don't want to do too many things at once, but clearly there's probably an inflammatory mechanism. There's no reason why you couldn't get rid of this muscle spasm issue. There's a lot of ways to approach that in a lot of nutritional ways. I don't want to go into it too much because there's the treatments at first to treat the COVID portion of this and then move on and treat the other symptoms. And in general, I agree with what Dr. Stella said. Thank you.
Richard, do you think that maybe he could use COVID Light because of all the supplements we have in COVID Light?
Yeah, but first I would, treat the acute phase, right?
Yeah.
And then we'd
Yeah.
go into some of that other. And I really do think nattokinase is a good choice for people that have long-term injury. It's simple. There's a role for triple therapy potentially. In some of these patients, they have lack of plasminogen activator inhibitor 1. So it's PIO1. It's basically a lot of this is we don't have all the answers. That's one of the
And
problems.
hydration, though, a lot of hydration, because remember,
Yeah, yes,
when we have
yes.
one of the things we found in COVID patients where we had a rise in their creatine kinase. So this was like very hypermetabolic situations, and hydration was so good in flushing out some of the spike, flushing out some of the toxins out of the person's body. So hydration is something I would tell you, if you can just get maybe a liter or two of Pedialyte a day. We really saw that work very well with people that we did labs on, and they came back with high creatine kinase. That shows that their muscles were affected. Hydration really helped.
Yeah, and I can't. And Stella and I would both agree on this. This is normal for viral disorders, where you get electrolyte issues, you get hydration issues, and a liter or two of fluids really makes a big difference. So that's number one. I'm a bigger fan of bone broth as my replacement. It helps the gut. But I think either way, you're getting electrolytes, you're getting fluids, and I think at the end of the day, it's a matter of actually the bottom line is getting fluids, getting electrolytes. But I think long term, if you're still having those issues, there's answers. And the first thing I like we use, and I won't go into it because that's a whole nother call, but ivermectin, colchicine, steroids, low dose naltrexone, Ubrelvy. There's so many different nattokinase, triple therapy. So there's a lot of things to talk about, a lot of things that we could call in another call. But there's an answer there for you. Don't get gaslit. Don't believe the gaslighting. That is what I always tell doctors. If you can't figure out the problem, it's not psychological. You have the problem. You can't come up with the answer. You have a problem. There's an answer to it. Keep digging for it, and there's an answer.
For now, get the acute COVID treated, and we'll take care of that.
Thank you, doctors. The preacher, can you come on and ask your question? And please take it to 30 seconds. The doctors have been extremely patient to give us extra time.
Okay. My name is Francisco. First, I would just like to thank Dr. Stella for her brilliant work in helping and informing people about this disease. I'm the son of a professor of nursing who retired from 2 Brazilian government universities, but who still does research. So I help her with the graphics and computational parts. In 2020, we were in the Amazon rainforest, and then we received the word that the airports were going to close.
We were locked in the hotel for 2 days. When I took the opportunity to study the facts I could find on the networks about the event, and I still managed to find out a lot of information for it was raised, such as the names of the research teams in Wuhan, which were erased from records, and some results by scientists who were testing ivermectin on virus strains with a positive response. Since then, we decided to use this medicine with family and friends, and we haven't lost a single relative of those who used this medicine. Therefore, today, according to our family doctors, we are discussed the case. We use it in every 15 days without ever having any problems, including with other type of viruses. We are very scared now because the new communist government that took over Brazil promised to forcibly vaccinate the population that does not want to be vaccinated. Having even forcibly vaccinated the prisoners of the invasion of the Congress, who were named as terrorists and are suffering abuses in prison. Because the current hears now that as we are conservatives and patriots informed about the new globalist agenda, we are against this vaccine. I don't know what to do to help avoid this evil with our people because side events increase every day more in the world, but they are hidden from the great media here. I call for help. No, it's only
Eu
what I can say.
preciso falar português, eu preciso você me liga. Eu
Okay,
preciso
Carolina,
falar,
I know
okay?
you. You
Stella,
were in the space from Kevin.
yes, we gave you guys the training on what to do with the false flag. But Dr. Stella, this is the group of people that I was explaining to you, that in the concentration camps that they're setting up for the people that they trapped, they're forcing them to take the vaccine. They're literally holding children down, holding people down to take this vaccine. And their concern is that now that they're under a corrupt regime of dictatorship, they're going to all be forced into the vaccination. So this is where we were asking you the question yesterday. So I just wanted to see what you have to say about this. Dr. Ursula is saying that they need support, help, and
Yeah,
guidance.
you can do a space, Carolina, so that we can come and give them hope. But I think this is, for example, if they're going to put you in a concentration camp, force you to take a vaccine, and not give you any kind of treatment, I would say it's time to turn to Jesus, because that's the only person that can help them in that situation. And he
Yes, I'm
does
going to
help.
send you the videos. I mean, all they do is pray and read the Bible. I have all the
That's
videos that I
good.
will send you.
That's amazing. And
And they're
it
still
works.
vaccinating them right now. So there's got to be something else we can do as well, additional to spiritual support.
Yeah, I'm saying that when they vaccinate them, that vaccine, Carolina, you really need to go to our website and print that prayer that we do
Okay.
for vaccine. Because
Yes, I'll translate it and send to them.
translate it and send it to them, because if they can vaccinate them and they can pray and cleanse themselves with the blood of Jesus. And when we're in stressful situations like that, you can always call on the Lord and he will help. If that's what they are doing, I'm telling you, they should stand strong. Because you know what? Like I always say, the devil can kill this body, but my soul and spirit is living there forever. And that's where we are right now.
Cause this,
Mhm.
Carolina, cause this, I give myself the nickname to preach because I'm talking about Jesus, because I know the end is near. Okay, with this events, we know that the end is near, and I will try to take this time to talk about the word and talk
Yeah,
about
we'll give
Jesus
you
and God.
the website, and then I'm going to give you the prayers as well. And it's very important, te lo voy a decir en español, es muy importante que esta información la pongas y la imprimas para que esta información se la lleves a la gente que está siendo inoculada.
You can have this conversation because we need to go. So
Okay.
Thank you, Richard. Julie?
Yes.
Yeah, no
Thank
problem.
you a lot, buddy. God bless everybody now.
Julie, are you there?
Oh, hi, I'm here. I just have a quick question. It's about treatment. Somebody mentioned the hydrogen peroxide nebulizer, and I wanted to find out what Dr. Orzo would say about that. And I also wanted to ask what probiotics he would recommend. Thank you.
So, I love the hydrogen peroxide. It can make you cough a little bit more.
So I think usually do it 1 part hydrogen peroxide, 1 part saline, 2 parts saline is what I was using. There may be others doing different formulas. I'm getting a little pushback. The other question was what was the other question? Oh, about the probiotics. I think in general, I'm the best science we have on this right now is the Bifidobacterium bifidum. Bifidobacterium bifidum needs to be in your probiotic. Someone earlier talked about prebiotics. I do think that's a good idea because it basically supports the growth of these good bacteria. But I also find that a lot of people who take prebiotics basically have a lot of GI upset too. So I think getting a good product, and the one I use, I have one and I give it to most of the patients, and I'm blanking on it right now. I got it in my head, and I have printed out in the clinic, but it's in a glass bottle in tablets, and I'm going to blank on it. I apologize. I can try to get it to Carolina, send her what it is, and she could put it out, and so people can see it. But the key component that we've seen in the patients that have been the best able to actually resist this coronavirus is the people with the most Bifidobacterium bifidum, and that's a key part of the GI system as being a healthy system right now. That's the best thing I say. If you look at kids with autism, they have a very narrow spectrum of bacteria. A lot of people who have other health issues, actually having a broad-based diet makes a difference. So if people only eat like vegetarian or vegan, they have a less diverse microbiome. So it's real important to kind of have a diverse. I apologize. I've got some other stuff going on behind me. I apologize for kind of being slow on this answer, but basically that's one of the things. The microbiome can be supported, and I think the Bifidobacterium is the most important, and a broad, diverse, whole foods, plant-based, meat-based is good too. I mean, meat is good. It's been denigrated, but it's not true. I think there's a lot of good data on that from the microbiome studies that have been done by Sabine Hazen. Thank you.
Okay, thank you. Do you also
Okay,
see
Carolina, I
patients?
think we'll take 5 more questions, and because
Yes, Rebecca, are you available? Rebecca and
Yes,
then
I am.
Julie.
Thank you. Thank you. I'm wondering what is the current treatment for COVID, because there's a lot of talk about vaccines and what you can do to, basically.
So, hey, Rebecca. So Rebecca is, so for people who don't know, Rebecca is a journalist from, I'll let you answer, Stella. Hold on. She's a journalist from Norway. She's been fighting the fight, the globalists over in Europe. She's had she's on there just basically, she even says radical things like she knows that there's a man win, and she gets chastised for saying that. Because she doesn't acknowledge that there's more than 2 sexes. So she's been a warrior over there in Europe. Stella, why don't you go ahead and say what you're doing, because I think you've been treating the most patients. I have a regimen. Let's hear what you have to say.
I was saying, Rebecca, you probably need to listen to this space, the recording of this is, because this was all about early treatment, beginning to end. It was about early treatment, really hydroxychloroquine, ivermectin, budesonide, and Z-Pak, and if they are having nausea, we give them
No, I think the question was more like, what are we doing for the Omicron that maybe we weren't doing for other stuff? I think that's really what the question is.
Actually, I'm doing the same thing. It still works. I'm doing the same thing for Omicron. In fact, one of the most difficult things to treat was the Delta. And
Yeah,
if we have
totally.
Delta, Omicron is a breeze.
Yeah, I agree.
Mm-hmm.
So I think that's basically where we are. We were using 6 and 7 different things for Delta, and now we're back. I mean, I pretty much use azithromycin, either ivermectin or hydroxychloroquine, and I use prednisone. So that's about it. It's a very simple treatment.
For me, budesonide has really, really worked because, especially when people have they are diabetics, and budesonide if I was to use 4 things, I use hydroxychloroquine, ivermectin, depending on how sick they are, and then I give them budesonide and Z-Pak. So nothing has really changed. See, coronaviruses, they're about almost 90% the same, and they get treated the same. Nothing has changed much about the way we treat them, and it still works.
Yeah, and I think Brian, same thing. Brian's using more hydroxy than he is ivermectin right now, because it's been easier to get hydroxychloroquine than ivermectin lately, and they both work. And like you said, I mean, there is some issues with prednisone. I think in general, you do have to watch. A lot of these people that are actually going to be really sick are already diabetics or insulin resistant, and so yeah, I agree with you, Stella. But I still use the prednisone. I think it's more effective, at least for what I've been seeing. And so I'm really careful about telling all the patients to, basically you can't eat carbs. Basically, if you do, you're going to end up in the hospital. I got burned once on that, and probably the last 500 or 600 patients, but basically it's worked real well. And I think, like you said, it's not a complicated thing. I think I have had a patient pass away about a month and a half ago. She was had chronic kidney disease, about to get thinking about getting dialysis, and then she called, asked for treatment. I gave her treatment. She used it for a day. Family was worried, took her to the hospital. They gave her remdesivir, and about 2 days later she had passed away. So we're still seeing patients that are with comorbidities. And now, if you want to know, the average age of death is 82. So people are still dying, but they're people with comorbidities. And so you're going to see that in respiratory disease for pretty much flu and other things, where there are deaths going on in COVID. And I think one of the things she called me, I think last week, and said people are not paying attention, that we're still having problems and people
Yeah,
are actually dying of COVID.
yeah.
So
That's why we had this space, Richard. I called Richard. I said, Richard, we have left the narrative of early treatment, and we're talking about a whole lot of stuff, and we've left the narrative of early treatment, which is what people need. Whether you're vaccinated or unvaccinated, COVID is treatable, and it's much better done like in the first 5 days. So that's why we held the space to remind people that early treatment works.
And the other thing, I think, Stella, what we're seeing is the people that are getting sick are the vaccinated. The IgG switch, the immune tolerance. We're seeing the people in the hospital are the vaccinated people. They're the ones dying at higher levels. And I just want to give a shout out to Rebecca again. Thanks so much. If you got a chance, follow Rebecca. She's been a warrior, a journalist in Europe, fighting the fight over there. They don't get as much support. They literally get potentially arrested for saying what I just said. That if she put out a quote of that there's a man and a woman, and they threaten to actually fine her and throw her in jail. So it's really different over in Europe than it is over in the United States. So Rebecca,
remember,
thank you so much.
If you're out of the country and you can't get hydroxychloroquine and ivermectin, you can use tonic water. You can use quercetin and zinc and vitamin D. These are things you can buy on Amazon. You know what I'm saying? We can ship our supplements all over the world, but we cannot ship hydroxychloroquine and ivermectin to you. So remember that these things, there are things that you can do that can help. If you're not in a position where you can go on drstellamd.com and see a doctor, or go to Dr. Oso's office and get the medicines that you need. There are things that you can do to help you come back and fight the disease better.
Yeah, thanks so much. Yeah, it's a long way from Norway to my office, but thanks so much. Bye. Stella, one other question for you. Are you seeing any issues with blood clotting at all? I just had that one patient probably in the last 4 or 5 months. Are you seeing any?
Actually, we put our sick patients on we put all of them, everybody that comes with COVID, we put them on baby aspirin. You know what I'm saying? We put them, and when they get, this is the issue, we're not able to assess the blood clotting, because if they get that sick, they always end up in the hospital, and most of the time if they came in too sick, they end up in the hospital and we're not going to see them. But when we see patients, we are aware of the fact that we're dealing with a disease that can cause clotting. So baby aspirin is part of our regimen.
Thank you, doctors. Can we go over to Julie? I think it was Julie, Linda Denkins, RL, 1TX, and Nora. And then we still have 8 after that. So please answer 30 seconds, and then I have to drop you out quickly.
My question is about the electrolytes for diabetics. What would y'all recommend for that?
I mean, we'll recommend general electrolytes. See, remember that when like Pedialyte, there are electrolytes for diabetics. There are actually electrolytes that are done for diabetics that has less sugar, and we recommend. But the issue is most people that are sick with COVID don't eat. So even if they are diabetic, they still need electrolytes. So they do have electrolytes that for diabetics that have less sugar. What we have is COVID-Lite that we put together, and just about any kind of patient can take it. And most diabetics know how to check their blood sugar to make sure that it's not going higher. What say thou, Richard?
I agree with you on that. So, totally in alignment. A lot of times, this is one of the biggest issues. So, yeah, I mean, I'm glad we keep emphasizing it.
Thank you. Linda?
Yes. Hi. Dr. Stella, I'll address it to you, but it's really for all the doctors. I'm a scholar of communication, and I've been following the COVID story for years. I'm a friend of Dr. Urso's and have been in communication with him quite a lot. My interest has been at the communication and the way in which you doctors have been censored and canceled and otherwise muted for years. And Dr. Stella, you have said you had this fear, this dread that something's coming up soon and that's going to happen to you again. And my interest is in interviewing. I'm a phenomenologist, and I want to interview as many doctors as I can who have gone through this and chronicle your experience for posterity. I want to be able to put together what is it that has been communicated to you? How have they communicated it? And get it down for posterity, for other scholars. I'd like to be able to publish it for the wider audience. And also, I think that we have to fight, as Lauren Boebert was saying, we have to be able to assert ourselves and fight against the people that would silence you and others in this fight. It's as much a communication problem as it is a medical problem, I think, perhaps more. So if you're interested, I'd love to be able to be in that fight with you and help in some way to get your stories down. So I just would be interested in that if you're interested.
Yeah, DM me and we'll see how we can get some things done. Definitely, it was a communication issue. They shut us down from telling people the truth and allowed people to die. And that is the part that is a nightmare till tomorrow. The fact that each time they said 100 people have died, 10,000 people have died, all you could say is that they didn't have to die.
That's right. Absolutely.
Thank you, Linda. Longclaw, and then Jenkins.
Hi. Many thanks and blessings to all of you for your help through this. My question is, back when there were rumors of medicine, ivermectin, hydroxychloroquine, even NAC being hard to get, I kind of stocked up on them, and I have my own traveling medicine kit. And so my question is, do I need to be concerned about any of these expiring? I know these have expiration dates, but, I don't know how accurate they are.
It's interesting. I was just going to say, Stella and I talk about this a lot. So we're big believers in having some prophylactic, some therapeutics that are available if you do get sick. So she's got some great ideas on this. We both probably would say it's a fantastic way to be prepared because you never know what's going to happen. Most medications are going to actually be quite stable past their expiration date if they're kept in, good conditions. You don't want to keep it in the car in 110 degrees in Texas. So in general, you're going to go past the expiration date. The expiration dates have really shortened since I've been in training. Used to oftentimes be 2 or 3 years down the road. I don't want to, I can't really make any recommendations for you, but in general, I often take medications past their expiration date that are kept in the proper environment in temperatures, around 70 degrees. So that's my thoughts. Stella, do you want to add anything? Because I know you've thought about this a lot.
Yeah, I said about this earlier. I said people look at expiration date, it means spoiled by. And expiration date is not spoiled by. Expiration date is, well, we can swear for the efficacy by this date. It doesn't mean that the medication stops working. So we just are a wasteful society, and I do believe that many expiration dates are put there so they can throw away and get new ones. Here's the thing. Okay, you stock ivermectin in your house and it gets crazy and CBDC is here. You can't come out of your house. You can't go out without taking the mark or something. You're going to take the ivermectin. So we are in a time right now that when it gets desperate, you would pick that piece of bread, cut off the molded part, and eat it.
Thank you, Doctor. 1TX and then Nora. And then we still have 5 other people waiting, so please drop out quickly and ask under like 30 seconds. Thank you.
Do I get a
Thank you.
chance to?
Thank you for allowing me to ask questions and getting the chance to be answered by professionals. So I'm talking from Quebec, Canada. I'm a PhD student, not non-vaccinated. It's been a struggle since like almost 92% of Quebec got one shot at least. So it's not been easy these 2 last years. My first question is, many of my relatives actually going from 40 years old to 60 years old somehow have expressed and been diagnosed with carpal tunnel syndrome or sometimes arthritis because they had like a lot of pain in their fingers, sometimes in one hand, not the other, a lot of swelling in their fingers. And I'm just wondering, is this can be caused by the eventual microthrombosis reactions induced by mRNA vaccines? My second question is, since I'm not vaccinated, but my partner is, so I'm a little bit like worried about like an eventual pregnancy. So what are the risks and the concerns that I should be aware of? Am I gonna get the spike protein through my fetus, for example? Is my baby gonna have it? Is there lesser risk since one of us is vaccinated? Is there gonna be risks during the pregnancy as if I was vaccinated myself? So those are my 2 concerns, and thank you for asking.
So I'll kind of address the second one first because shedding is a real thing. It's not a question of the amounts. So we know it's real. If you look at the Journal of Immunology, they acknowledge that circulating exosomes 4 months later, those are going to go. They could go out through many areas. So what that is, an exosome is an excess of spike protein is made inside the cell. The cell wraps it in its own lipophilic capsule and it spits it back out of the cell because there's no more room on the outside wall of the cell. Anyway, circulating exosomes are around, and also mRNA can cross across the and through mother's milk. It can cross across the placenta. So all these things are potentially there. I think in reality that if it's been a month, I would be concerned to some extent. If it's been a year, I'd be less concerned. What they found from the jabs for sperm counts, it does lower sperm counts, and it looks like it recovers over time. Nobody's done a study to see what happens when you get 4 or 5 shots. So I think I would highly encourage him not to get any more. The data is clearly is clearly horrible data. And I have lectured on this extensively, so I'm not going to go into it here. But just there's a lot of reasons why you wouldn't want to get it, including the lipid nanoparticle portion being a cellular toxin, and the mRNA component lasting for 2 months or more, making tons of protein, which would be wonderful for a genetic inborn error of metabolism, but not for a foreign protein. So the spike itself is the toxin. So in a sense, that's providing most of the damage. And yes, I think it's going to be in some ways an issue, but probably a minor issue if you're waiting long enough. I can't remember what the first part of the question was, but if you can jog my memory, I'll answer that, and Stella can answer too. So,
Yeah. About the spike protein and fertility, there actually are issues on spike protein and fertility, not just about the shedding. the space that we are in as humanity is a space that is going to bring a lot of confusion and a lot of problems. And we do know, and there have been studies and a lot of anecdotal studies from GYN doctors and stuff, that there's a lot of fetal death, there's a lot of malformations and a lot of inborn errors and stuff. So I don't know what to tell you about having a baby with a vaccinated person. I don't know. We don't know. So those are risks and benefits that we take. So we don't know. This is the world that we're in right now. And your
Thank you,
first question
doctor.
was, I can't remember your first question for real. Can you jog my memory on your first question? Oh, yeah, I remember. You were talking about hand swelling and people having all kinds of arthritis. We don't. This spike protein affects the whole body. So we don't really know the depth and the length or the amount of problems that it can cause. And of course, because this microthrombi can form anywhere, it can cause all kinds of problems. So we don't. That's what
Thank you,
So
Dr. Stella.
I'll answer it this way. There's definitely some inflammothrombotic process. There's also maybe a biomimic process where you basically can create epitopes that are on the spike that may be in part of your own body. So there's autoimmunity, and then there's pure inflammatory components where, in a sense, it gets engulfed by macrophage-like components and taken in the cells and then attacked and creating kind of like we might see in a MS type situation where oligodendrocytes are engulfing lipid nanoparticle portions of this product and then being attacked by some of the other components of the immune system and creating problems. So there's a lot of reasons that it could be multifactorial, and I'm going to say that that's part of the process we're going through. And thankfully, we have groups of people that are partnering together to do that. And I think, unfortunately, the federal government is basically spending, millions of dollars on advertising and very little money on supporting these kind of important studies. So we will keep working on it. And I think the answers are there are treatments for all this stuff. I think Stella said it real well. We don't really know what's going to happen with fertility. We do know that it's affecting fertility, period. There's 8 to 10%. I said it earlier, 8 to 10% less fertility in Europe and all the countries where they're about 75% vax. So that's what we're seeing. It's definitely affecting it, and it makes sense. It's going into the ovaries. It's going into testes. It's affecting sperm counts. We're seeing it. Our anecdotal reports coming from the OB-GYNs. Jim Thorpe has talked about it immensely, and so have others. We're seeing it in the clinics, and we're seeing it actually in data. So it's harmful, and I would be very careful about continuing on with somebody who's going to continue to get 4 and 5 and 6 vaccines. He needs to stop getting vaxxed, and that would be my recommendation.
Thank you, Doctor. 1TX, you're next.
Hey, thank you very much. Can you hear me?
Yes, we can hear you.
Thank you. I want to thank you guys for the platform and allowing just a layperson to voice their concerns and questions. I've got a couple of questions. In 2005, Michael Hollick, an endocrinologist, published a paper about the vitamin D epidemic as it relates to deficiency. And in 2016, he published another paper regarding toxicity. And I think that, one, vitamin D is not a vitamin. It's actually a hormone, and many people don't know that. And we should be treating vitamin D, or the hormone, like we do any other hormone deficiency, and we don't do that very well. Another paper was published in 2020 by Quest Diagnostics, and that paper was a retrospective study regarding the vitamin D deficiency as it relates to positivity rates. And it showed essentially that if you had a vitamin D level of 55 or greater, your positivity rate was lower for COVID-19 than it was if you had a deficiency, which was less than 20. And so my question, I guess, and I've got a couple of questions, so I'm going to end with this. What are your thoughts about the vitamin D level and as it relates to toxicity? Because myself, I take 20,000 units a day along with vitamin K because that's important, and along with magnesium because we know that magnesium is deficient as well in many cases.
What is
So
your thought?
yeah, so
Go ahead.
let's jump into that. Basically, if the normal levels are considered between 30 and 100, and 30 is basically, like I've said before, is a half a tank of gas. Every cell and every white blood cell in your body has a vitamin D receptor, and that vitamin D receptor is basically like a data analyst for your immune system. So if you want a good functioning immune system, you need to have good vitamin D levels. The toxicity issues are primarily calcium based. Take vitamin K2, make sure your calcium doesn't get too high. I think you can run your vitamin Ds up over 100 easily, and you'll be fine. Usually I recommend a level on the higher end of normal, which is 70, 80 or so. But if they're running a little higher, the key factor in the toxicity issues, it's not like vitamin A where you're going to destroy your liver. I don't think anybody has ever died in the history of mankind from vitamin D toxicity ever. Just like vitamin E, you can overdo it, but you don't get true debilitating morbidity and mortality from vitamin D. So you can jump up your calcium scores, and the way you control that, you need to take vitamin K2. If you're not doing it, then you're not being smart. So you need to supplement with vitamin K2 because it's hard to source from your food sources. It's in beef, butter, and cheese naturally in natto. So those are the thoughts, and it's been a huge part of my practice since about 1995 when I recognized its importance in cancer. So I think it's extremely important. And like he said, you can be more efficient with it. Also, a little bit of magnesium can help it too. So well thought out, well said. I'm in agreement with you. The toxicity issue is basically you can fix that with vitamin K2 if you happen to have a little bit higher calcium scores. The other thing to think of, calcium scores up, multiple myeloma. Over.
Yeah, right on target. So real quick, couple of questions as it relates to black seed oil or Nigella sativa, and then what your thoughts on polyphenols are in relation to COVID and the treatment of COVID. And finally,
so
third
polyphenols
question.
are overrated. I don't mind doing them, but I think they're overrated. Like I said, I've had a bunch of products. I usually throw them in and dust them into a lot of products because people, are really spend a lot of time thinking about like ORAC scores and stuff like that. I don't think it makes a difference. I think there's a sort of hormesis effect. I don't know if you've read about hormesis. Maybe spend a little time looking at that topic. So basically, what was the other question?
So, well, I hadn't got to it, but, I've been in the medical field for nearly 40 years, and I've only seen a few cases of pancreatic cancer. And it seems like here in the last 7 or 8 months, from my perspective, I can count on both hands and both feet more than 20 cases of pancreatic cancer, including a personal family member. And I mentioned that I was in a Bible study and somebody prayed for somebody with pancreatic cancer, and then people started talking about it. And it seems like that is becoming a more and more relevant issue as it relates to some of the cancers. And I'm just kind of curious what your take on that is.
Well, the spike
Cancers
protein
are all off.
disturbs DNA damage repair in a big way. So Stella, go ahead, take it away, and then
Yeah, I'm
I'll
saying
follow you
that
up.
cancers are all, cancers are up, not just pancreatic cancers. Even people that have been in remission for years, they are getting aggressive. They are coming back and they are coming back aggressive because, like I said, this spike protein disease, that the spike protein has been injected in people is actually messing up people's immune system. And usually it's your immunity that fights all these little tumor cells that start in your body all over the place. So yes, that's something that we all are seeing, and cancers are up, but not just pancreatic cancers, all kinds of cancers. Even people that
Yeah,
have remissions, they
I
are coming.
agree with you, Stella. There, I do agree with this. So I have an oncology practice, and we're seeing a lot of recurrences, turbo cancers. In general, I've been using some drugs that historically, I was chief at one of probably the top a cancer hospital in the world. So basically, I would tell you this: we are seeing a huge recurrence of cancers, and there's recognition of the fact that the DNA damage repair mechanisms are being interfered with by the S1 portion of the spike protein. So this is not a make-believe thing. They actually had to retract one of the studies. It put so much pressure on the authors, but a couple other people redid the data, and so it's not an opinion that it's affecting DNA damage repair. That's part of the wonder of the spike protein. The first coronavirus to ever affect DNA damage repair, the first spike protein ever affect tumor immune viral surveillance through toll-like receptors. The first one I said have an NRP1, the first one to have a TMP-RSS2 to get in the deeper lungs. The first one to have a GP120 fragment. The first one to have, its most wonderful ACE2 receptor. So I probably left some stuff out. So in general, tumors are on the uprise. There's mechanistic reasons we're seeing it. They're basically, it's hard to get the data, so we need big places where the tumors are being treated at these big cancer hospitals. But they're not putting that data out there. They are flooded with more tumors, more cancers, more recurrences. And what I'm seeing is, I just had a patient come in, triple vax. He sent me a nice note today. I wish I could read it, but I'm going to read. I'm going to read because it's buried in my text. Dr. Urso, thank you so much for all your help. I had fourth stage melanoma all over my body. And since we started treatment, and just for this fellow, I'd given fenbendazole, low-dose naltrexone, high-dose vitamin D, and fenofibrate, because fenofibrate is good against neural ectodermal tumors. And he said, I got my PET scan back today, and I got my all my tests back today, and there's no tumor in my body. Thanks for all your prayers, and thanks for all your help. So you can overcome a lot of these things. There's strategies that we don't even talk about. The fenbendazole, mebendazole, the ivermectin, hydroxychloroquine. A lot of these things have anti-tumor properties, autophagy effects. They are things that are, this is the other thing that I've been holding under the radar. And it's time to just let it out. We've got things that are incredibly effective against a lot of these solid tumors, and it's time for let that loose. But that's for another talk.
Yeah, I think it's 1 a.m. in my time, and I know everybody has many, many questions, but I don't think we're going to get off this. And I'm sure, Richard, you have to do surgery at 5 a.m., right?
Oh, yeah. But I'm
Yeah.
ready. We'll keep going. If you want to keep going, keep going. We stay up all night. Stella and I are not early birds. We keep going.
All right.
Can
So
I just jump in real quick with something?
And
please?
the other thing about Stella is she told me she sleeps fast, so I guess that she doesn't need that much sleep.
She's lucky.
No, it's not about sleep. It's not about sleep. I pray at night, so I need to get on my prayer.
Yes, she's an hour past her prayer time.
So
we won't
that's
get
beautiful.
to all the questions.
So let's do one more question, and then Stella, send us off with a prayer.
Yes, and then we can set up this space again, and like I said, we'll be back to do a lot more talking. But I'm like 1 hour past my prayer time, so I've been doing that for years. Anyway, go ahead.
Dr. Urso, this is Ron Reese. I've done a lot of research on the zinc and hydroxychloroquine and the Zelenko protocol.
Can you guys hear me or hear him?
I can hear you, but not him.
Okay, I think
he disappeared.
Oh, yeah. Okay.
Can I jump?
Okay, one more question. And then we...
Dr. Stella, how do you feel about the ivermectin paste? Because in New Jersey, we couldn't really get ivermectin at all, in the beginning, especially the last 2 years. And I had a lot of friends that were taking the ivermectin
Hey, got kicked
paste.
off.
Hi, yes. Can anybody hear me now?
Yes. Okay, we can hear you.
Great. I'm sorry about that.
Let me answer this question.
Sure, please.
Hold on, Reese. I don't have any feelings on ivermectin paste, and the reason is that I don't want to be quoted like, "Oh, she gave people horse medicine," when I can actually just prescribe regular ivermectin to you. So I deliberately did not look at the ivermectin paste to see what dosage we need to use or whatever. I just did not want to know it because I didn't want to have to give anybody advice on it. So, Reese, yeah.
Okay, the last question, super briefly.
Yeah, I want to bring some clarity to some of the issues here. I've done a lot of research on this.
Do you have a question?
Yeah, it is a question, but it's also, do we understand that zinc is the primary antiviral in the Zelenko protocol?
Yeah, we talked about that.
Yeah,
we talked about that. That's what we
hydroxychloroquine is important, but there are other ionophores. If we understand the mechanism...
Oh
I'm
So
yeah,
just
Ron.
referencing.
What
so
happened is they
Can we
covered this.
discuss
They
the
covered this.
mechanism, how it works?
They already did, Ron. Yes,
yeah,
they did.
Ron. And the other
Ron, the
thing,
whole
Ron,
thing was
which
about hydroxychloroquine, the ionophos, the quercetins. We covered all that. Maybe you
Yeah,
want.
we'll put the
That's all we
playback.
did today. Yes, you
Yeah.
can go play back. This was about early treatment and the hydroxychloroquine, the mechanism of action, ionophos, quercetin, and all that good stuff. We
Yeah.
covered all that.
and don't forget hydroxychloroquine. A big part of its effects are an
And
endosomal
inflammatory.
acidification. And I
yes.
don't want to go too much into it because it's a big thing, but it's not just about zinc, ionophores, and RDRP. It's
But do we
also
know?
endosomal. It's also about endosomal acidification. It's also about affecting the Golgi apparatus, the
Mhm.
ribosomes. It's a lot more than just zinc. Okay, so
It's more than
I
that.
don't mind going there, but it don't talk about stuff when you don't know what you're talking about. So it's not only about zinc. Okay, so I'm not trying to be rude, but it's
Yeah,
not only about zinc.
yeah. Zinc and quercetin and everything works, but hydroxychloroquine and ivermectin has about almost 20 different ways that it works. So yeah, we covered all that in the beginning. So thank you guys very much for joining this space. We're going to be putting 2 more spaces. Follow me so that whenever the space come up, you can join. We're going to be putting together a space on vaccine injury, and we're going to be putting together a space to discuss the spiritual implication or where we are in the spiritual space and all the stuff that's been done by the World Economic Forum and what we need to do about that. So thank everybody for coming. And like I say, it's past my prayer time. And I know Doctor also has to be up in the morning. And we are so thankful for all of you. And you can share. This space was recorded, so please share widely as possible. Follow us, and when we come up again, we will probably start a little. I didn't know it was going to take this long. We're going to start a little earlier so that we can have way more time. God bless every single one of you. And let me just pray, if you guys will let me. Father, I pray for everybody that's listening to this space. I pray that whatever has happened to us as humanity, that God, you will take sovereignty and help us, that you will show us mercy. The enemy is too strong for us. We are standing in a position where we don't know why some of the things have happened to us as humanity. And we just pray and ask for your sovereign help, Lord Jesus, and ask that you open the minds of people to know where we are spiritually and also know that you are the healer. We doctors, we do our thing, but you are the healer. So I thank you for everybody that has come. For those that have taken the vaccine, we pray for their healing. For those that have long symptoms, so cancer, whatever, Father, we pray that you will just touch people, heal them. Most of all, we rebuke the spirit of fear that has been released over humanity. And I pray that our hearts will be at peace and will rise up and stand in one voice and not be divided. Thank you, Lord Jesus, in Jesus' name. Amen.
Thank you. Amen. Dr. Stella, and
Amen.
I tell everyone in the audience to
Amen, doctor. Thank you.
send a DM, and I will log everybody's name that did not get to answer a question. The doctors know that I micromanage, so you please get on next time you see Dr. Stella Immanuel live on here and join right away and send a request. I will go over your name and I will give you priority in the order in which it was received. Thank you, guys.
Amen. God bless everyone.
God bless you.